5, December 8th, 2020. I'm going to call the meeting to order. And
he's frozen. Chair Hashchak, are you? Well, it looks as though his computer has frozen, so let me go ahead and begin to call roll of the other supervisors in hopes that he'll reconnect soon. Supervisor Williams?
Here.
Supervisor Jurdy?
Here.
Supervisor McCowan?
Here.
Supervisor Brown?
Here.
Chair Hashchak will be rejoining us shortly.
Perhaps we could go forward with Vice Chair Jurdy leading us in the Pledge of Allegiance.
let's see. Hello. Can you hear me?
Yes, I can, Chair Hashchak. I can hear you. Thank you. No, I cannot. So maybe Supervisor Brown's suggestion was best. Can you hear me, Chair Hashchak?
Yeah, I can hear you.
Okay, I can hear you again.
Okay. How's that?
That's great. So you are present and we can start the pledge whenever you're ready.
Okay, so Supervisor Williams, could you lead us in the pledge?
Sure, I'd love to. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. So, in order to speak via telecomment, one must submit a speaker form online. We took away the time restriction of 8 o'clock. So if there's an item that you want to speak to, you can submit the speaker form online, and then you will be called on. Hopefully that this is a new way of doing it to try to get more public expression, and we'll see how it goes. Okay. So the link to the telecomment request forms can be found on both the first and last pages of the meeting agenda and on the Board of Supervisors website on agenda and minutes and public engagement. If you have submitted a telecomment,
Chair Hashchak, I would suggest calling in on your telephone, and in the meantime, Vice Chair Jurdy, if you would like to take over the lead of the meeting.
Okay. So as Chair Hashchak was just saying, the next thing on our agenda is public expression on non-agenda items. And if members of the public would like to comment on items not on today's agenda, please do so now. Do we have any speakers who are raising their hands or requesting to speak?
Yes, we have Thomas Chandler on the line. Mr. Chandler, you are live. You can speak whenever you're ready.
Hi, can you hear me?
Yes.
Hi. Yeah, so I would like to talk about the Great Plates program, which hopefully the supervisors are familiar with. Yeah, I'm really calling in because especially with this latest expected round of COVID shutdowns, a lot of people in the restaurant industry are going to be heavily impacted by further shutdowns. I am in that industry, and a number of my friends are going through financial hardships. because of COVID and the shutdowns. And I really think that an expansion of the Great Plates program would stand to benefit both those individuals and then the senior community that the program was in part designed to protect. I threw together a calculator for calculating, how many people in the county likely qualify for the program, and how that translates into federal, state, and county expenditures for the program. I don't think there's a screen share option, so I can't show you, this thing right now. But the long and short of it is that for every dollar that the county puts into this program or is able to put into this program, we get about $25 back from state and federal organizations, and that goes directly into the hands of restaurateurs that are hard hit by the financial impact of COVID. So really what I would like to see is a more organized outreach program for recruiting our senior population. We have about 20,000 seniors who are likely to qualify for the program in the county, and we have less than 250 of those seniors currently signed up for the program. I have a bunch of ideas for how the outreach would look. Yeah, but at the end of the day, it's, over the course of 90 days, if we got 1,000 participants, it would bring in over $5 million from the state and the federal, from FEMA into our county. Yeah, so all of the, the outreach programs that, I can think of are either going to take a fair bit of time or a little bit of money. Throwing together a phone bank, the data would cost somewhere around $1,500 for a phone bank that is both sorted by demographics and geographic region. In addition to that, we can do grassroots campaigns just to get the word out there. And I've got a bunch of ideas for that. So I guess what I'm asking for is a little bit more.
So Mr. Chandler, your time's up, but I would urge you to send an email to the board members and we can put you in contact with the correct people at Health and Human Services who are running the program. And I know that the county has been looking at getting additional restaurants in the program, but the notices that the county receives about how much longer the program will run have been somewhat sporadic, usually given 10 days notice that there's an additional 30 days of the program. So that's been one of the issues with the program, but it's been a great program overall for the seniors. Do we have any other callers?
Okay, I'm just checking in. Can you hear me?
Yes, we can.
Yes.
Okay, great. Okay, is Anna Stockel on the line?
We don't have any other people on the line for public expression at this time.
Okay. Okay, I just wanted to announce that item 8A will be heard at the same time as a COVID update. Okay, 8A is an off agenda item. Okay, and so moving on to consent calendar. Okay, are there any items to be pulled?
Chair Heshek, I'd request that we pull 4O for discussion.
Okay, and I'd like to pull 4D for comment. Any others? Okay, hearing none. Let's deal with, I'll deal with 4D right now. And 4D is a proclamation recognizing the retirement of Tammy Moss Chandler as the Director of Health and Human Services Agency. And just, there was a very nice proclamation that goes along with this. And there was a very meaningful, impactful retirement party the other night. And I'd just like to say that on behalf of the board, that we greatly appreciate Ms. Moss Chandler's tireless efforts, her passion towards helping people, and her vision and guidance throughout this pandemic that she's been leading Health and Human Services. So very important work. And thank you, Ms. Moss Chandler. Okay, Supervisor Jurdy.
Thank you.
4-0.
So 4.0 is a contract for $650,000 for 3 years of planning services. That works out to about, when you look at the fact that a county employee has about 70 cents in benefits for every dollar in salary, we could hire a county employee for $127,000 salary for 3 years for the same amount of money. And I just think that this contract is an awful lot of money. By point of comparison, $127,000 is about 45% more than the county pays its chief planner. It's about 75% more than it pays one of its senior planners. And it's about double what it pays an engineer in the Department of Transportation. So I think that it's an awful lot of money. I realize there may be some special circumstances right now, but I think it should be restructured. I talked to the CEO about this as a 1-year contract with 2 1-year extensions. I think that the Department of Planning and Building merits a reevaluation of its structure, maybe paying some people a little bit more so we can get more out of it. But I don't think that this contract is in the long-term interest of the department. So I would prefer a 1-year contract with 2 1-year extensions as an option.
All right, is there a second to that?
I would support Supervisor Jurdy on that, but I guess I'd like to hear a response from staff before we vote.
Is there a comment from the CEO?
Yes, Chair Hashjack, CEO Angelo. I have no issue with Supervisor Jurdy's suggestion to make this a 1-year contract with 2 1-year renewals. I think that is a good suggestion. We are looking, as this board knows, that we are looking at the Planning and Building Department right now, particularly with the Planning and Building Director, Brent Schultz, giving notice and relocating out of state. So I think doing a 1-year with renewal would be good. I would also like to say that Supervisor Jurdy and I have had discussions about this, and with this contract, a portion of this contract is paid for with disaster dollars because a portion of this work is with disaster recovery. So it is about 50-50, but again, there is no objection from staff on changing the terms of this contract. Thank you.
Mr. Chair?
Okay. Yes, Supervisor McCowan.
So one other item that I'd like to ask about regarding item 4C, which is approval of the budget resolution. When we considered the first quarter budget report and gave direction, there were 3 items raised by Supervisor Williams. One of them was to look at possibly augmenting salaries in the planning department to better enable us to hire and retain planners. And I just wondered if we could get a report on what the response was to those 3 items raised by Supervisor Williams that the board had directed county staff to look into and possibly incorporate some changes into the budget approval. Thank you.
CEO Angelo, do you have any comment on that?
Chair Hashjack, I guess did we finalize the item that Supervisor Jurdy had? I was responding to Supervisor Jurdy's item, and the item that Supervisor McCowan brought up was a different item. So,
okay.
I'll leave it at that, and please, if I can get an answer to my question, thank you.
Okay.
Well,
so,
no, we didn't finalize Supervisor Jurdy's item, but since there's agreement on how to deal with it, that could be folded into the overall motion for consent calendar, and we don't yet have a motion. Before we get one, I wanted to ask about 4C.
Well, let's deal with Supervisor Jurdy's, okay? And I think that's a standalone. So, Supervisor Jurdy, did you have a motion? Was that a motion you made? It sounded like it.
If needed, I'll make a separate motion for 4.0 to approve it as a, modified as a 1-year contract with the option for 2 1-year extensions.
Second.
Okay. Any further discussion on this? Okay, Deputy Clerk, could you do a roll call vote on item 4.0?
Absolutely. Supervisor Jurdy?
Yes.
Chair Haschak?
Yes.
Supervisor Williams?
Yes.
Supervisor Brown?
Yes,
And Supervisor McCowan?
Yes.
The
but I
motion
would
carri-
like to ask a question, if I may, Mr. Chair.
Yes. Supervisor Brown.
Did we have public comment on that item?
Oh, we didn't. Okay. So let's go back to see if there's public comment. Is there any public comment?
No, there's no public comment for this item.
Okay, thank you, Supervisor Brown. So should we redo the vote or can we go on? County Council?
Mr. Chair, I believe you can proceed. If I understood correctly, the motion carried. I defer to the clerk of the board on that.
Yes, this is Deputy Clerk Lindsay Doherty, and the motion carries unanimously.
Okay. Okay, Supervisor McCowan, did you want to pull item 4C?
Well, we don't necessarily need to pull it. I just am curious, what is the update on the 3 items raised by Supervisor Williams that the board gave direction on?
Okay, is there an update on that, CEO Angelo?
Thank you, Chair Haschak. I personally do not have an update on that today. And I don't know if Deputy CEO Darcy Antill is on and if she has anything to add, but we certainly can give this board an update at the next meeting. Thank you.
Okay, so is there we still have all the other items besides 4.0. So is there any public comment on those items?
There are no public comment for consent calendar.
Okay, so going back to the board for all the items except for 4.0 on the consent.
I move approval of the consent calendar, all items except 4.0.
Okay, is there a second?
I'll second, Mr. Chair.
Okay, seconded by Supervisor Brown. All right. Further comment? Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Brown?
Yes,
Supervisor McCowan?
Yes.
Supervisor Williams?
Yes.
Chair Haschak?
Yes.
And Supervisor Jurdy?
Yes.
The motion carries unanimously.
Okay, thank you. So moving on to agenda item number 5A, which is discussion and possible act. Oh, no, we're going to move to item 5B. Sorry about that. Which is discussion and possible action, including an update associated with the novel coronavirus, COVID-19, and provide possible direction regarding essential services in Mendocino County, operational preparation and response, and associated countywide economic impacts. So the sponsor is the Executive Office. I'm going to turn to the CEO.
Thank you, Chair Haschak. We do have an update to give you from Dr. Corin. We also have Dr. Doohan on, and I have some items that have to do with county staff. However, today we have representatives from Adventist Health with us who will give us an update on the local hospitalization capacity. So at this time, I would like to turn to Jason Wells to begin the Adventist update, and I believe he has a full team with him today. So, Mr. Wells?
Hello, CEO Angelo. Can you hear me okay?
Yes.
Yes, go ahead.
Perfect.
Good morning.
Hey, good morning, team. Thank you. I'm Jason Wells, serve as the president of our 3 hospitals in Mendocino County. We've got our executive team on today, and so we're eager to take questions as you have once we're kind of done with a short presentation of how we're doing. We've got a number of physician leaders from across our hospitals, as well as clinic leaders and certainly our executive team on with us today. So thank you for your support through this. Incredibly proud of our frontline caregivers, not just with Adventist Health, but with all across the county, serving in county roles, serving in clinics. It has been an incredible effort these past 9 months, and very, very proud. We've lost over 1,700 caregivers across America through this pandemic, and just really proud of the frontline who comes to work each and every day and puts themselves in harm's way for the sake of the community. So thank you for your support of them, and really your efforts on getting the community to wear masks is the #1 thing that we can do. We're much stronger together. As you know, the Coast Hospital came on with us in June and July, really July 1 of 2020, and feel very good about the work there. All 3 hospitals are coordinating. We have 100 beds across the county. ICU beds, we have 16. And you know, recently the ICU bed count and percentages has become quite a big deal. And so 16 is the number we've had. It's the number we continue to have. We've been floating right around the last week, right around a 60% occupancy, typically having about 7 to 8 patients, depending on the day in ICU. It goes up and down with that. Today in the hospital, across our 3 campuses, we have 7 COVID positive patients. 6 of those are at Adventist Health Ukiah Valley, and 1 of those is over on the coast at Adventist Health Mendocino Coast. Our highest census through this pandemic was 17 inpatients. That was a couple months ago. Of course, we had the Sherwood Oaks outbreak, and the team stepped up on the coast, brought those COVID positive patients into the hospital and saved every single one of them. It was an amazing, amazing story, and Dr. William Miller and the team there could not be more proud of their efforts. So 7 COVID positive patients today. We have had CDPH come through in the spring and look at our surge plan with us, help us modify it. We've worked with Dr. Duhan over time. We've talked with Dr. Corin this past week, presented our surge plan to him. He recommended some great modifications and changes. So we've appreciated the partnership from the county. We feel very supportive through this pandemic. And I'm gonna turn it over to our Chief Nursing Officer, Linda Gibbons, and she'll take you through a little more details of the surge plan, and then toss it to Dr. Passant Parker, our Chief Medical Officer. And then we'll certainly be available for questions as you've got the whole executive team here. Linda.
Oh, thank you, Jason. I wanted to talk about our surge plan today. You know, different triggers deploy our surge plan. One of the first items we do is we discharge all patients that are ready. And then we have ICU nurses and ER nurses that are doing more administrative type work, and we redeploy those to their frontline critical areas. In September, we welcome back students in the different clinical areas, and many of them can function as students. We actually have that in several of our other affiliated hospitals in which we've been allowed to do that. And we have students from many different disciplines. We built our surge plan back in March, as Jason alluded to, and we trained to that surge plan. We spent significant resources during the first shutdown of the OR, cross-training our staff and setting up expectations so they're able to care for those COVID patients if we do have to cancel elective surgeries. We will expect patients to be in our PACU departments, and we will have staff to care for them. This includes both staff beds in both ICU and regular hospitalizations, as many of our recovery room nurses have the same skills as a critical care nurse. And then all 3 hospitals have recovery room staff, because in the end, it is truly our staff that is our most precious resource. And so this is how we plan on being able to meet that increased demand. Thank you. And with that, I'm going to pass that on to Dr. Parker.
Hello.
Hello.
Yeah, can you hear me?
Yes.
Thank you, Linda and Jason. At this point, I would ask if board has any questions for us. Otherwise, I can dive into a few details as needed.
Dr. Park, I'll add as they think of any questions. One thing I should have shared is being a part of a 23 hospital system, we've seen pretty much every phase of this at one of our campuses. Glendale has borne quite a bit of the brunt of it. Hanford in Central California, right out over Yuba City, Marysville, those three campuses have probably seen more COVID. We've had over 150 patients we've cared for in Mendocino County, but the system has cared for thousands. And we've had the National Guard come in to some of our hospitals. We've had the Department of Defense bring a team in to support. So we're well connected to the national partners on bringing staff. We've not needed that, thankfully, in Mendocino County. We have borne the brunt of it, but I feel like early on, I felt like we've had the support. We've had 1,000 ventilators at our disposal, even though we probably only have 45 to 60, depending if we take the ones out of the operating rooms. So it's nice to be supported. We have the PPE we need. That was scary at the beginning of this, but we've never had to have our nurses or caregivers wear trash bags or some of the things that you saw online. We have been able to resource and move things around in the system to make sure that no one went without. And so very much appreciate that partnership, and it does give us a level of comfort. We've got a 24/7 incident command that is open in Roseville around the clock. They're looking at the COVID numbers on every single campus, in the clinics and the hospitals, in the emergency departments, partnering with CDPH and making sure that all the resources are being deployed where they need. And again, Mendocino County is probably one of the top performing on a COVID standpoint in the system. We're very blessed to live in the region that we do.
Chair Haschak.
Yeah, Supervisor Williams.
Yeah, I have a few questions. I think the public now has its eyes on ICU bed capacity. The state is using that as a metric, and I understand why. It makes a lot of sense. It's tangible. Is it possible for Adventists to publish the daily numbers, perhaps a chart? I know you report these to the state, but it's difficult for the public to access and visualize the trend.
Absolutely. What's your recommendation?
Well, if you're able to publish it directly and just have the county reference, an Adventist health URL, that might be the best. But otherwise, maybe provide the raw data and the county could chart it as part of the dashboard. But I think it would be beneficial to the public if we could see the daily trend for the three facilities and overall. And then the next question. When you talk about surge capacity, how much can you scale up with the available staffing, equipment, and facilities to provide equal outcomes as the 16 ICU beds would provide today?
Well said. Linda, I'll let you Dr. Parker, take that.
Let me start, Linda. I think we currently have a 100-bed network of 3 hospitals in Mendocino County. We are able to, with our surge plan, go up 70%. Now, we could even go up some more with the hospital at home, which is acute care at home for lower acuity diseases. Now, staffing usually comes up, but we are able to redeploy staff from the OR if need be, who are already cross-trained to scale up our staffing to be able to handle the bed capacity that we're able to create. So that's, in practicality, what we are able to do. I should mention also that beginning with the pandemic, we opened up a unit that we are using as COVID unit in Ukiah. We initially started with 6 units. That's the old ICU in the Ukiah hospital. We have scaled that up currently to 11. So that's a significant scaling. And we are able to staff that currently. So that's in addition to our ICU. Now, these rooms are negative pressure rooms that allow for air to be taken out and to be able to care for the patient in a very optimal way. So that's what we've done thus far.
And also, like I mentioned before, the recovery rooms, they can become ICUs. They have the equipment and they have staff that's trained to that level. I know that was your question about staffing trained to that level. So that would increase capacity by quite a bit.
Yeah, so that answer is helpful. Could you distill it down to a number? Because I think the public is, through me, wants to know. Is the count 16 or is the count 16 plus some amount for
I think in a surge, it's definitely 16 plus. But you know, Supervisor Williams, why I'm so reluctant is because a lot of this is all dependent upon staff, right? And staff get sick. So what I have today might not have, you know, during the surge. We you know, so I say that with a caveat that, you know, staff are all healthy. So it's 16 plus because obviously we could turn the old ICU back into an ICU. We could use recovery room beds if we canceled elective surgery again, and they could function as critical care beds.
Yeah. So we spent the last 9 months cross-training staff. So our OR have been trained. I mean, there are RNs, but they can now take care of COVID patients. So we're ready to go. And again, with the system supporting us, if we had the need to go to our 70% surge plan and go to 170 beds by using all of our PACU, our pre and post-operating areas for those that have gone through a surgery experience, all of those rooms are sitting and waiting. We've got 28 negative pressure rooms. We're, of course, only using 7 of those today. And so we've got strong capacity, and I know the system will support us. We would tap into the same state and national resources if we needed to go to that 100 and 170. 10% of our workforce today is out on medical leave of absence. That is not all COVID related. That is simply all across the board of some people have chosen to go on leave during the pandemic because of the age that they're in, and we fully support that. And so that's a big number. So could we ourselves get to 170 beds? No, we would need system resources, and I'm confident they would come.
Mm-hmm.
When you say 16 plus, what would the total be? And I because this is really what the public is wanting to know, how, you know, with available staffing and based on what's happened in your facilities elsewhere, what do you think the reasonable maximum would be with ICU care, equipment, facility, staffing?
We have ventilators to take us above 45. And so using all of those spaces, you know, 16 plus taking us to 45.
And that's with staffing? We could go to 45 based on current?
We would make sure we have the qualified staff to do it. Some of them may come from, you know, one of our other hospitals, but if we needed to go there, we absolutely could do 45.
I appreciate that. And then last question, are you content with the public's response, precautions being taken and current trend, or do you feel that we need to do more?
I appreciate that Mendocino County continues to lead the state in so many of the metrics that we're watching. We appreciate that. Being on the front line of this, our teams each and every day are putting themselves in harm's way. So when people will wear their masks, when people will physically distance, that is so critical to fighting this pandemic. And so we also feel for the small business owners. This has been tough on our local economy. And so finding that balance to flatten the curve, we did an incredible job flattening the curve. Mendocino County, more so than most, bought us the time we needed to figure this out, to get ahead of it. Our clinical teams are excellent at caring. We've learned a lot as a health system, but we are pleased when we see people taking masking seriously. And, you know, it's heartbreaking to see some of the stuff you see online about this is a fake and this is a hoax. You know, I can point people to 1,700 caregivers that have lost their lives in COVID.
Please thank your team for caring for us. I have no further questions.
Chair Housecheck.
Yeah, Supervisor McCowan.
Thank you. And thank you, Jason Wells, and for your entire team at Adventist Health. I really think you've all gone above and beyond to serve the community. And as you point out, it's not without considerable risk. People can take all the precautions in the world. You're still working in an environment where where personnel are going to be at risk. Things happen. You know, you can't control every last situation. And it's not only the personal risk that someone may become ill, but I think it's the impact of caring for people, and then inevitably we lose some. And I just think it has to be a tremendously stressful environment for many of your staff. And I do hear some comments that people are being called upon to work long hours, particularly the more expertise someone has, the more in demand they are. And I want to pause for a second and say it appears that your staff have become very skilled at treating COVID patients, because for those who wind up having to go to the hospital, it appears that a very small percentage of those, much less than anticipated by all the modeling, wind up in the ICU. And then most of those who do wind up in the ICU recover. So it just seems to me you have some very skilled people doing a great job, but what is the impact this far into it of the potential for COVID fatigue or burnout on your staff? And how are you guarding against that?
I appreciate that, Chairman Hatchek. So that is absolutely a reality that we're facing, especially going to the holidays. People have been separated from family. 9 months is a long run, and there are so many stories online of caregivers pouring their hearts out, whether it's CNN or the news sources. You know, when you come to work and you're in the business of saving lives, and thankfully Mendocino County, our numbers are nothing like numbers in other places, but it's heartbreaking, the stories that are out there of people that are trained to save life and the situations they've been put in. We never want to see that in Mendocino County. And I feel that our state has gotten ahead of this better than other states in our county. The partnership with the county support, I feel they genuinely care for our staff, genuinely concerned, partnering with us as we do contract tracing and getting ahead of situations. There has been exceptional collaboration. So we feel that support. We don't feel like we're in it alone. That's been helpful. These type of conversations, I've had it with many of you individually, and that's helpful, just to know that people appreciate what everyone's doing. But to be honest, people are tired. 1,300 team members on the front line of this, and it's not just the nurses and the techs. I mean, it's the housekeepers, it's our greeters, it's our security guards, it's our physicians. It's tough to come to work each and every day and know that there's no one to backfill your position. And so then there's that extra burden when people need to go out for either personal reasons or whatever. They know they're putting an additional burden on their team. So we're thin, and we're doing everything we can to recruit nurses. I also have the responsibility for our hospital at home program, and we're rolling that out across the state. And of course, you've seen the CMS waivers endorsing that and urging health systems, frankly, to move into the home space. And so we can't get the nurses we need for all the demand. Hospital systems are reaching out, begging for support, but nurses are in such short supply now. Respiratory therapists are in short supply. So I'm so thankful for the people that we have, that we've resourced, and we want to hang on to every single one. But thank you for your concern.
Thank you. And so then this kind of ties back into the questions that Supervisor Williams was asking about capacity. So we do have an excellent surge plan, and you know, I appreciate all the comments regarding it and the cross training, but and if I understood correctly, currently you could have 100 beds open, you could surge to 170, you know, total beds, 16 ICU beds. If I understand correctly, potentially that could surge to 45. Is that correct?
Correct.
We took every piece of equipment and pulled in additional resources, which we would. If we had that need, I'm fully confident that need would be met. It's been met in every Adventist Health hospital, sometimes by other Adventist Health staff, other times by whether it's Department of Defense or National Guard. It's been called in multiple times in other locations. So
the National Guard staff would have sufficient training to be able to.
They have served with distinction. They are an incredible group who have served in multiple hotspots, if you will. And if we ever got in the unfortunate them to come to Mendocino County, they would be incredibly well trained before they got here.
Well, that's certainly good news. And I would like to ask, based on current personnel, and obviously you've got a lot of very qualified people. You've pointed out, you know, the current recovery room staff, they have very translatable skills. So based on current resources, current staff resources within Mendocino County, how high could you staff up in terms of ICU beds?
45.
45 would be pulling pretty much every cross-trained individual. Of course, we had 17 inpatients at our height. They were not ICU. Only a small handful of those were ICU. So Linda and Basant, you'll have to help me.
Yeah, we could do 45. Remember that all of our recovery rooms, right, would be opened up and could be critical care models, right? We would pull back all the staff that, we have many staff doing administrative tasks that have those skills of ICU and ER nurses, and those would all be called in. 45 would really stretch us, you know, nobody'd have to call in sick, but we could do it. You know, I went back to the National Guard question. Rideout just recently is deploying the National Guard, and there's a whole process of how they come in. And they get orientation, much like we do travelers, which are very common in our industry. So there's a whole process of how they integrate into our system. It's really quite phenomenal. So we're lucky to be able to affiliate with Rideout and to get a lot of their lessons learned, as you will. We try to always deploy that. A little back to our staffing. Somebody had a question about burnout. We do have counselors. We have spiritual support. We recognize that this is really hard on people, and we have really worked hard with our staff. We have what we call Zen dens. I don't know if you've seen those on popular media, but every single hospital has one. It's a quiet spot for our staff just to recharge after a really hard day. So those are some of the things that we've deployed for our staff.
Thank you. And then one more question that, as we all know, the state is now looking at ICU capacity, and when that capacity falls to 15% of the availability of ICU beds region-wide, then it triggers additional restrictions. And how quickly, I mean, are you working on a regional basis with other hospitals to review ICU bed availability across the region and potentially report to the state, we absolutely can staff beds? Because it certainly sounds like we have a lot of capacity in Mendocino County. So, and yet the hospital doesn't want to staff beds if you're not going to have patients. But if we hit the 15%, then I think you're probably in a position of turning away elective surgeries. And so it's a complex equation. Can you enlighten me any on how we would work to avoid hitting the 15% trigger?
Yeah, so great question. And we're licensed for 16 ICU beds. And so in an absolute crisis, we obviously can go beyond the 16, and we have the surge plans in place that have been certified by CDPH to allow us to do that should that trigger come. And again, I think the most we've ever had may have been 5 COVID patients in our ICU at one time through this. And so again, 17 in the hospital, 5 specifically in that ICU space. So we are tracking that number daily. We realize how important that is to the community. We only want to have ICU patients that absolutely have to be in the ICU and can't be cared appropriately for on the med-surg floor. Today, we have only 1 COVID ICU patient, but I think we have 5 or 6 others that, you know, life goes on and people continue to have other issues outside of COVID. And we typically run in Mendocino County this time of year a census around 80 to 85. Typically, today it's 72. So we're actually lower than we usually are, but this is the flu season. And typically we're right at about 80% capacity of our 100 beds across our system, across the 3 hospitals. So to your specific question, we have not reached out to other other hospitals in our pod that's been created. We're certainly reaching out of the 3, making sure every ICU patient is appropriate. I'm not aware of a single ICU patient being transferred to us from one of those other named hospitals. Doesn't mean it's other. Dr. JJ Allende is on. JJ, he leads our hospitals program at Ukiah, where we've cared for by far the majority of COVID. Anything you would add to that on the 15% and any collaboration you've done with any of your partners or accepting patients that you've done, ICU related?
We haven't, I don't think we've received anyone in transfer for any of the outside hospitals aside from Mendocino County. And as far as COVID patients, we haven't had any transfers within our 3 hospitals for management. Not that that may not occur.
You know, we have 16
well,
beds. Sorry.
If I may, we were told a few days ago, I believe, that we had 4 COVID patients in ICU in Mendocino County, and that 3 of them were out-of-county patients.
We have
so there seems to be a little discrepancy here, possibly.
We have 2 patients in Ukiah ICU that have COVID that are in the ICU right now.
And without, violating HIPAA, JJ, can you? Are they out of county? Is there anything that?
Yeah, but they presented to our ER.
They're from county.
Yeah, I do believe we have patients that come into our ER from out of county, and we care for whoever comes to our doors. We're obligated to do that. So even those,
but the public,
even
the
those
public really wants to know: are they our people or are they from elsewhere?
I don't think that's relevant. I mean, we can't really.
Yeah, we do surgeries on patients, hips and knees from a 5-6 county area. So anyone that does come in the door, we treat them as our own. But I understand the perception that may have been out there a couple of days ago that we're accepting patients from other hospitals and putting our own capacity at risk. That is absolutely our first and foremost is Mendocino County. That said, anyone that comes into our emergency department, we won't turn them away, and we will care them and love them as our own.
And one more comment, and then I'll step aside here. But if I understand correctly, we have apparently in the last week had some COVID patients who show up at our ER, and of course we treat them. I mean, that's without question. It's also, in my mind, without question, we would accept patients from out of county who need to be transferred because of the stress on that other system, just as we would hope other areas would take patients from us. But it sounds like, if I've got it correctly, we haven't been having people transferred from out of the area. We have had people who live out of the area who became ill while in Mendocino County. Is that accurate?
Yes, that's accurate.
Thank you.
That's accurate.
Okay, are there any other questions from the board?
Mr. Chair?
Yes, Supervisor Brown.
I think all the questions between Supervisor Williams and McCowan have been asked, and I appreciate the information received. But I also want to thank Jason Wells and the Adventist Health Team for all their tremendous work and their planning. That was needed. But I also want to chime in about the community sphere to get medical services early on and not getting the tests or, other medical needs early on. I myself didn't go in, but in the last 6 months, 5 months, I have had to go forward with certain tests, and I want Adventist Health to know how well I was taken care of, how staff made sure that, others around had their masks on, temperature taking, but the kindness, because I was pretty fearful myself of going in, but the kindness and good service, that was provided has really calmed my fears about receiving normal medical services. So thank you.
Thank you.
Right, Brent, thank you for sharing that. I appreciate that.
Okay, and Supervisor Jurdy, any questions or comments?
I don't have any questions for Emmis, just county staff.
Okay, and then I'd just like to say for Jason Wells and Dr. Parker and the rest of the team that thank you very much. You know, my family is a family of nurses, and so we really appreciate what's happening. I guess with the vaccine that's on the horizon, that our staff from the hospital first in line for those vaccines. Do you know what the protocol will be for that?
Yeah, we're going to work very closely with Dr. Corin and the team and the state on that. Dr. Parker will take the lead. I'm with you. I would hope that, you know, ICU nurses and ICU techs and respiratory therapists and physicians that are on the front line in our most critical areas, like our ICUs, like our med surg, like our emergency departments, would be, you know, right up there. But I know that we will, when those vaccines show up, hopefully a week from now, we will have that plan well orchestrated in the deployment of that. But I would imagine, I'm gonna leave that to the clinicians. Dr. Parker, do you want to weigh in on Chairman's question?
Right, I think Jason has rightly put it, and CDPH does have guidelines for all health facilities in California, and the rubric is start with those who are most exposed to COVID, and that would be the ED physicians and physicians taking care of COVID patients in the ICUs. So, and it's not only physicians, nurses as well, and environmental services, respiratory therapists, any healthcare personnel that get into contact with the patients or are exposed to hazardous substances from the patients in any shape or form would be the first in line. And then we would go to regular ICU patients, ICU staff and physicians and other providers, and then cascade it down to regular medical surgical wards and other first responders.
Hey, Dr. Bowen.
As well. So
Oh
that's
my God.
and we definitely will be working with them.
It was amazing. And Dr. Dawson was there, and he said, I wouldn't have missed those.
Okay, well, thank you very much to all of you, and thank you for your time. We know you have lots of important work to get back to, so thank you for being here this morning and sharing your thoughts and care.
Thank you so much.
Thank you.
Appreciate it, everybody.
Right. Okay, Dr. Corin.
Thank you. Good morning. Well, that was a very good presentation. I'll try not to be too repetitive, but I'll put it in some context. I think that, you know, we're in this tremendous surge around the country, but in particular in California. In Mendocino County, we had 20 new cases yesterday. 60% were Latinx. We have 8 in the hospital today, and 5 are in Med-Surg 3 in the ICU. There are some from out of county, but they are not in the ICU today. The Mendocino average daily new cases is at this point 22.43. There have been some days that number is over 35 patients that our contact investigators, contact tracers need to work with. Our total number of cases so far is 1,759. That is 34% higher than my last report 2 weeks ago. Of that, the Latinx community accounts for 1,067. Active isolation are 236 people. Quarantine now is 410. We have not seen anywhere near those numbers. The deaths at this time in Mendocino County account for 24 of our citizens. We just had another person who died on hospice at home after a severe course in the hospital. In California, 1,341,700 cases have been reported. We're getting over 30,000 new cases per day. There have been 19,876 deaths, 86 per day in the state of California. Worldwide statistic, just to put things in perspective, one COVID-19 death every 9 seconds. So in our county, there have recently been an uptick in the number of outbreaks. They are relatively small. Some are very serious. One, very serious, was recently uncovered in the homeless shelter building bridges, which RCS is providing housing for and moving people around so they are not continually exposed. And the street medicine program is doing medical monitoring and working very hard with our team for tracing and containment. We still have much more non-outbreak related cases. The majority continue to come from small gatherings, break rooms in particular, associated with eating and drinking, leading to more community spread through close contacts. The surge, as you heard already, is very severe and it threatens all of California. Governor Newsom has instituted the new stay-at-home orders based on the number of ICU beds available in a region. We are in the Northern California region, which includes Del Norte, Glen, Humboldt, Lake, Lassen, ourselves, Modoc, Shasta, Siskiyou, Tehama, and Trinity. In an effort to blunt that surge, if and when our region hits less than 15% of staffed ICU beds, we'll be under restrictive orders that are more than we have now, and they would go into effect within 24 hours. Remember that 12% of COVID positive patients need hospitalization, and of that, 10 to 20% wind up in the intensive care unit. Northern California now has, at last count, 26.5% ICU bed capacity. This is significantly better than several other regions in our state. We thought we were going to be the first to enter that restrictive state. It turns out that Southern California, San Joaquin Valley entered before us, and San Francisco voluntarily entered, though they did not meet that 15% trigger. The new recommendations, if we should go into the new stay-at-home orders, will include 100% masking, except when you're asleep or eating or washing, physical distancing, and no non-essential travel, lasting for 3 weeks until we would break out of that 15% trigger, and then each county would earn their tier level again. That's the plan. During this time that we could be in the restrictive state, the following enterprises would be closed: indoor and outdoor playgrounds and all indoor recreational facilities, including pools, hair salons and barbershops and personal care services, museums, zoos, aquariums, and movie theaters, wineries, bars, breweries, and distilleries, family entertainment centers, card rooms, and even satellite wagering. Live audience sports would not be allowed. Amusement parks would not be allowed. Modified would include outdoor recreational facilities without any food or drink or alcohol sales, and no overnight stays in campgrounds unless it was a permanent housing situation. For example, a homeless person who is housed in the campground. Retail operation would be cut down to 20% capacity, though groceries would be allowed to have 35%, and there would be entrance monitoring. No eating or drinking in the stores, and for seniors and others with chronic conditions that make them more vulnerable, there should be special hours so they can go shopping without undue exposure to people who may be ill. Restaurants would only be allowed to be open for takeout, pickup, or delivery. Offices would be remote only, except for critical infrastructure where remote work is not possible. Places of worship and political expression would be allowed outdoor only. And then open would be continuing critical infrastructure. Schools that are already open would remain open for in-person learning. Childcare and pre-K would be allowed. Non-urgent medical and dental care would be allowed. In addition to all these restrictions, the state is making available millions of more dollars for relief programs and for business and small businesses and workers, including housing and food relief. Remember that we as a county cannot be less restrictive than the state, or we could lose all of our state benefits. So you've already heard from the hospital staff and their expectations of being able to rise to the occasion. And we are working closely with them. We've had several meetings. Tuesday morning seems to be the time when we can fit it in. We did meet this morning. I wanted to give an update next on testing. We have acquired the new OptumServe testing. We continue to have the fixed site at the Ukiah Fairgrounds Sunday through Friday. And recently they have been doing a record amount of testing, including up to 400 tests per day. We expect, well, we have been approved for an additional fixed site, and we'll be moving that to Fort Bragg within the next 2 weeks. We did get the travel team, and beginning this week, we are doing some outbreak testing, and we're working on future scheduling for the outskirts of the city, of the county. We've been approved also for the LHJ model, which is essentially sets that we get, testing sets, and we would distribute them to other organizations. We're awaiting those test kits. They haven't been delivered. There may be some particulars we're not aware of, but we're hoping that they can be distributed to the schools and the skilled nursing facilities for surveillance testing. We did have a plan to begin the Binax Now antigen test for our pilot program for essential workers with mild symptoms. This Binax test is the 15-minute right now test, and it has been distributed to our clinics, so all of our clinics do have rapid testing availability. But this particular pilot was to really try and make sure that our essential workers, first responders, if they had any symptoms at all, did not avoid tending to them, and we could test and let them know if they were at high risk. So this is a pilot surveillance program, which is something new. We were going to start it this week, but as I said a minute ago, our testing site at the county fairgrounds has been overwhelmed and could not do it. So as soon as we have these other sites online and the Ukiah testing site relieves itself a little bit, we can make way for this new Binax Now pilot program. Mentioned earlier were the vaccines, and as the last I spoke, 2 vaccines are now online for emergency use authorization in the next, we hope, 1 to 2 weeks. That will be Pfizer and Moderna, which are both messenger RNA, a new technology with excellent safety and efficacy data as far as we know. There are another 2 or 3 vaccines in line. They have not applied for the EUA yet, but hopefully in the next few months we'll have 4 or 5 vaccines available. After it's approved by the feds, the FDA, and so forth, it will come to California, and California is already doing its independent evaluation of the safety and efficacy, primarily because of some vaccine hesitancy and because it's a new product and new technology. And at the same time that this evaluation is going on, the production of these vaccines are ongoing, so hopefully there will be many millions available to be distributed once it acquires its approval. We have purchased an appropriate freezer for these Pfizer vaccines that require minus 70 degrees Celsius temperature. However, I just found out that there may be some delays in delivering that,
And at our meeting with the hospital this morning, we found that the hospital itself does have that kind of refrigeration capacity and is very willing to share it with us. So more to come on that, but we are preparing ourselves for these vaccines. It's important to understand that it's a two-shot series. The first vaccines that we'll get, as far as I know, will be 1,000 for our county, 975, and we will need to distribute them under very difficult circumstances. They will be distributed according to CDBH recommendations, first to healthcare workers, and that does include not only the physicians and nurses, but other employees who are clerical and necessary, people who are involved in housekeeping, food service, and so on and so forth, so that it's intended to be an equitable and fair distribution. Let me see. In summary, I'll just summarize up now. The surge is a very dangerous situation that's confronting us now. We're making every effort to stave off more restrictions, but the largest population centers in the state are failing in that. And as they go into more restrictions, if they can't blunt their curves, in spite of our best efforts, we will be having to accept some patients from out of county. We have already. I don't think anybody would want us not to do that. But that could also, along with our own patients, overwhelm our ICU and our hospitals. And remember, these are staffed beds, so it's very important that we keep our staff healthy. This is not going to be a usual holiday season. I think you all know that, but we can still pray for that. This is the time for us all to pull together, individually mask, keep our social distance, sanitize, avoid gatherings, avoid traveling. Other counties and certainly other states are worse than ours. Despite the intense divisions, we have to find ways to support each other to minimize the loss of health and life. And I'll close with that.
All right, thank you, Dr. Corin. And I see Dr. Duhan on the line. So, Dr. Duhan, would you like to add anything to that?
Yes.
It's great to see you.
Thank you, Chair. Hashtag Board of Supervisors, CEO Carmel Angelo, County Council, and our health officer, Dr. Corin. I am your deputy health officer. I want Mendocino County to know that I have been serving behind the scenes all these months. Weekends, nights, 6 a.m. meetings. I'm here for Mendocino County. I am pledged to continue to serve through this pandemic. One of the elements that I'm not sure that our community is so aware of is how intensely the county on the public health side has been preparing and planning every single day. So when we have maybe what seems like a slow time during the summer, we're planning very hard for what is to come. We've never slowed our pace down. When I stood here as your health officer and I said, we're running as fast as we can to get ahead of this, we have never stopped running in the DOC. And we continue to run now, but we have a very, very strong team that I'm so proud to serve with. We've been focusing on, for example, vaccines, and we are ready for them. We are one of the first counties, certainly rural counties, to put in an order for a minus 70 or ultra low freezer. We're first in that line. So we're hard at work and we've never stopped. We also, because of this, have moment-to-moment situational awareness from the state. We are aware of what's coming down the pipeline, and we're ready for it. And that's because we're all working so hard in the DOC. One of the things that's emerged in the last couple of months that I want to share with everyone is the danger of eating and drinking in enclosed spaces together. So there have been many studies now that have shown that when people eat and drink in a room and they take down their masks, the COVID is to some extent in the air. And so that is why indoor restaurants at this time have been closed by the state, because we have found that in enclosed areas where people are eating and drinking, we tend to talk more loudly when we're socializing. The COVID is aerosolized and you can get it from the air. So this is why opening windows, eating outside, not having meals in your workplace in enclosed break rooms, why that is being avoided, why this is so important. So if you are a worker and you are going to eat your lunch, the safest place for you to eat it is outside. If you have a break room in your workplace and you have people coming in and slipping down their masks to drink their coffee, that is dangerous. So please recognize that eating outside is the safest way to eat or drink unless you're in your home. And even dropping down your mask for a moment to take those sips of coffee, you are potentially exposing yourself to COVID. So when we are at work, we should be wearing our masks all the time. And that is over the nose and mouth and chin. So there's also a lot that we've learned about proper mask wearing and how protective those masks are when we wear them over our nose, mouth, and chin. So I'm here to serve you. You haven't been in front of you in the public for some while, but I've been fully engaged behind the scenes serving our DOC and will continue to do so. So thank you.
Okay, thank you very much. Are there any questions from the board for either Dr. Corin or Dr. Duhan?
I have 3 questions.
Well, Supervisor Jurdy.
Yeah, well, thanks, Dr. Duhan, Dr. Corin, for being here. And we've had this surge, we've seen it coming. We knew it was coming with the holidays, and so obviously we appreciate everything that everybody's been doing to try to prepare for it. I want to go back in time for Dr. Corin's benefit because Dr. Duhan was working on these things early on, but early on, one of the concerns, one of many, was that the homeless population generally obviously doesn't get a lot of health care and is maybe not in contact with people who would be advising people about healthcare practices. And so early on, arranged for a meeting with Dr. Duhan and our Mendocino Transit Authority to look at when we were seeing outbreaks in the homeless population in Sonoma County. And the conclusion was that we needed to shut down inter-county transfer and long transportation. There were 2 different routes in Sonoma County into Mendocino County. So that was shut down. I'm not sure if the county was aware, but about 2 or 3 months ago, MTA, as things were relaxing, they did reestablish those longer routes. And seeing the outbreak at the Ukiah homeless shelter, and just seeing the concern statewide in our region, I'm not trying to put you on the spot right now, but I think it'd be worth another conversation with MTA right now to see about if there should be a suspension of those long routes again, because of the concern of people moving around into our county and between communities in our county. I know that on the coast, there's always besides the year-round shelter, there's a winter shelter, and they're having difficulty recruiting people for the winter shelter. I think, based on concern for their health as a worker at the shelter. So anyway, so I'm not trying to put you on the spot right at this moment, but I think we should have another conversation with Mendocino Transit Authority about those routes during this surge.
Thank you.
I would respond that, we had our surge in the late spring, early summer. We all know what that was because we lived through it. This one is bigger and will be harder because it's winter. So all of the things that we did in the spring to mitigate that surge, we should be thinking about again, every single thing. And we're not in the statewide sheltering in place now because our ICU bed count in our region is above 15%. But we anticipate that will come in about the next 2 weeks. So we will be having, when we see across the state what's happening in other regions, we do anticipate that happening here as well.
Hey, Supervisor Williams. You're muted.
I have 3 questions. CalCat has a forecast of total deaths reaching 37 in our county a month from now. I'm curious if you think that's an accurate estimate. And I hear a continual public discussion about people dying from COVID versus dying with COVID. And my read is people with other conditions are more vulnerable. but it's normal to die, vulnerable folks to die with multiple contributing factors, and COVID certainly may be the one that does them in. Can you explain of the 24 to date and the projected 37? Are these people who, if they hadn't been infected with COVID, would still be around, or is it just that they're dying anyway and they have COVID?
As I've looked at the individual cases, there have been some who've had very significant comorbidities, but seem to be acutely infected with COVID and had complications, for example, of their heart failure and their lung disease. So I would not consider those people dying with COVID, but that their comorbidities were definitely tipped over the scale, and it wouldn't have been, I mean, who knows when a person's time to die is. But COVID is taking people who don't have comorbid conditions at a lesser rate than the people who have comorbid conditions. But every comorbidity doesn't mean you're going to die in the next few weeks. So they're higher risk, and many complications come from COVID. But these are COVID deaths. There's no question about it.
And the coast hasn't had as much testing availability as inland. And Ukiah does indeed provide the greatest number of people served for. And so there's no dispute about Ukiah being the right place to have the Optum serve. And I'm really thankful that community partners have been providing testing on the coast. But seeing that the numbers are lower, could that be in part because of the reduced testing availability? And should we be doing anything more as local government to increase testing?
Well, we are going to increase testing. The new lane of the Optum Serve is going to be in Fort Bragg, so that will be accessible. Our clinic partners will also have access to more testing for diagnostic testing. And we are going to have the traveling team making stops at different places on the coast and in North County that are less accessible to the Ukiah Fairgrounds. But no, our testing capability is going to go up very much in the next few weeks. So
excellent. And then last, is there anything more county government can do to save lives? Are we doing everything that you believe we should be, or are there areas we're falling short that we should reconsider?
Well, I think one of the things that we have to be aware of is that, as Dr. Doohan was saying, our county staff right now is absolutely stretched to the limits. So we're needing more staff, and I think we're doing that on a regular basis, but that is an urgent need. As far as other things we're certainly doing a fair amount of messaging, and I think that's good. Because there is some vaccine hesitancy, and we'll need, as we go through, to make sure that as many people who want it can get it, and as many people who can get it want to get it. And I think that the testing is important, and messaging again about the restrictions in activities and in areas that increase the transmission. So we're trying to work on that. And we do have various parts of the health department looking into those issues. Mimi, do you have anything else to say?
Yeah, thank you. I believe that we have a very strong state leadership. Dr. Tomas Aragon is our new health officer for the state of California. He comes having been the health officer for San Francisco. And we have worked closely together with ABAJO in Mendocino County, and that is the Association of Area Health Officers, which Dr. Aragon has been one of the leaders. So in as much as we have a very strong public health in our state, there's been a clear message coming from our state leadership now. For the next 3 weeks, shelter in place. Only leave your house or your home when you must leave your home. If you can work from home, work from home. The recommendation from our state leadership is let's get through this next 3 weeks being as careful and as cautious as possible. So while we haven't locked down Mendocino County from the state level, nor with local orders, we all remember what it was like in the spring, and we need to go back to those behaviors. Of course, the wearing the mask, staying home when we're sick, as we come out with our data from our DOC, we tabulate our data very carefully every day. We can keep in mind some statistics, Supervisor Williams, to get back to your question. About 12% of positive people end up being hospitalized, and there's about a 2% death rate overall. So, you know, we've seen that recreated in counties across California and the country. So you can see, you know, I think we're about 20 cases on average a day now. And so just keeping those numbers in mind and taking the next 3 weeks and being as careful and cautious as we can, that will, our hope on our state level is flatten the curve, which we did this summer. We did it, and we need to do that again.
Thank you, Dr. Duhan and Dr. Korn.
Chair Haschek.
Yeah, Supervisor McCowan.
Thank you. I did have some additional questions, and this first one, I don't expect you to have the data at your fingertips, but perhaps it could be provided to the board or released to the public. I'm curious to know the unduplicated total of hospitalizations and also the unduplicated total of ICU patients. I assume that we have that information available in the DOC. So is that something that can fairly simply be put out to the board and possibly to the public?
When we publish it on the website, those are screened for duplication, so there shouldn't be a question. Those are not duplicate numbers.
Well, we have a total patients, total persons infected. I don't think we have anything there that would show total unduplicated hospitalizations and total unduplicated ICU admissions.
Oh, I see a cumulative total.
Correct. I mean, we see it daily, of course, but one patient may show up in the hospitalization category a week or 2 weeks running. So, you know, the cumulative total of hospitalizations from the dashboard would be misleading. So I would appreciate a breakout of the total unduplicated if we could have that.
Yeah, I think we can work on
that. Thank you. Also, it does seem clear that break rooms are a very risky environment. Often break rooms are kind of on the small side. If you have even 2 people in there without masks, you do have the effect of, aside from droplets, even, take the droplets out of the picture, you still have the aerosolized particles. And then if people are in close contact in that environment, that's a risky environment if anyone in that room is infected. Have we explicitly ordered that break rooms be closed or that no more than one person be in a break room at a time, so they could go in, they could go to the refrigerator, they could prepare something on the stove, but have we issued, rather than just general guidance, gee, it's a bad idea, have we issued an order on break rooms? And if not, would that be a good idea to do so?
To my knowledge, we have not had a county order for our break rooms to have a limited number of people. And that might be a good thing to do.
That would be being more restrictive than the state. There's quite a lot of messaging and guidance coming from the state regarding that, but that would be, there is no state order banning eating in break rooms.
Well, understood, but since we've identified that as it seems to be possibly a growing source of some of these outbreaks, and we had one at a local business. I think we had 20 cases resulting from one break room. It seems like it's worth considering. Should we be more strict than the state on break rooms, since our local data seems to indicate that's a fairly significant source of transmission. I did have a question regarding other business sectors. Have we identified that personal care services, and of course it's often one individual working in very close contact with another. However, we would expect them to follow all protocols such as masking, improved air circulation. Do we have any statistics on cases originating from personal care services?
Here in Mendocino County, are you talking about?
Correct.
I'm not aware at the top of my head of any specific, cases that involve that. But a lot of times we just don't know. Becky, I see you just got on the line. Do you have some information?
Certainly. So we can certainly pull that data. I know I had pulled a report previously in September of employers and areas of spread. I'm happy to pull that report again. I do not have it readily accessible today. So we will get that information and do a new report out to the board for that updated information.
Thank you. And, I had the same question as regarding gyms as well, which have been an issue of some controversy lately. And so I would appreciate knowing if we have identified them as a source of outbreak. And then one more regarding the outbreak at the homeless day center / shelter. Were any staff personnel identified as being infected, or is it limited to clients at this point?
As far as I know, for the current testing, Becky, you could update me, but I think it's just the residents. Is that correct?
So that is correct. We've had 8 residents total. They have tested all staff, and at this time, all staff have tested negative.
And I would presume we've offered testing to the clients, although we can't require it. So have we offered that to the clients?
Yes.
We have, excuse me, sorry, Dr. Korn.
Oh, go ahead, Becky.
Sorry. We did do a round of testing late last week of all the clients. And additionally, we are doing additional testing today in follow-up to the 8 identified from that result. And
then driving by just the street level view over time, it seems that there is very little adherence on the part of the folks accessing that facility to wear masks or to social distance. I would hope we're making a concerted effort to really improve compliance on the masking and social distancing. So I assume that's been part of our educational outreach to that facility. And it seems there must be a reluctance on the part of the management to attempt to enforce that, because I see it occurring not simply in the neighborhood off the premises, but specifically on the premises, very poor compliance with the masking and the social distancing, which I think are the most scientifically proven methods of slowing transmission.
Oh, you're right about that. I think there's a problem with requiring any of these measures. So it is a matter, as you said, of education. And I think that this experience will also up the ante and add to the educational experience so people understand that this stuff is transmissible. And I hope that nobody gets sick enough to have to go into the hospital from this, but that would also be another, unfortunate educational consequence.
All right.
Thank you.
Are there any other questions from Supervisor Jurdy or Brown?
No, Mr. Chair, I think it's all been covered. Thank you.
Okay. I guess I just like to ask about the 60% of Latinx community being the positive cases, and we have these social determinants of health that are certainly playing a factor. Have we and we're doing the Promotores de Salud. We just kicked off that program just recently. So do you think that there's more that we could be doing as a community to help the Latinx community? Because certainly, the job situation, the living situation, all those factors play into their high numbers. And the 60% is very concerning. And so I'd just like your opinion to see what we can do.
Well, Supervisor John Hanschak, I really appreciate your inquiring about that and the attention this whole board has paid to that problem. It is a problem throughout the state and throughout the nation, and it does have very much to do with the social determinants of health. In our county, as you know, we have put a lot of energy into public messaging, including translating all of our meetings and all of our orders and so on and so forth. And we did start up the Promotores model and just got their first actually pretty full report. And so I think as we go forward, we're going to want to increase those community health workers that can speak to their neighbors both in a culturally and linguistically appropriate manner and get this message across.
Okay. Well,
I would add, oh, sorry.
No, go ahead, Dr. Duhan.
I would add that including in the messaging this idea that is relatively new in the general public about eating and drinking outside unless it's your household. So, if you're going to eat with another person that's not in your household, outside 6 feet apart, including if you're going to be having a drink of coffee.
Okay. And I guess for both of you, that, the state order has certainly been controversial in California and in other places, but you feel like the state order is appropriate in regards to the situation we're living in, and hopefully we can keep our numbers, the ICU above 15%.
Yeah, this is the best that we can do at this point. Looking forward, this could be a terrible nightmare, more than what we even predict at this point. I think I've mentioned to people before I took this job, I read a book on the 1918 epidemic in the United States, and it's frightening. And we're getting into that situation where this virus is widespread and where it's could overwhelm our medical system and our social services system. And so we need to be as strict as we can. I think that it does hurt small businesses and businesses and people who lose their jobs and the risk of rent and losing rent and housing, which would complicate matters even worse. And I hope that those issues can be resolved quickly at the federal and the state level so we can support people who are at risk of the consequences of our mitigation efforts. But I think our mitigation efforts have to go forward strongly. And our Department of Public Health in California is very, very strong in leading that effort.
Okay.
And I would add, Chair Hanschak, that, as I stood before you many months ago, we said, when are we going to get a vaccine? And I had predicted it would be about a year. And that's about when we're going to get it, is coming in January. I would add that to my colleagues that are healthcare providers, us stepping forward and agreeing to have an experimental vaccine is an important part of us getting out of this pandemic. So the vaccine is going to be offered based on ethical frameworks, first to healthcare workers and people in skilled nursing facilities. And so it's important that those of us who will be qualified for those first tiers of vaccines to step up and get it. That's one message I would have for my colleagues in the healthcare worker world. It is experimental, coming through emergency use authorization, so it cannot be mandated that we must receive the vaccine. It is going to be an act of leadership and some element of bravery to accept an experimental vaccine, but I myself am pledging that when it's offered to me, I'll be in the first line to get it.
Okay, well, thank you very much.
Mr. Chair?
Yeah, Supervisor Brown.
Thank you, sir. And Dr. Doohan, it's very nice. I can't go on Zoom and see your picture, but it's nice to hear your voice. And I want to thank you again for your continued service. It's really appreciated. So thank you.
Yes. And Supervisor McCollum.
Thank you. Well, mention of messaging, and I'm very concerned that we've lost a lot of the public. We know that, unfortunately, something as simple as wearing a mask has become politicized. I won't go into all the details of all of that. It's a very strange environment, a challenge to put out a clear and consistent message. But I've read a number of articles that basically indicate a lot of the public have simply tuned out what any official messaging is. They're aware of the issue. They're making their own decisions of how they adapt to it. And so I think, to me, the most important message all along would be consistently emphasizing the efficacy of masking, social distancing, avoidance of gatherings, and improved air circulation. And yet, it just seems that that isn't the message that is really getting out there. And I'm voicing a concern. I don't necessarily have a solution for it, but do you feel, and Dr. Doohan, Dr. Corin, you're, I think, very tuned in to the medical community, certainly, in the state here. Do you feel that we're really getting the message out there to the public that needs to hear it? Or what thoughts do you have on that?
I think we're getting the message out. I think, as was mentioned before, there are things that we can improve and flood the airwaves and so on. I think there are two issues that concern me. One is the group that has turned down the message and does not believe in the threat of the COVID pandemic, which is well proven and publicized better than we could do through the national media. And the other thing is the social determinants of health that make certain kinds of things for some people nearly impossible. If you must work every day and the work involves close contact, and some of our industries do, and their employers have not managed to change that, and your housing involves multiple households being together, and things like that, that it's very hard to get the message across and have it stick. So those are things we have to continually work on, and we're doing it, but we're not going to get it to 100% of people, I think.
Dr. Corin, I just had a thought on that. So we do know that crowded living environments, multi-generational families is a reality for many people, partly based on economic necessity, I think partly based on cultural preference, where it's a common model. Could we start using that as a strength? So in our outreach to populations that are in this environment, could we leverage the multi-generational aspect? And part of the message that might be delivered by our promotores would be there's a responsibility of the younger people to protect your elders. And so make sure that they have, as much as possible, some separation from the people who might have to go out to work every day and potentially be exposed. Could we start trying to use those cultural preferences as a strength and incorporate that into our messaging? Is there a value there?
Well, I think those are good suggestions, and it's something that we will take into consideration in our future messaging.
All right, very good. Okay, any further questions for Dr. Corin or Dr. Duhan? Okay, seeing none, we need to take a break. So thank you very much, Dr. Corin, Dr. Duhan, for your work on all of this. I'm sure it's consuming, and we are very appreciative of that. So, okay, so we're going to take a break until 11:30.
Yes, we're ready when you are, Chair Haschak.
Okay, I don't see the other supervisors. Okay. Okay, are we all here? Okay.
I believe so. I believe we're just waiting on Vice Chair Dirty.
Okay. Why don't we get going, and we'll call the meeting back to order. And we have a presentation from Mascot Mendocino, an update. Is Mascot Mendocino on the line?
Yes, hi. Thank you.
All right. Ms. Davis, are you giving the presentation this morning?
Yes, thank you. Should I go ahead?
Yes, go ahead.
Okay, thank you so much, Chair Haschak, County Supervisors, and CEO Angelo. I'm reporting on Mascot Mendo's activities on behalf of the 3 area chambers, including the Willits Chamber, the Greater Ukiah Business and Tourism Alliance, and the Mendocino Coast Chamber of Commerce. So this project began at the end of July, and in the 4 months, much has been accomplished. Obviously, it's clear that wearing a mask has become a key component to fighting the spread of COVID-19. And one of our main goals is to continue to keep the conversation in the public's top of mind, with the primary focus being on normalizing wearing a mask by consistent messaging that adapts to the changing needs of focus. We're not only providing supplies, but resources and awareness. Mascot Mendo has a team of effective collaborative partners that give the program the ability to be shared across industry sectors, population groups, ages, and social collectives. One example of effective collaboration is the partnership with Visit Mendocino County and the Safe Mendocino program. This gained recognition from Visit California as a model of comprehensive strategy for visitors and residents. And with the rise of cases happening, as has been discussed, and the holiday season upon us, this work is more important than ever. It is one of the tools we have to maintain a sense of freedom of movement. And it's very effective in helping our business community stay safe and remain open to the public. We've received overwhelming support and positive feedback from businesses and our communities. So I'd like to talk a little bit about our distribution and outreach. Over 100,000 masks and pallets of sanitizer have been distributed. We're working directly with cannabis farming community to supply mass sanitizer and working with farming community through EDD representatives and education on importance of safety practices. We supply masks and sanitizer to apartment managers, laundromats for them to supply to people with safety materials and education. Businesses have been receiving outreach and direct engagement. Over 500 businesses have been served countywide. Outreach continues to expand in the areas of Covelo and Laytonville, and community outreach stations have been utilized. We have a volunteer program that's operational and accepting volunteers. As far as advertising and marketing, a broad spectrum marketing campaign has been utilized to facilitate reach from multiple media outlets and wide, diverse audiences in varying demographics and locations. Messaging is on all chamber, city, and project partner networks. As a result, the brand Mascot Mendo has gained brand recognition and continues to build momentum and awareness. Our current campaigns are general Mascot Mendo ads that include community and business leaders encouraging masking, shop local, shop safe, message to encourage holiday expenditures for local economy and to foster a sense of security and safety to venture out into community businesses. It encourages brick and mortar engagement as opposed to online shopping. We're using safe holiday messages, for example, spread only cheer this holiday season. Billboards, as of November, we have billboards up on Highway 101 corridor. They create a sense of confidence for visitors and a reminder to residents. They're an important piece to consistency and visibility of messaging. These billboards can also have messaging changed to reflect shifting needs. Radio ads in both English and Spanish have been created and are running on 7 radio stations. Holiday versions of Mask Up and Shop Local are also in rotation. We have video clips that we produced, and those are also in rotation. And we've launched a website to evolve the program and allow for online ordering of the free PPE, education, and marketing efforts. This is a valuable component in ease of use for the program, along with building brand and program awareness. We have social media channels, and this form of outreach is key in sharing messaging, gaining engagement from various industry sectors, population groups, and assists in normalizing mask wearing. Just some quick stats on that. We gained over 200 followers on Instagram in the first month. We have really good engagement, averaging about 30 likes per post, which is pretty good for a campaign such as this. The hashtag #MaskUpMendo is utilized by our partners in their messaging and through the multiple platforms. And so I want to thank you for the opportunity to bring this update. And I heard Supervisor McCowan's concern, so it's possible that we need to do a better job of advertising our own activities on this program. But I welcome your feedback and any ideas that you have on how we can improve our messaging for Mask Up Mendo.
All right, thank you for that update. Are there any questions from the board? Supervisor.
Yeah, I don't have a question, but just a comment, and I just want to thank Sharon and everybody at Mask Up Mendocino for the work they've done. I think it is making a difference, and it may not be to the same success in every pocket of the county. I do think when someone drives on Highway 1 in Fort Bragg, Main Street, and they approach the Noyo Bridge, and there's that Paul Bunyan and Babe sign, then they're masking up. I think it catches your eye, and that's not the only sign on the coast, but I think it might be a little more visible on the coast than in some parts of the county, the Mask Up campaign. But I think it has been successful overall, and maybe there's more that can be done in the Ukiah area. I don't know. Maybe Supervisor McCowan has some suggestions there.
Thank you.
Okay, any further questions from the board? Okay, hearing none, thank you, Ms. Davis. Really appreciate it, and all the work that you and everyone else does. Okay, we have some public comment. So I'm going to go to, is Anna Stockel? Supervisor McCowan.
Thank you. I had to hit *6 there. I did have one question. I assume the billboards.
I don't think she's on the line anymore.
Oh, okay. Would you happen to know if the bill?
Oh. Okay, go ahead with your question.
Are the billboards bilingual?
No, they are not, but we can change the messaging on the billboards, and that is something that we have discussed. So that's a very good suggestion.
And then the radio ads, are those on Spanish language radio stations, I would assume?
Yes.
Also? Great. And I think the billboards could be an effective means of outreach because people drive by them, they see them. A lot of the people that we're trying to reach are probably not accessing the communication methods that a lot of the rest of us may use. So I appreciate your consideration of having the billboards be bilingual. Thank you. And thank you for your presentation.
Thank you.
Okay, is Anna Stockel on the line?
Yes, Chair Hashtag. We'll bring her into the meeting. So call-in user 1, if this is Anna Stockel, please unmute and feel free to speak whenever you're ready. You just hit *6 to unmute.
Ms. Stockel.
Oh, how about that?
Ms. Stockel, are you on the line?
Yes. Can you hear me?
Yes, welcome.
Oh my God, I've been hanging on the line since 9:30 because I was originally supposed to speak at public expression agenda item 3.
Right, and no one was on the line when I called on that agenda item, so I guess we missed you then.
Oh,
now you're on.
Well, because I didn't get the phone, I'm sorry, I didn't get the phone number until 9:30, and the technical difficulties, the video didn't come on, yada, yada, yada. I'm here now.
Okay, well, you're on for 5B. We're talking about the COVID.
I know. So, okay, I have my 3-minute thing, although it's dated because I meant it to happen before your 5B agenda item. So please forgive me if you discuss some of the things that I'm covering, but let me just read it and we'll go forward.
Go ahead.
Are we good?
Yeah, go ahead.
Okay, good morning. Anna Stockel speaking. This expression was meant for agenda item 3. I did submit yesterday. Technical difficulties. I don't know why I didn't get the phone number till 9:30, but we'll deal with that offline. Thank you for the opportunity to speak. I am loving these Zoom meetings because it gives more of us a chance to participate without having to drive all the way to Ukiah, which is not something I'm able to do. And I hope that even after the coronavirus resolves, that we can continue having these Zoom meetings, because I'm happy to be able to be more involved in the Board of Supervisors meetings and to see what's going on. As an aside, I was treated in the ER last week for a concussion, so excuse me if I'm a little slow, but I did get to see firsthand what happened in the ER, and that educated me a little bit. And just so you know, I since donated some of my farm heirloom produce to, I'm talking about the Coast Hospital. I donated some of my produce this week to the ER staff. And I just wanted them to know how much they're appreciated. Hopefully that part didn't count towards my 3 minutes.
30 seconds.
So after watching, sorry?
Go ahead.
After watching the board last meetings, I was a little frustrated, and I was hoping for a much improved meeting today, and so far there has been. But here's the notes that I wrote before 5B today. It would be great if every meeting had a detailed COVID-19 report, a standard template with a detailed COVID-19 report with graphics from Dr. Cohen. I think there should be a regular presentation template agreed upon in advance, and to include items like outbreak sources and contact tracing.
Okay, just hold on. Lindsay, we're going to give her an additional 3 minutes because of she wanted to speak during public expression also.
You got it, Chair Hashtag, no problem.
Okay, go on.
Oh, thank you, Supervisor. I probably only need about 2 more. So where was I? The things I wanted to hear: detailed COVID-19 report, a standard template, every meeting, agreed upon in advance that includes items like outbreak sources and contact tracing. And one question I have is, what's the threshold of cases needed for disclosing to the public the source of the outbreak? Because only occasionally do we hear from its original source when it somehow passes some threshold and you let us know what it is, from where it's originated. I wanted to hear an update on getting the state's data as requested by Supervisor John McCowan. Also, regarding data, I'd like to see a run chart So what we're getting is snapshots, but what we need is run charts. And if anybody knows statistics, that tells you the difference between what's happening and perhaps a point in time. And so I have previously requested the data from Mendocino County Public Health, but I can do it, but I'm not sure it's my job. And so my question is anybody doing the run chart, and where is it? And if not, I can do it. But that's a very important point in tracing what's going on. And we can take that offline because I know my time is limited, but because that's a 10-minute discussion. I'd like to see a specific 3-month rolling test plan for both inland and the coast for the next 3 months, including contracted provider. I just found out today there's testing here in Fort Bragg, but I didn't go because I signed up for public expression in this meeting. I wasn't previously able to get tested because I was asymptomatic here on the coast, so you weren't able to get previously tested here. I wanted to hear specific vaccination plans, assuming the vaccination is available next month, including the priorities of who gets them, distribution channels, and proper storage of the vaccinations. I did ask Mendocino Public Health what the plan was, and they said, well, we'll figure it out when we get the vaccination. And that was very disturbing because you have to order freezers and storage in advance. And I did hear a little bit about that in the meeting. So that was better. But I wanted to see milestones and, you know, what freezers or whatever is being ordered. I'm kind of getting a little random here because specific reports regarding, so specific reports regarding the number of beds that was discussed a little, and PPP supplies. Additionally, reports from every county supervisor in cooperation with the Chamber of Commerce to include specific businesses, effects to date, closures, changes in revenues, proposals to mitigate, and specific ordinance budget line items and local community outreach, which is not shaming.
Thank you.
I'm almost done. I just need 30 more seconds. 30 seconds, please.
We've gone
the budget.
Anna,
the budget. I'm shocked.
Like a lot of your questions, you know, if you could write them to the board, we'd appreciate that. And you know, I gave you extra 3 minutes, so we need to wrap this up. Thank you, and I think I hope that a lot of your questions were answered in the presentation this morning, and we are doing that coronavirus presentation at each meeting. So I hope that if you could write those questions into the board, that would be great, and we could make sure that they get to the right place. All right, thank you. Okay, we have Teresa McNerlin.
Hello.
Yeah, Teresa?
Yes.
Yes.
Hi. Something remarkably absent from this presentation and conversation has been the children in our community. My child is in 5th grade, and she has not stepped foot in a classroom for 9 months. This has been during the good times of this pandemic and the bad, yet we're treating the children completely the same through this entire thing. The emotional, physical, and educational damage occurring to our children far outweighs any risk COVID presents to these children. Right now, according to your data, 0.003% of children have tested positive for COVID. We have the CDC and the Federal COVID Task Force telling us that our children should be in school, amongst other professionals. The data supports children should be in school learning. The math test scores have dropped 10 points nationwide since this time last year. And that's not including the children that weren't even in this test, that aren't in school, that don't have computers, that don't have stay-at-home parents helping them through this, what you call an education. The homeless shelter you mentioned had 8 clients test positive, yet 0 of the staff tested positive. So this should say something about PPE measures. If we're doing outreach to cannabis farming, why can't we do outreach to our children and get them in the classroom? This is absolutely outrageous. I heard the public health officer say, well, we have to follow the guidelines that the state provides or we won't get funding. I disagree, because when the federal government threatened to withhold state funding because we wouldn't do what they said, our governor said, no, that's not going to happen on my watch. And he fought it and he won. So why can't we do the same? Children are in private schools, children are in preschools, and children are in daycare. This is a social injustice to kids in public school. This is now the haves and the have-nots. If you have the means, your child is going to get educated. And if you don't, your child is going to stay home and hopefully they can do the best they can. We're losing doctors and scientists and researchers of the future because of this failure on our part to get these kids into the classroom. And I would urge you to make it a priority and show me some data
30
which
seconds.
Show me some data which supports keeping children out of school is healthy. The teachers need to get vaccinated at the top of that list, and we need to get our children into school. Thank you.
Okay, thank you, Ms. McNerlin. And Victoria Kelly.
Chair Haschek, I actually wonder if we could get a response from staff to the concern raised. Specifically, as a county, are we putting any restrictions in place, or is it the discretion of the school districts?
Yeah, my understanding was that when we were in the red zone, that schools could have opened, but now that we're in the purple, that they can't. So we have to wait. But the private school.
Yeah, the parties here. Is this a decision that we could make? Could our public health make, or is this between the schools and the state?
Ms. Emery.
Supervisor Haschek, Becky Emery, Department Operations Center Manager. The schools themselves have to submit their plans to the state and have them approved. They do have support from the health officer in that effort. It was in the red tier that they could do that and then open. But it's the schools that govern their operations and what they are doing. The public health officer, as many of you know, is required to review their plans, but it is at the schools to write them up and submit those plans and how they operate. It is not at the health officer to determine how those schools are operating.
So, and having been involved in some of the outreach to the schools, my understanding is the county opened that process, invited all of the districts. Some found the support and ability to submit a plan, and others decided to wait. Is that right?
That is correct. We do have some schools that did submit plans and did open in the red tier, and others that were waiting.
Okay. Well, thank you. We're going to go on to Victoria Kelly.
Hello, thank you for taking my comment. I'm Victoria Kelly. I'm with RCS. I'm the CEO. And I wanted to first say thank you to our partners with Mendocino County Public Health and Adventist Health, specifically our street medicine team. Since RCS received notification early Thursday morning of a COVID positive guest, we quickly, in collaboration with our partners, responded to ensure that guests at the shelter quarantined at the site and did not exit to the community, as is normal practice. We arranged for that outbreak testing that day and for today, as Becky Emery spoke to. We have also worked with each guest individually in developing plans to meet their needs, to not break quarantine and leave the site. This continues daily and is experiencing increased successful outcomes. Our first priority was to ensure guests did not leave the site and not break quarantine. We then received word that additional guests were COVID positive and moved them quickly to isolation and cleaned the dorms afterwards. We continue to follow our detailed COVID-19 policies and all recommendations from public health to ensure we mitigate any additional spread while serving those in isolation and quarantine. We also continue to require that all guests and staff cooperate with the twice weekly testing by public health while our shelter and our staff are in quarantine orders until those quarantine orders are lifted. I'm happy to take any questions, or people can contact me individually if there's additional questions as to our response and what is occurring. I also lastly just want to again thank your partners, Mendocino County Public Health, Adventist Health, Plowshares, McCavan, and Manzanita. Without this team, we would have no doubt seen a bigger impact in the community from this COVID-19 case and cases at our shelter. So thank you again.
Okay, thank you, Ms. Kelly. Okay, any questions on, that was public comment. So I'm going to go to CEO Angelo.
Thank you, Chair Haschak. Just 3 comments. One is that just an update on the freezer. We do actually have 2 freezers on order right now. The challenge of freezers is like the challenge of ventilators when we first started the pandemic. We have a promise of getting a freezer from the state, which we're working on, and then of course we've ordered another freezer. So we will keep this board apprised. We're doing everything we can to get the freezer, to have Plan B if the freezer doesn't come. We did our call with Adventist Health this morning at 7. We're all in agreement that we will work together on the vaccines and on storing the vaccines and doing everything we can here in Mendocino County for the public and to get the vaccination process going. Secondly, I wanted to let this board know about our employees regarding COVID, and I try to give you this update at least once a month. We are keeping track of our employees, how many are impacted by COVID. We have approximately 1,200 employees in the county. On any given day, we have a certain percentage of employees that are out. They could be out on sick leave, they could be out on family leave, they could be out for other reasons. So on top of that, we have anywhere from 30 to 50 employees every day that are out on some COVID-related reason. Today, we have 43 employees that are out due to COVID-related reasons, and we have 8 positive employees. We have 8 close contact employees. We have 24 employees that are out for childcare issues, and then we have 3 that are symptomatic and are waiting to be tested and for test results. So I share this with the board because approximately 50 employees a day on top of employees that would routinely be out. It can impact a county office, particularly a small office. So I want to be sure you know what is happening. I want to give you a 2-minute update on our flexible time off that this board has approved and that the ad hoc has supported. And that is that back in April, we started the flexible time off accrual, and that basically employees can accrue up to 260 hours of flexible time off, and that they would have to cash, they had the ability to cash 100 hours before the end of this calendar year. And this was employees, initially it was employees who worked directly in the COVID-19 emergency. And the reason we went with that particular group of employees was because that would not impact the general fund. That was money that could be paid for by our disaster, our COVID, our CARES Act dollars. And then realizing once we had the fires and going back to this board to discuss it, that there was some inequity between the disasters. We were in 2, and there was a benefit with one and not with the other. So then the board approved that we could move forward with the additional 100 hours if it was related to the Oak Fire or the August Complex fire. And that was greatly appreciated by our employees, by the way. And then what we learned is that we actually can continue with this benefit to our employees through June 30th. It's still 100 hours. It doesn't increase, but an employee has until June 30th to submit a claim for that 100 hours. They don't have to submit it by the end of this month. So again, that was something that was an additional enhancement with the FTO plan. Now what's happened is the longer that we're in the FTO plan, the more employees are coming forward, and we're seeing that, you know, there's an additional inequity here. So what we've done now is we've looked at the indirect support. An example would be you have one employee who is pulled into the DOC, they're working in the DOC, all of their overtime is claimed to the DOC. But back in the office, you have two other employees who are still working overtime, not getting reimbursed, working very long hours, and they're actually supporting that person who can be in the DOC. And we are calling that indirect support. We have multiple employees that are in that position. So we've gone back and we've adjusted the FTO accrual and cash out process. So employees who provide indirect support to COVID-19 or to the Oak and August Complex Fire Emergency Response should now be allowed to accrue the FTO beyond their standard accrual limit. So that's the additional 100 hours, and they could cash up to 100 FTO hours for those accruals. And our human resources team is working with the bargaining units on side letters for this. So I wanted to be certain that the board knew what we were doing and understood why we were doing this. Again, the inequity between the pandemic and the fire response, and now the inequity between all of our employees who are giving 150%, everybody in this organization working many, many long hours and 7 days a week. And so we want to be sure that if we can try to compensate our employees, we want to compensate all of them. So that is the enhancement to the flexible time off that will begin shortly. I've given you the number of employees today, which is 43. Again, that runs anywhere between 30 and 50 employees every day that are impacted by COVID. We are waiting for our freezer. And the last thing I would say is that we don't talk about break rooms because you get into many different issues. When you talk about a break room, we talk about a congregate setting. So within the county system, the advisory from the CEO to the department heads and then the department heads to their staff is that there will be no congregate areas. So for instance, in the executive office, it's one person. If they're in the kitchen using the sink or the microwave, it's one person at a time. There are no we are advising against congregate settings. So that is the way we are handling break rooms rather than just saying a break room, because it presents many problems, whether it's labor issues, union issues. So anyway, that is my update. I wanted to be sure specifically that the board knew about the flexible time off program and what the additional change was to that program. So thank you very much.
Okay, thank you. And we have a closed session item that starts at 12:10. So if it's all right with the board, we will break right now and we will finish up this item 5B when we come back, hopefully at 1:30. Okay, so if there's not a problem with that, we will go on lunch break. It's a working lunch. We're dealing with items 9A, 9B, and 9C. Okay, so to the board, we will be reconvening in closed session at 10 after. Okay, thank you.
Well, it's 1:46. We're going to reconvene the meeting. We dealt with issues 9A, 9B, and 9C during closed session, and direction was given to staff in all of those. So we are going to go back to 5B and finish it up. Okay, is there anything from the board on 5B? To finish it up.
Well, actually, yes, Mr. Chair, there's one issue. I'd just like to refresh it. The board has consistently given direction that we would like to hear from the state what is the data and science that supports the blueprint for a safer economy, the tier system, the restrictions on business. So I'd like to hear if there's any update on that. We did also ask, I think on November 17th, does the state have an actual plan beyond the blueprint? And we were assured by the CEO that the state did have a plan. She would ask for it. I wonder if we have any update on that. Thank you.
Okay, do we have any updates?
Chair Hashjack, this is CEO Angelo. I have asked repeatedly, along with 57 other colleagues, along with CSAC, and I have nothing more. And I do want to say we have asked for the data at every turn. As this board knows, there is a rural caucus that has made great inroads, but obviously not enough. And then, of course, we have the larger meeting, which is the kitchen cabinet. Those meetings happen with Dr. Galley and Secretary Montesantos. And even in discussing with the state staff that it's very difficult because there is a loss of confidence from the public in the state direction, and then it trickles down to county direction, and that we would have a better chance at the public following us if we were able to explain why the state is doing what they're doing, and that is a really good reason to not only have the data, but to have more of an understanding of how they've analyzed the data and how they got to the numbers they got to. I can say that I do not have that information. And at this point, the only people that do have that information is the state. So since the latest press conferences with the governor and Dr. Galley, we have not, CSAC has not had any additional meetings with the state. The state health officer has met with local health officers to discuss some of the current actions that are being taken. But we have not had any additional meetings with the state, and we do not have any additional information on their plans, their data, how they have gotten to the decisions they've gotten to.
Mr. Chair?
Yes. Supervisor Brown.
Thank you, sir. Also, on the Cal OES statewide calls, this has been a question asked by whether you're a county supervisor or city council person or a mayor, and even some of the legislative offices to see this plan and having the data science to back up these actions. But so far, and then there was one just yesterday afternoon, nothing has come forward. So I reiterate what our CEO, Angelo, just said. It remains unsafe.
Okay. Any further comment from the board? Okay, hearing none, we will move on to, and we're going to go out of order a little bit. We're going to go to 5C, which was hard timed for 11 o'clock, but we have a consultant on the line. So Agenda item 5C is discussion and possible action, including adoption of resolution adopting the 2020 multi-jurisdictional hazard mitigation plan for Mendocino County as the official plan. So the sponsor is the executive office.
Mr. Chair, members of the board, this is Nash Gonzalez with Recovery. The item before you is the adoption of the county's hazard mitigation plan, which is required to be updated every 5 years and provides for the county to receive hazard mitigation grant funding, especially during and after disasters. This project is the first in 2 phases of the scope to bring the hazard mitigation plan into compliance with state and federal statutes. The second is the revision of the general plan safety element. And that is because the 2 documents now have to be married. Over the past 10 months, Mendocino County and participating jurisdictions, which include the county, the 4 incorporated cities, and the County Office of Education, developed an update to the 2014 plan. The plan was developed by the Multi-Jurisdictional Hazard Mitigation Plan Committee, which again had representatives from all of the jurisdictions and the Office of Education, as well as community partners. Since the plan needs to be adopted before the end of the year, the plan is before you this afternoon. The plan has been submitted to both Cal OES and to FEMA. And the next step is for the board to adopt this plan so that FEMA may certify the plan. And currently, I just want to remind the board that the county has been awarded $3.1 million in HMGP funding. And we currently have $7.1 million in pending hazard mitigation grant funding. Not adopting this plan would jeopardize the grant funds, as we could not afford to have to give back the $3.1 million that we received to date. This plan has also been funded by the same grant dollars that I just mentioned. With that, I'm going to go ahead and turn it over to Aaron Pfeffenstiel with Atlas Planning Solutions, who's going to briefly walk you through the hazard mitigation plan and the steps, the process, and so on. And then afterwards, we're both going to be available to answer any questions. But based on this, staff is recommending that the board adopt the resolution approving the plan so we can go ahead and move this on to FEMA. So with that, I'd like to turn it over to Aaron.
Thank you, Nash. Thank you, Chair and Supervisors. I'm going to go ahead and share my screen, and that way we can walk you through the process. So as Nash had indicated, we embarked on this project about 10 months ago to update the 2014 Multi-Jurisdictional Hazard Mitigation Plan. This plan has a 5-year shelf life. And so, as you can see, we are lucky enough to have an extension through the end of this year due to circumstances outside of our control. And for the most part, we have been working at a rapid pace to make sure that this plan got completed and is now currently in the hands of FEMA reviewers for final adoption. As Nash indicated, there were 5 additional participants aside from Mendocino County. We had the 4 cities within the county, as well as the Office of Education. And why did we do this plan, and why do you want to have this plan? Well, it's really focused on ensuring you understand and identify ways to reduce your exposure and increase protection for your residents and infrastructure throughout the county and city. And so this is really an informative process, not only for internal staff, but for businesses and residents. But ultimately, the end result is opening up additional access to grant funding, as Nash had indicated. And without this plan in place, those grant funding resources would not be available to the county and the participating jurisdictions like the cities and the Office of Education. And these are those grant funds that you typically pursue. So we have the Hazard Mitigation Grant Program. These funds are typically attached to a presidential disaster declaration. The other 2 funding sources, which are known as BRIC and FMA, are funding sources that are appropriated on an annual basis by Congress in the yearly budget. And so I want to jump right into what the end result is of this planning process and how things now look when we went through this analysis. So one of the most important components of this process is to really start to understand where are the priority hazards of concern. And we walked through this exercise with the entire team, which included a number of staff members from the county as well as participating jurisdictions, and identified that the largest impact and the highest likelihood of a hazard event would occur with wildfire. Next would be earthquake, and then you can see drought, slope failure, floods were highly likely. However, they had a much smaller limited impact. And then through the exercise, we did identify soil hazards, extreme weather, and dam failure as those final hazards of concern. And this is really a process to help us understand where do we need to focus our efforts as we start to identify potential mitigation actions and strategies to take forward for the county and the participating jurisdictions. And so I want to share with you a lot of the mapping that was done as part of this that really help exemplify why we have a much better understanding of where these hazards are and how they may impact the community. So within the plan, we did map many of the hazards. This is what's identifying the wildfire risk exposure. And as you can see, wildfire risk is pretty significant throughout the county. That's probably come at no surprise to the board as well as businesses and residences. But through this process, we're also able to quantify what those potential impacts may look like for these areas of the county that are at risk. And that's what you see as part of this mapping. And so as we walk through the rest of these maps, we looked at different earthquake scenarios. These are based on U.S. Geological Survey earthquake scenarios that they have created to assist communities in understanding what is your potential seismic risk. As you can see, the San Andreas scenario, which denotes an earthquake that is triggered off of the coast of the county, and what the potential impacts may be to that. But we also looked at a second scenario along the Macama-Garberville, what's known as the Macama-Garberville scenario. So this is actually originating south of the county along the Macama Fault, and how that could potentially impact properties. And then we looked at landslide risk exposure, and you can see there's a number of areas within the county that have the potential to be for landslide. And what we did find though is that there's a smaller percentage of properties and exposure to to damage associated with these, not as prevalent as we found when it came to wildfire and seismic risk. When we looked at flood risk, so this is one of the smallest footprints of hazard within the county. So it affects the smallest number of properties. However, it does not mean that it's still not a significant impact when you have certain communities that may be cut off or impacted in a unique way that other parts of the county may not. And so one of the things we try to capture with this is really understanding some of the local conditions and ways that we can identify mitigation strategies to help some of these nuances to how hazards may impact a specific community. Tsunami was identified as a risk. Obviously, this is related to seismic hazards, but we do have a good resource with the tsunami inundation mapping that Cal OES and California Geologic Survey have prepared in the last few years, so we can identify those areas that may be at risk. And then sea level rise. So this is really starting to better understand which portions of the coastal region may be subjected to future sea level rise. And so that way we can tie in how we may need to build in specific projects to address infrastructure vulnerability for any low-lying areas along the coast. And finally, with this process of understanding all of the different hazards, the potential risk associated with them, and where what portions of the county may be vulnerable, this is where we use this information to develop mitigation actions and strategies. And so I wanted to highlight what the table, the outcome of this analysis looks like. And so what we do is we identify the hazard type, whether it's a strategy focused on all hazards strategy, what its focus is, whether it be public education awareness, emergency services, and the like, who would be primarily responsible for it. So in this case, in that first line, you see Mendocino County. And then we describe what that description or what that action should be taken. So in this case, develop a public outreach program that distributes consistent hazard mitigation content and mitigation tips for property owners and the like. And so what we try to do is lay out all of the information you need. And this is a continuation of that same table. It's actually a fairly large table. And so we wanted to zoom in and give you a little bit more detail. But what this really is intended to do is hopefully create a very simple playbook on when a grant opportunity becomes available, starting to look through this table of actions and strategies and identify which ones you want to pursue, which ones are in line with kind of your annual budgeting process, your annual implementation process of the general plan of your capital improvements program, and really make sure these can get integrated into everyday life for county staff and departments. That is one of the best ways to make sure that this mitigation actually happens and is not added on as an extra duty, but more baked into the day-to-day processes that you currently undertake. I just wanted to provide you another example. This is what the whole table looks like from start to finish. It's one of the reasons why I broke it up and tried to provide you with a larger version so you can see a little bit more of the detail. But this really is that action plan. It's really what helps county staff start to use this moving forward as they look to pursue more grant funding in the future. So finally, just wanted to identify what the next steps are. So we've already gone through public review. We've submitted to Cal OES. That review has been completed, and now it's off to FEMA for their final review. And today is the day we are requesting plan adoption for two reasons. One, we want to make sure that we stay on schedule and this gets adopted prior to the end of the year, and that it doesn't jeopardize any of the existing grant funding, and it does not prevent the county from pursuing future grant funding. As I said, every time a presidential disaster declaration is signed, HMGP funding is already earmarked as part of that, and you would be eligible for any of that new funding as it becomes available. And so with that, the one thing to note is that today, if you do adopt, that is not the end of this process. It really is just the beginning. But what the county does from this point forward, it's really about transitioning to focused implementation and tracking of your plan and making sure that it is effectively integrated into other department processes and other activities undertaken throughout the county. Nash, is there anything else you'd like to add?
No, I think you have pretty much summed it up, other than we're available for any questions. And again, we are currently pursuing an additional $7.1 million in grant funding. A lot of it we're going after right now based on the oak and Mendocino fires that have occurred up in the National Forest, which have affected the entire state. So we're eligible to go after grant funding. And again, very important document here. So with that, both Aaron and I are available to answer any questions.
All right, are there any questions from the board?
Chair Haschek.
Yes, Supervisor McCowan.
Thank you. Just wanted to confirm, I believe, and first of all, thank you both for the presentation. I believe I heard that we've already received 3.1 million in grant funds. And then there was reference to we have grants that we've applied for. And then, so what do we think may be in the pipeline here? We've got, sounds like 3.1 million in hand. And what are we hoping that we're going to be able to get based on this plan?
So if I may, Chair, we've got we've got 5 HMGT pending grants that run anywhere from $314,000 all the way up to $5 million. And these include anything from hazard tree removal to sirens to additional planned monies. I know that one of the grants that we've already received is a $2.2 million grant for the Redwood Valley County Water District Infrastructure Project, which is moving along. But I could go back through and look at the additional grants, but basically it's a number of different types of projects that we have in the pipeline, including generators, sirens, additional tree removal. In fact, some monies are even going to go to projects such as the one that was done for the West Hills of Ukiah in other areas of the county. And one of the ones that we've got out there right now is an ignition-resistant construction project. Some of these things would provide for homeowners rebates so that they could go and have a Class A roof put on their home, where the county would administer the grant, and then these folks would receive a rebate to be able to accomplish such tasks and basically make their homes, their properties more resilient.
Thank you.
Hey, Supervisor Jurdy.
Yeah, this might be a question for Aaron. In your presentation, you showed what looked like a new grant program in 2020. It was building resilient infrastructure in communities.
Yes.
And I was curious, if it's a new program, we probably haven't yet applied for it yet, but what would be a couple of examples of the type of programs that we could apply for under that grant program?
So while it has a new name, it's actually still an existing program. It used to be known as the Pre-Disaster Mitigation Program, but they renamed it. And part of that was also trying to refocus it. What FEMA is really hoping is to get more shovel-ready projects. So if you've already designed a project that fits within the confines of your hazard mitigation plan, that's really focused on infrastructure improvements, infrastructure investment, that's really where they're hoping to divert a lot of the funding through the BRIC program too. Part of it too is, I think, as part of the rebranding, was they also wanted to up the budget. In years past, the PDM budget had been as small as about $50 billion. And now it's moving upwards of about $500 billion. But if you think about it, it's national. So $50 billion divvied up amongst all states as well as territories. It doesn't mean there's a lot of money to go around. And so by it going national and by them raising the amount of money in the program, it's really hoping to get more of the shovel-ready projects that a lot of communities hopefully already have on the books and need to make sure get it constructed.
So just quick follow-up. So if you had infrastructure, say a water infrastructure project that was vulnerable due to fire and drought, I'm assuming that would be an eligible activity, or another infrastructure project that was identified as being vulnerable due to earthquake. Is that the kinds of things that it's focused on?
Yes, it's definitely focused on what hazards what vulnerabilities you have to your critical assets based on the hazards you've identified in your plan. One of the things that these grant funding programs will not do, they will not pay for deferred maintenance. So while you may have an aging infrastructure, what you want to do is make sure that it's not the age of the infrastructure, but the vulnerability based on it was you were using substandard materials that may have been great 20, 30 years ago, but no longer meet current safety standards. So that's really the focus. It's really about making sure you are enhancing the systems that you have, not just replacing them in kind.
Thank you.
All right, we see a lot of wildfire danger, and with climate change, that hazard is increasing every year for us. Certainly in the 3rd district, we have brook trails and other areas that are very vulnerable. And I saw one of the grant areas would be increasing egress opportunities through the Department of Transportation. So is there money out there? Are there grants available for doing this kind of work? Because we certainly have them throughout the county, not just my area, but every area has these one way in, one way out that Supervisor Jurdy and I are on an ad hoc for. So.
Yes, so the identification and expansion of infrastructure, especially infrastructure that aids in increasing connection and mobility from an evacuation standpoint, is a project type that you can use this grant funding for.
And do you think that will be increased with the new administration at the federal level?
So again, budgets are adopted by Congress. So it's really what ultimately makes it out of Congress. Most of the time, and over the last, let's say 5 or so years, we have seen these budgets increase because both FEMA as well as I think our electeds do understand that if we spend money now, it's going to save money later. But obviously there are no guarantees. I know probably about 8 years ago, it seemed like it was at its lowest point, and there was even movement to zero out the pre-disaster mitigation grant line item out of the budget. That's never actually happened. It's always had some money in it, but we have seen over the last few years, especially with some of these larger catastrophic disaster events that have occurred across the nation, that this budget has been increasing, which is a good thing.
Okay, thank you. Supervisor Williams.
Yeah, there's nothing quite like responding to a 911 call where you know somebody needs help, and putting together that they're on an unnamed road or an address that's miles out of sequence. Do any of the infrastructure grants cover modernizing the addressing system, for example, naming roads that are not named and fixing the numbers that are out of sequence?
So the grant programs have a whole list of project types that you can follow. They don't explicitly call out something as unique as that. However, my recommendation is always put in the grant application, even if you can't make the case that it specifically fits in. There's always ways, and I'm sure Nash can attest to the way that FEMA and Callaway staff have worked with him through the grant process, application and submittal process, to really get the funding into your hands where you know it's needed. Because as part of this project, we're also updating the general plan safety element, and we know that issue is a big issue that we're trying to address as from a policy standpoint within the element as well.
Thank you.
Any further questions from the board?
Nash has his hand up.
Oh, Nash.
If I may, through the chair, Aaron does bring up a good point. And so typically what happens for the HMGP grant funding is we would submit what we call an NOI, which is basically a concept paper to Cal OES. If Cal OES accepts the idea for, let's say, road naming or addressing, then we would be moved to the next tier, which would be permission to move forward to apply for the FEMA grant. So we could attempt that, but we've also, over the last couple of years, prioritized the grants where we believe that we would have very, very much success in obtaining funds. So we've actually done fairly well by prioritizing. But as we move forward, we can start looking at some of these other types of projects that are not necessarily a planning project, not necessarily a boots on the ground project, but really modernizing the roadway system or the addressing system.
Would you like to come back to us when you're ready, or would it be helpful for you to get some board direction from today? that when the opportunity arises, we'd like to attempt a grant application for the road naming and addressing.
If I may, through the chair, I don't think there's the need for direction. We can just come back at the next opportunity where when grant funds are then called for, we can then submit a concept paper and just see what happens. And then we can report back to the board as to where things are at. Again, what happens is we submit an NOI, and typically it might take anywhere from 3 to 6 months before we hear anything. And at that point, if they accept it, they would then give us the green light to submit the application. And again, once we submit the concept paper, if they allow us to move forward, that means we have a 50-50 shot of getting the grant. If they shoot down our NOI in the very beginning, that means that we're not going to get a chance to apply for that grant funding. Either way, we can come back and report out to the board.
And if I could just jump in, I do want to correct something that I stated. So previously I stated 50 billion. It's actually million. I apologize. So in earlier years, the PDM grant funding was at $50 million. I just am verifying right now. For fiscal year 2019, that budget is $250 million, and they anticipate the number of awards to be approximately 350. So what you have to recognize is that across the nation, you will be competing for one of 350 slots, and that's on average a little over $700,000 per award. Now, granted, that's not the case for every single grant award. Some are much smaller, and obviously some are a little bit larger. The great thing about having your plan in place, though, is that when an HMGP opportunity opens up, you're only competing against those under the disaster declaration. So if the president signs a declaration and it covers Mendocino, Tehama, and Sonoma and Lake County, you're only going to compete against them for the funding attached to that declaration. So that's another one of those reasons why you always want to look out for those disaster declarations that are signed and make sure you track when the notice of funding opportunity is opened up for those, because you'll have a much higher success rate in being able to obtain funding.
All right, any further questions from the board? Okay, so I'll go to public comment. Is there any public comment?
Hashtag there is no public comment on this item.
Chair Haschek, I'll move approval of the recommended action.
I'll second.
Okay, it's been moved and seconded. Any further comment from the board? Hearing none, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Jurdy?
Yes.
Supervisor McCowan?
Yes.
Supervisor Brown?
Yes.
Supervisor Williams? Supervisor Williams?
Yes.
And Chair Haschak?
Yes.
The motion carries unanimously.
Okay, thank you very much. Nice presentation. Okay, I just needed to go back to item number 9, our closed session items. That direction was given to staff for items 9A, 9B, and 9C. Okay, so we're going to go on to item 5A, which is discussion and possible action, including approval of appointment of Supervisor John Haschak as board member representative and appointment of an alternate representative to the National Association of Counties, NACO, and appointment of Supervisor-elect Glenn McGordy as director, board member representative, and appointment of an alternate representative to Rural County Representatives of California, the RCRC, and Golden State Finance Authority, GSFA, for the 2020-21 term. Sponsor is the Executive Office and Clerk of the Board.
Good afternoon. Thank you, Chair Haschak. It is actually a bittersweet item that I am bringing this forward. Historically, the Executive Office brings this item forward, which is the annual appointment for the Rural County Representatives of California and also for the National Association of Counties. And it's bittersweet because Supervisor Brown, who has been with us for quite a few years now, we know is retiring, and she has been our representative for CSAC, RCRC, and she has been an exemplary representative for us and has made Mendocino County proud. So at this time, I am bringing this item forward for the appointment to be made, the annual appointment, and it is in consultation with Supervisor Brown that the Executive Office brings this forward with recommendations for this board to consider. And that the recommendations, are for Supervisor John Hashjack to be the board member representative for the National Association of Counties, and that this board determine an alternate representative. And additionally, that there be an appointment for the board member for the RCRC, for Rural County Representatives of California. And that also is for the Golden State Finance Authority, which is part of RCRC. So we are recommending Supervisor Hashjack as the NACO appointment, and Supervisor-elect Glenn McGordy in the 1st District for the RCRC representative for this board. And we have no recommendations at this time for the alternates for both positions. And so this is absolutely open to any questions this board may have. Supervisor Brown may want to comment and add as well. So at this point, Chair Hashjack, I'll turn it back over to you.
Hey, Supervisor Brown, did you have anything to add to that?
Yes, I do. And I'd like to thank you, Chair Hashjack, for being my alternate on NACO. So I think this is perfect for you. I also think that the representative to the Rural Counties Association, which also is Golden State Finance Authority, with the 1st District Supervisor, is the best decision we could make. The 1st District has all of agriculture and very rural communities, no cities. And I would like to make the motion when we're ready to approve these appointments. Thank you.
All right, and I'd just like to say that I'm certainly willing to accept this nomination, and big shoes to follow, but I don't want to tip the scale. And if anyone else wants to apply for this or get into the nomination, I'm certainly willing to accept that. So.
Chair Hashjack.
I support the recommendation.
Well, we have to go to public comment first, but Supervisor McCowan, do you have a comment?
Thank you. Well, I certainly support the recommendations, but I think it's also calling for appointment of an alternate. And is there any current board member who will be serving next year who would like to be the alternate for RCRC and for NACO?
I'm grateful that we have had great representation in RCRC, and I think we will with Glenn McGordy as well. But I won't have the time to serve on either of these boards. I don't know about Supervisor Williams. I can't imagine he has much spare time, but maybe he does. Of
course.
And then we have two.
Supervisor Jurdy, you'll be the incoming chair. Perhaps you can work with the new supervisors and make a recommendation on that. Thank you.
Okay, any further questions or comments before we go to public expression? And I'd just like to say, I could do the alternate for the RCRC. I think I've been doing that this year, but with Supervisor Brown, she never misses anything. So anyway, let's see, is there any public expression?
There is no public expression on this item, Chair Hashjack.
Okay, so we'll go back to Supervisor Brown.
Thank you, Mr. Chair, and I move approval of the recommended action with the alternates being selected after the first of the year. And I'll phrase that different. If you want to be the alternate for RCRC, that would be good. I think, Ashley, you were my alternate for CSAC, and Supervisor Williams was my alternate for RCRC and GSFA. So anyway, I'll start my motion again. I move the recommended action for the appointment as stated.
Second.
Very good. Okay. Any further comment? And I guess, you know, let's leave it open, I think, for the alternate positions and see if supervisors elect want to be part of it. Okay.
I think that's a great suggestion, sir.
Okay. Is, let's see, Deputy Clerk, could you conduct a roll call vote?
Absolutely. Supervisor Brown?
Yes.
Supervisor McCowan?
Yes.
Chair Haschak?
Yes.
Supervisor Jurdy?
Yes.
And Supervisor Williams?
Yes.
The motion carries unanimously.
Okay. So we'll move on to this off-agenda item number 8A, which is pursuant to Government Code Section 54954.2, discussion and possible action, including adoption of a resolution affirming support for state and local health orders, encouraging compliance therewith, and prioritizing available county resources to assure effective enforcement. Sponsors are Supervisors McCowan and Williams. So Supervisor McCowan or Williams?
Supervisor Williams, would you like to go first?
I think I will yield to Supervisor McCowan's seniority, and he asked me to sponsor this item, co-sponsor it. I think it has merit. I understand the sheriff may support it, and Supervisor McCowan, take it away.
Well, and I do hope that we have the sheriff available. So we're all, I think, painfully aware of the issues that confront us, the difficulty of gaining compliance with the health orders, specifically gatherings, seems to continue to be a major driver. And we don't seem to be doing a lot, or I'm uninformed, in attempting to really rein in the gatherings and really make it clear to the public it's not acceptable. Supervisor Williams and I, and probably other board members, have had recent reports of large parties, 50 cars, 100 people.
Supervisor McCowan, I got to stop you because we have a process here. And because it's an off-agenda item, we need to...
Oh, I'm sorry.
We just need to talk to the process.
Exactly. Thank you, Mr. Chair. So based on the governor's announcement that the county could be put into a more restrictive tier, a return to shelter in place, that announcement was made after agenda publication. There is a need to take immediate action to better control gatherings, achieve compliance, and hopefully avoid hitting the 15% trigger. So the purpose of this item is to be able to discuss the potential to do that. And again, the need to take action arose after agenda publication based on the governor's announcement. And if we don't act now, then we may hit that trigger.
Okay, so according to County Council, we need a majority vote on this.
If I may, Mr. Chair, there's two different ways to take an off-agenda item. Under the findings that Supervisor McCowan just described, it would be a 4/5 vote. Alternatively, there is a provision that the board can make a determination that an emergency situation exists as defined by the code. And since we are still in a declared emergency with respect to COVID, I believe that it would meet those criteria. That would be a simple majority.
Okay. Okay, so we're going to vote on whether to hear this.
So I would move to authorize this as an off-agenda item.
Okay. Is there a second to that? Or
I'll second.
okay. Okay, so Deputy Clerk, could you conduct the roll call
Yes.
vote?
Yes. Supervisor Williams?
Yes.
Supervisor Dirty?
Yes.
Chair Hashtak?
Yes.
Supervisor McCowan?
Yes.
And Supervisor Brown?
Yes.
The motion carries unanimously.
Okay, so we'll go back to you, Supervisor McCowan. Now you can speak to the merits of this.
And thank you, Mr. Chair, for reining me in on that. I just, obviously jumped right into the issue. So the concern is we have limited resources to devote to enforcement. All of our staff tasked with enforcement, Special Investigations Unit, Public Health, Code Enforcement from Planning and Building, Sheriff's Office, obviously all have other duties, and COVID has been thrown onto the top of that. And I am hear consistent reports that other functions that are critical to our residents are perhaps not being fulfilled in as timely a manner as they can because our resources are stretched so thin. We, I think, heard again today that the most effective methods of slowing transmission are masking and social distancing. We absolutely want to see those are complied with. We know that gatherings are an issue. We, I believe, need to step up and do a better job on restricting gatherings. And then we still need to fulfill all the other critical functions of the county. And then we get into other issues related to the health orders as well. We've had a recent incident where there were reports of people being inside gyms. My understanding, public health staff responded. They documented all of the safety measures that were being taken. Masking was in compliance, distancing. There was enhanced air circulation. So no obvious immediate threat to public health. And yet we have this disconnect that we have these gatherings we're not attending to. I think our first approach should be, is there a gathering out there? We want to respond to those and send a clear message to the public. Beyond that, if we were to receive a complaint about how a business is operating, I would hope our first priority would be, are they following the COVID safety protocols, principally masking, distancing to the extent feasible? Do they have restricted access? Are they limiting capacity and all these types of things? If they're operating on the face of it safely, that shouldn't be a priority. So the purpose of this item is to give the board an opportunity to weigh in on where would we like to see the available resources allocated. And then also a concern has been raised, well, gee, you want them to drop everything and just go after gatherings. No, the prioritization is in terms of COVID-related enforcement. Number one would be gatherings. Number two would be masking and distancing. And then also, I did have a conversation with Sheriff Kendall, and we can ask him today for his opinion, but would the deputies, and I know his resources are finite as well, but if the call comes in over the weekend, other issues permitting based on what the calls are, would they respond and attempt to shut down gatherings? So I hope Sheriff Kendall's prepared to speak to that. Thank you.
Okay, Supervisor Williams, did you have anything to add to that?
No.
Okay, Sheriff Kendall.
Thank you, Chair Hashtak, members of the board. I spoke with Supervisor McCowan this morning regarding this.
there are concerns that we have regarding the states continuing to shut things down as we get closer and closer to that 85%. The concerns that I have are obviously, where are we going to get the personnel to take care of these things when we literally have this avalanche of calls for service as it is, and the current status of we've got a lot of people who are out on injuries and whatnot. Now, up until this point, the sheriff's office, when we fielded a call, we've immediately sent it over for triage to the DOC, and when it's triaged out, there's a determination made at the DOC regarding what needs to be done at this moment. Is this something that needs to be done tomorrow? Does it need to be done today? And so I understand that, but the questions that I have is, where are we going to get the personnel to be able to jump on this? And then the prioritization of things, I completely understand it. However, we've got to have enough personnel to be able to deal with the meat and potatoes of the job to begin with. I do support the fact that the gatherings are probably our most concerning activities that we have going on in Mendocino County. And then following that, we've got some other pretty concerning stuff. And our deputies have had numerous contacts with some people who are good enough to tell them basically, you know, on calls for service and whatnot, when they show up at their home, there's a domestic, there's some type of a problem there. And these folks will tell them, we have been exposed to COVID. And of course, these deputies are taking every precaution that they should. We've also run into some people who are using COVID to an advantage. We had a burglar who took us on a great big pursuit and then began to feign COVID, hoping that he wouldn't be arrested. These things are becoming very concerning for all of public safety. But as far as us jumping in and then trying to be able to support each other, of course, we're for that.
Okay, I was wondering if John Martyr was on the line.
Chair Haschak, we're bringing him into the room.
Okay. Okay. So I guess with this idea of gatherings, you know, we're in the holiday season. So are we talking about families getting together, multi-families, people? Are we talking about going door to door to see how many people are in a household celebrating a holiday, or what? Or are we just talking about band parties or something?
If I may, Mr. Chair?
Yeah, Supervisor McCowan.
Well, obviously, I think families will do what they will do. We hope they do it as safely as possible, but I don't think this is directed at a family holiday get-together. Again, the examples, the very recent examples are parties involving 50 to 100 people or more. We can assume there's going to be limited masking, no social distancing, mixing of multiple households, a real challenge for contact tracing if an outbreak occurs. So I think it's these larger gatherings is certainly the focus of this. There's absolutely no expectation, even if we had the personnel, that we would have our county staff cruising the neighborhoods to see if there's 5 cars parked in front of a house or something like that. But if we get a call to dispatch that there's a band playing, there's loud music, there's crowds of people coming in and out, the backyard's full, those are the kinds of calls that I think we really have to respond to if we want to get our case numbers down. And that's a major thrust of this agenda item. Thank you.
Chair Haschak?
Yeah, Supervisor Williams.
Yeah, as a tangible example, I saw on social media back on December 6th, somebody reported, quote, there was a big party last night on Laughlin, live band with mariachi music so loud you could hear it through the whole valley, 50 cars on the road, ... These types of parties happen in the valley all the time, end quote. And it's not just inland. I've heard similar about parties on the coast in the last 2 weeks. But the real question I have is, if we were to pass this resolution and influence the way we prioritize to focus on large gatherings, would would it have a tangible impact? Are we prioritizing something that is a zero effort? You know, that we're not doing any enforcement of any type for COVID calls, in which case, you know, this is more of a statement than it is changing the dynamic. Is the sheriff's office responding to break up COVID situations today, or is SIU doing that? And this will shift the priorities somewhat. Or will we pass this and, well, we weren't doing any enforcement before, we're not going to do any enforcement tomorrow?
Okay, John Martir, would you like to respond to all of this and your perspective on how the enforcement's going at this point?
Thank you, Chair Hashek. I would love to respond to it. Much like the sheriff's office, you know, we have a limited amount of staff, and we're not able to go out there and be proactive, just cruising the streets looking for gatherings. We are still requesting the public call with their complaints, and that we can go out on a case-by-case basis and investigate those complaints. I can tell you, I just finished last month's statistics. We only had 23 calls for service for the whole month of November. And while anecdotally, I hear from the public, oh, there was a big party on this day, or, you know, 3 days ago I saw something, it's very difficult to do any enforcement action after the fact. So while I chimed in a little bit late, I did hear about prioritizing, and to me, one of our first priorities is responding to gathering calls, because I think that creates the most greatest possibility for the spread of COVID. And so we're looking to you know, enforce those rules and that public health order, along with everything else. But it really has to be on a complaint basis and a call for service. County's just too spread out, you know, without the help from other agencies and with our limited staffing.
So what I'm hearing is that whatever we do with this, it really wouldn't affect what you're doing as far as triaging and your enforcement policy.
That is correct. We would continue to prioritize, in our best opinion, on what's creating the largest danger to the public's health and safety with regard to the spread of COVID. And we would continue to respond just as we have been since the onset of this incident.
Okay, very good. Thank you. Let's see, any other comments from the board?
Chair Haschek.
Yes, Supervisor McCowan.
Thank you. I had a question of Mr. Martir. Have you had calls come in recently regarding people being inside of a gym or a fitness center where they're supposed to only be outside? Have you gotten calls regarding gyms not in compliance?
Through Chair Hashek, no, Mr. McGowan, I have not. We have not received any complaints on any violations regarding any of the gyms anywhere in the county.
And if you did receive a complaint regarding that, what would your approach? I think you said earlier your main concern are people masking and that kind of thing. How would you handle a call like that?
We would go out and, given the prevailing public health order regarding to what restrictions are being, or what level of restrictions that we are at, we would still go ahead and educate the people and bring them into compliance. And we would still leave issuing a citation as our last resort on that, which, by the way, you know, we're having more pushback now from the community. I heard you all talking about the lack of definitive metrics from the state. Well, we're getting asked those questions when we go out and talk to people and attempt to enforce this. And, you know, we're being asked what type of scientific information and how can we be sure that their business is responsible for spreading COVID. So it's very difficult on the enforcement side to try to answer these questions and you know, to make some sort of enforcement effort. But we would still continue to educate with the goal of bringing them into compliance rather than going out and just issuing a citation.
Thank you.
All right, very good. So if there are any further comments from the board, we will go to public expression.
I have one, Chair Hascheck.
Yeah, Supervisor Williams.
Does enforcement feel that they can shut down a party, a gathering? And the reason I ask is it looks like most of the cases are from these social engagements, but it's clear that government has the ability to regulate business. Do you feel that we have the ability to prevent people assembling in the privacy of their home with their friends, even if it's a bad idea and they're spreading COVID? Is that their right? And is that part of the why you see the state prioritizing businesses which don't seem to be the leading cause? Is it just because that is an area where they can regulate and they're trying to reduce cumulative impact, and in fact maybe we can't regulate in someone's house?
Mr. Chair, I may need a little bit of clarification. I can't quite tell if Supervisor Williams is asking if there's a legal impediment to enforcing restrictions as to gatherings in homes, or whether he's asking if there's a practical impediment.
Practical. Is that the practical element would be the fear that maybe we don't have quite the authority to be breaking up private parties? And eventually there will be litigation. Is that why we're not enforcing? In which case, setting the priority may not change the outcome.
For the chair, perhaps I can answer that.
Yeah, Sheriff Kendall.
The practical issue behind it is anytime that I enter into a person's curtilage, the area that surrounds their home or their home, I'm required to have a warrant, either a raiding warrant, an arrest warrant, a search warrant. And being able to get one of those warrants at a moment's notice is completely impossible in Mendocino County. The issue is that, especially with the Ramey case, years ago, it was decided by the Supreme Court that a person's household is their castle, and the government may not enter until such time that they have the authority granted to them by a judge to do so. We have some extreme emergency circumstances that would allow us to enter if there was a felony in progress where a child or a person was in danger, things like that. However, simply going into snoop is absolutely a violation. And I'm not sure that we could survive that slippery slope to begin with. Now, when we show up to these things, we can ask nicely in the same fashion that I can't just go in and seize a boombox over loud music after 10 o'clock at night, but I can ask nicely for them to turn it off. And we have done plenty of that over the years. We've done a lot of good contacts with some good people who agree to do these things. However, it is an agreement. It is not me forcing them to do it.
Chair Hascheck.
Okay, well, let's see. We've already had a couple whacks at this, so let's go to public expression. Any public expression? Deputy Clerk?
No, Chair Hascheck, there is no public expression on this item.
Okay, we're going back to the board then. Is there a motion to be made?
Chair Hascheck, I would move approval of the recommended action.
Is there a second?
I will second it.
Okay, it's been moved and seconded. Are there any further comments?
Chair Hascheck.
I guess my comment would be, I don't understand the need for this if we're saying, you know, our staff is saying that it won't have any effect on how we're dealing with these issues. So I guess I don't understand the urgency of this or why it was brought forth if it's not going to have any effect on how we're doing it already.
Mr. Chair, I would like the sponsors to please give comments to your question.
Yes, Supervisor Williams.
Let's let Supervisor McCowan go. I heard him.
Okay, Supervisor McCowan.
I'd be happy to defer actually Supervisor Williams, and you were about to speak, I believe.
I was going to ask you, do you think maybe bringing this back a week from today, maybe you could work a little bit with SIU and the Sheriff's Office and see if there's room for improvement?
No, I don't think there's any point to bring it back a week from now. The issue is before us now. The issue is clear. I have no complaints about how the Sheriff's Office and SEIU have been operating. It is complaint only. I am willing to believe they do what they can do. Maybe there could be a little renewed emphasis. One thing it's very telling, 23 total calls in November. I think the public has given up on us. But if the public knew that we would respond affirmatively, particularly to gatherings, or if there's a report of a business where the employees are not masking, those kinds of things, I think the public would be more willing to call it in. So again, this really is not intended to say that the sheriff and special investigations unit need to do more. It may be that we have entities within the county that need to do less. So apparently no one called the Department Operations Center to complain, but somehow the thought that somebody might be inside of a gym or a fitness center became the highest priority over the weekend of various county officials who hustled to get out a press release on Sunday. They got out an advisory letter. And the result of it is that, to cite one example, and I think there's at least one public comment that was submitted, a gentleman who's not able to receive therapy. He's not paired with a physical therapist. Supposedly it would be okay if he was working with a physical therapist, perhaps not social distancing. But since he's only an individual with a doctor's note saying that he needs therapy, it is denied to him. Another example that I heard about was an obese individual who needs to lose weight in order to undergo surgery. These things are being denied to people. The overall benefit to mental and physical health of regular exercise. There is a whole host of people that are not able to access these services for fear that the county is going to shut down a business.
Supervisor McCowan?
So the point of this resolution is to redirect the priorities, that it should be focused on threats to public health, such as gatherings, not observing masking. It shouldn't be the officious enforcement of every last detail of state orders that, as far as we know, are not supported by data or science. So that's the intended purpose of this resolution. I encourage us all to support it. Stand with the public.
Okay.
Thank you.
Let's see, CEO Angelo.
Chair Haschak, thank you. The complaints came into the Department Operations Center, and they were about health clubs. And the complaints were not about physical therapy at health clubs, because clearly both Dr. Doohan and Dr. Corin are supportive, and the orders, even in the purple tier, if you have a doctor's note, you can get physical therapy. So there was no issue with people needing physical therapy in the health club. I don't really want to say too much, because all of our health clubs are important to the county. And they are small businesses, and some are family-owned, and definitely many of us probably in this room belong to those health clubs and appreciate the work that they do and the fact that we can go every day, or we can, or we could. So my point is that the information did not go to Mr. Martyr. It was a weekend. Supervisor McCowan is right. There was more than one complaint that came into the Department Operations Center regarding the health clubs. We found some areas that definitely needed to be reviewed. And so I believe that part of the effort was to support all the health clubs and to remind them all that we were in the purple tier and they could not be open inside. Again, I would like to say that people that have a legitimate doctor's note that they need physical therapy inside of one of the health clubs, there's no stopping them. Dr. Doohan and Dr. Corn are absolutely on board. In the purple tier, you can have that. There was certainly some other areas that really needed to be reviewed and quite honestly needed to stop. And so that's what happened. I don't understand this connection with the gatherings, but I do want to say for this board's information that the complaints did come into the DOC. They were referred to environmental health. The DOC and environmental health worked together. We didn't see a need to call in SIU. We actually tried to be much more friendlier to the health club, so we went with environmental health rather than the special investigations unit. And so I think that people did understand, and if you are a member of the public out there that has a legitimate doctor's note and you need physical therapy at one of the clubs, the public health department is not going to stop you. And so I hope that for this board's review that I've given you enough information to understand what happened. And that's really all I can share at this point. Thank you.
Okay, thank you. We still have a motion on the table. So,
Chair Housecheck.
Well, this is your second time, Supervisor McCowan.
Well, I understand, but
let's see if
we hear these references
there's anyone
to
else who has a comment first. Okay. Are there any other supervisors who have a comment? Supervisor Williams.
I support aligning our priorities with the leading causes of spread in our county. And I think the resolution does that. I don't know that we need to get into details about health clubs.
Okay, Supervisor, anyone else? Supervisor McCowan.
Thank you, Chair Housecheck. The advisory to the health clubs specifically referenced a doctor's note won't do you any good. They actually have to be in physical therapy. So the mere fact that their primary care physician believes that the physical exercise is vital to their health is not considered to be sufficient. I hope with the passage of this resolution, it will be clear to everyone that preventing a person who, by their doctor's authorization, needs physical exercise to maintain their health, that enforcement against those individuals will not be considered any kind of priority. Thank you. I hope we can all support this.
Mr. Chair, if I could just clarify one thing about the orders.
Yeah, go ahead.
Thank you. And I think there's a little bit of confusion here stemming from some of the terminology. Currently, the orders would allow that if there is a doctor's authorization that someone may be able to get physical therapy and that the physical therapy might be able to appropriately occur within the health club. I think where the confusion is stemming from is that there's a difference between physical therapy and simply a doctor's note indicating that a person needs exercise. Physical therapy is something that's provided by a physical therapist. It's a particular type of service and medical treatment that's regulated. The misperception that I believe was out there was that essentially any doctor had the ability to simply write a note and say, this person needs exercise, and that was an exemption that allowed health clubs to resume their indoor operations that would otherwise be closed under the purple tier. And there simply wasn't any support for that in the orders. And that seems to have been a relatively, as I understand it, widespread myth that may have led to a relatively widespread practice of issuing notes that really were sort of misleading the public and misleading people as to what they were able to do safely at this time.
Okay, so we have the motion. We've had discussion. Any further discussion from Supervisor Brown or Jurdy? Okay. Deputy Clerk, Dr. Roll call vote, or could you repeat the motion? Yes, Supervisor Brown.
That's what I was going to ask, please.
Yeah. Repeat the motion, please.
Are you speaking to me?
Yes.
This is Deputy Clerk Lindsay Doherty. Okay. So I had the motion as written, along with the original agenda item, which states discussion and possible action, including adoption of a resolution affirming the support for state and local health orders, encouraging compliance therewith, and prioritizing available county resources to assure effective enforcement. Is that correct?
Yes.
Okay.
Okay. Could you conduct the roll call vote?
Yes. Supervisor McCowan?
Yes.
Supervisor Williams?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Brown?
Yes.
And Chair Hashtak?
No.
The motion carries with Chair Hashtak dissenting.
Okay. Very good. Moving on to item 5D has been withdrawn, and so has 5E. So we're moving on to item 5F, which is discussion and possible action, including adoption of urgency ordinance establishing requirements and procedures for removal of fire debris and hazard trees from private property following the August complex and oak fires. Okay, the executive office and county council are the sponsors.
And actually, Mr. Chair, just before we get into 5F, I just wanted to let the board know that items 5D and 5E will be returning in the next calendar year. One of the applicants became suddenly unavailable.
Okay, thank you. So Deputy CEO Antle.
Chair Hashtak and members of the boards, Disaster Recovery, County Council, and Code Enforcement are before you today for approval on an urgency ordinance needed for those properties impacted by the Oak and August fire. This board had approved a local emergency and public health declaration for the August complex and Oak fire in September, which allowed for the county to move forward with phase 1 debris removal, household hazardous waste. With the support of Environmental Health, Trace Strickland, Kirk Ford, and various other members, that work was completed with Cal OES and DTSC before Thanksgiving. At this time, the County of Mendocino is ready to move forward with phase 2, private property debris removal. The county disaster recovery team, along with county council, has worked closely with Cal OES to bring this board a comprehensive urgency ordinance in order to move forward with phase 2. At this point, I will turn this over to Kirk Ford, who will provide additional information regarding the current status of the number of parcels and the right of entry forms that have been received. And then we will be discussing the ordinance with Matt Kudrowski from County Council. Thank you.
Good afternoon, Chair Hashtak, members of the board, CEO Angelo, County Council Curtis. My name is Kirk Ford. I'm your Hazardous Materials Program Manager for Environmental Health, temporarily assigned to disaster recovery. I want to give you a brief update on the recovery efforts so far. Both the Oak Fire in Willits and the August Fire in Covelo burned a combined total of 75 structures. 42 of them were homes. This left a considerable amount of ash and debris, including some cars, hazardous trees, and potential dangerous chemicals at those properties. In order to facilitate the removal of all the debris from the affected properties, the state created a two-phase approach. Phase 1, remove all household hazardous waste from each of the sites and perform an asbestos assessment of any ash and debris. As Darcy mentioned, from November 11th through November 19th, the Department of Toxic Substance Control, assisted by their hired contractors and aided by Mendocino County Hazardous Material Inspectors Sarah Downey, Gary Leonard, and Jesse Laughlin, completed Phase 1 and removed numerous damaged solar batteries, car batteries, destroyed generator fuel, and cleared damaged propane tanks for removal as scrap. Residents can identify the work by a posting found outside their property, as well as observing a white X on any flammable containers that are now considered just scrap metal. Any pink paint observed around their property marks the presence of asbestos found by the certified asbestos contractor on site at the same time. With Phase 1 complete, Phase 2 is the next step that removes the building ash, removes damaged cars, removes hazardous trees, and completes the cleanup. Residents have two options for cleanup. They can choose to clean up their properties at their own cost as part of our private cleanup program, or they can opt into the state-funded cleanup program that is free to those without insurance and is a reduced cost to those with insurance. In order to opt into the state-funded debris removal, property owners need to submit a signed right of entry permit, or ROE. The right of entry permit is so that the state can be allowed access to the property and remove the debris. As of this morning, the county has received 13 right of entry permits, with 3 properties choosing private cleanup options, leaving 14 properties who have taken no action in either direction for removal of debris. That brings us to the purpose of this urgency ordinance before you. The overly simplified version is to outline the process for debris removal and outline the procedures for any abatement that the county must take against properties that don't complete cleanup, allowing the county to act swiftly and collaborate with state cleanup efforts for any abatements made by the county. So I'd like to turn it over to Deputy County Counsel Matthew Kudrowski to talk a little bit more about the specifics of the ordinance. He's been instrumental in adapting the ordinance to Mendocino County. Matt.
Deputy County Counsel Matthew Kudrowski. We received requests for the adoption of an urgency ordinance for debris removal, and we started looking at what we had done in 2017 for the Redwood Complex fire. We did receive a ordinance template for Cal OES, which had language updated from the Butte County ordinance adopted after the Camp Fire. So in addition to sections regarding debris removal and the state program and the private program, there's additional sections regarding temporary log storage yards, if they become needed for the amount of wood that may come out of hazard tree and other tree removal. That was an issue particularly in the Camp Fire. And separately, the separate section on hazard tree removal, which also has a component of a government program versus a private program. If a person opts into the state program under the debris removal, that will automatically take into account all hazard trees on site. Enforcement and abatement provisions were brought over from the 2017 ordinance that we did here in this county after working with our code enforcement division with Planning and Building Services. If there's any questions, please let us know.
All right, any questions from the board?
Mr. Chair?
Yes, Supervisor Brown.
Thank you very much. I would like to ask if the Mendocino County Farm Bureau comments have been looked at. I believe we need to answer some of those questions, especially when it comes with conflicts with forest practice rules. So staff, have you looked at the letter just submitted by the Farm Bureau? And if you have, can you talk to us about it?
Darcy Antle, Deputy CEO, no, I have not seen that item. Was it just submitted this morning?
Okay, and we have public expression from Devin Jones from the Farm Bureau. So maybe she could clarify some of those questions too. Okay. So are there any further questions from the board? Okay, hearing none, we'll go. Is Devin Jones on the line?
Yes, she is, Chair Hashtag. Just a moment.
Okay.
Yes, good afternoon. This is Devin Jones with Mendocino County Farm Bureau, and I apologize for the late notice. Just a couple things that came to our attention in reading through this draft. One, there are several references that I put in our comment letter that basically for the hazardous tree removal component are expansive beyond just those trees that are in right-of-ways, road systems, or threatening actual structures. I mentioned entirely on real property or on parcels. There is a definition of what is considered to be improved public property. However, that's later in the document, and it's not clear as to what improvements would trigger this definition. For example, being familiar with some of the inholdings within the Mendocino National Forest that are private property, is a hunting cabin on a 2,000-acre property considered a improved public property? Even that trigger tree removal on the entirety of the property. If there's a water system or fencing for livestock, does this qualify as an improvement? So our position is that this ordinance should focus the mandates for hazardous tree removal on roads, right-of-ways, or those trees threatening structures. So that's the first point. And ties in with the second point in terms of the concern on the forest practice rules. There are several variable requirements within forest practice rules that restrict tree removal and even dead trees, and most of these are relations to variable watercourse designations. So if, some of these timber properties within the Covelo area are sort of under this mandate for the entirety of the property to be cleared of these what are considered to be hazard trees, we feel there's a conflict with forest practice rules. And one more point that I did not put in my letter, but it's something to think about, is that there were thousands of acres of commercial timber burnt in this state, from Sonoma County, Santa Cruz County, going down the coast into Monterey, and obviously Mendocino County. So our current infrastructure for mills and processing logging companies, they're going to be at maximum capacity for 2 to 3 years. So even if folks are really looking at doing any sort of emergency salvage practice, logging for the burnt commercial species that they may have on these properties, it's going to be a challenge, one, to find a market, and two, to find the infrastructure to take that to. So those are the points we just wanted to bring forward for clarification today. Thank you.
All right, thank you. Are there any further comments from the board?
Well, I would, just Supervisor Brown, Mr. Chair, I would like to respond to something that Devin just stated about the maximum ability of some of our infrastructure to take all these burnt trees. We had quite a fire. And I remember in 2017, then 2018, the difficulty that property owners had in taking down some of these trees, putting in the landing, doing all of that, and then finding a mill that would literally take the lumber, so the downed trees. It was also difficult for them to actually find logging companies to go in. So I do have concern as well, and I do have concern with forest practice rules. Their rules are taking down maybe one tree, perhaps two. You could do, but when you're looking at an entire property, they do have rules where you have to go and get a permit from them. And actually, it's in any zoning where the soil will grow a commercial species of tree. So did we confer with CAL FIRE on this particular emergency ordinance?
Deputy County Counsel Matthew Kudrowski. We did not have a whole lot of time to talk with CAL FIRE on this ordinance, but we did talk with Cal OES about the hazard tree removal issue. And I do think it's a lot more limited in scope than the concerns being raised by the Farm Bureau. In the definition of hazard tree is fairly specific on its own, and it refers to something falling onto a eligible road or parcel. Now, the parcel, as far as I look at the definition of eligible road or parcel, would really it means very limited things. One, it's a public road or right of way. So that would not be a private road. it would be something that is serving as a county road or a state highway. 2 is an improved public property. And I don't think that's talking about inholdings within the national forest. I think that would be if there was a portion of that improved with some kind of infrastructure that was used by the national forest, where this tree rooted on a private property was threatening that infrastructure. And speaking with Cal OES, their concern isn't the private holding or the private improvements of, say, the water improvements for ranching or the cabin. It's looking at something that is actually used by the public and is public infrastructure. So that improved public property, I think, is far more limited in scope than the concerns being raised. And third this is coming from the Butte County Ordinance for the campfire. A private road, realistically, in very limited circumstances, would be considered a eligible road for this program. So in the grand scheme of things, I don't know that we're talking about these hazard trees becoming the entirety of a parcel that may threaten these roads or improved public properties. We're talking about trees that are extending or threatening largely from the edge of these properties onto or over the right-of-way or over something else that's improved public infrastructure.
Mr. Chair, I'd like to speak again, please.
Yes, go ahead.
Okay, thank you. Well, many times whenever you have an ordinance, definitions are one of the most important elements, so everybody knows what's being talked about. And I do want to add the fact that we're still having issues with property owners from 2017 that have not cleaned up their properties, and especially in the wildlands urban interface areas. So, you know, this, I think it's important that we reassure organizations with a big membership like the Farm Bureau as to what exactly this urgency ordinance says. But on the other hand, we also need to take care of the issues that have been caused by these deadly wildfires. So that's my statement.
Supervisor Jurdy.
Yeah, I agree with Supervisor Brown that, you know, it's really important that whenever we adopt an ordinance that that everybody understands the definitions, that there's common agreement on those. And while it may be crystal clear to the people who wrote the ordinance what exactly it means, if it's not crystal clear to other people who read it or others who might implement the ordinance at some later point, that's where problems can occur. So I'm wondering if we could, in concept, support the ordinance, but direct that the ordinance be brought back at our next meeting with direction to have Supervisor Brown and stakeholders and county staff review the ordinance and bring back the ordinance amended if needed at our next meeting.
Supervisor Jurdy, I appreciate that, but I am really booked, and our next meeting happens to be a week from today with a deadline of posting on Thursday. And unfortunately, I'm just not going to have the time to do that.
And according to our clerk of the board, that we're booked until 6:30 next Tuesday. So, well, Mr. Gonzalez.
If I could, my hope was that it would be brought back on the consent calendar after that review of the language. Thanks.
Okay. Nash Gonzalez.
Mr. Chair, members of the board, just a quick refresher from the 2017 fires. I would agree with Mr. Kudrowski. This is not to cover the entire property, but this is merely to address those hazardous trees that pose a danger to existing structures or the cleanup of the footprint of the structures. It would not cover the entire property. And what we found was that there was grant funding available through CAL FIRE, through HMGP to do hazardous tree removal, which the county did apply for and had the RCD manage the tree removal for the rest of the properties. And then at that point, CEQA had to be done, and there had to be the evaluation for compliance with the timber practice rules. But as far as this ordinance goes, it only addresses the issue of those hazardous trees. The other thing too is that this allows us to have leverage with Cal OES and the state for the cleanup. What we don't want is the county to be on the hook for hundreds of thousands of dollars per each property to have to clean up, because once the state leaves, we're on our own. So that's just a reminder of what could happen, and that's one of the reasons why there was the urgency to move the ordinance. And we actually went through the same process back in 2017.
Okay, so is there any further comment or a motion to be made?
Chair Haschek.
Yes, Supervisor McCowan.
Well, have we, through discussion, clarified the intent of this action so that we're comfortable moving forward today? And I suppose that might be a question principally to Supervisor Brown, as well as to staff. Has the board, through its discussion, clarified the intent and the purpose of this and the scope of it? Thank you.
And I guess to add to that, is there something that can be clarified and brought back on the consent calendar for next week if we still have a problem with it? So Supervisor Brown?
Well, again, I think Ms. Jones made those points. And I think staff responded very well, stating that's not the intent. And it is an urgency because you do need help in addressing this, or it's going to be left to the county to fix as we go into the future. But if Ms. Jones is still in the waiting room, perhaps she could come forward and state whether she feels comfortable in moving forward.
This is Deputy Clerk Lindsay Doherty. Devin Jones is no longer in the waiting room.
Okay.
Mr. Chair, if I may.
Yeah, County Council.
I'm not sure if this is going to help the board's analysis or not, but I do want to let the board know. The issue here seems to be the ambiguity in the term "in improved public property," and specifically what that means. And I'll note, Ms. Jones actually did touch on that in her comments, which I think was quite astute. What I will let the board know is that to the extent that it's ambiguous, the statements that have been made here as to the intent of the board would be admissible as legislative history if there was a dispute in front of the court that would help determine its meaning. That being said, it's not generally the best practice to be relying on ambiguous terms. If the board so desires, we could craft a little bit more of a definition of improved public property and bring that back on consent for next week.
Well, that seems like the path forward.
It does.
Okay. Are we in agreement with that then?
I could go for, yes.
Would you like to make a motion, Supervisor Brown?
Yes, I move to adopt the urgency ordinance establishing requirements and procedures for the removal of fire debris and hazardous trees from private property following the August complex and oak fires, along with an improved definition of improved public property, coming back in for the second reading, and authorize the chair to sign the same.
I'm sorry, Mr. Chair, if I could just jump in. I think there might be a little bit of confusion because this is an urgency ordinance. There isn't a second reading. So we would simply come back for adoption on the 15th if that's the board's desire.
I understand. That change my motion, please, clerk, to express that, and I'll look for a second.
Second.
So just to be clear, that we're sending it back. We're not really accepting it at this point. We'll accept it when it comes back on consent calendar, but we're sending it back to get that clarification.
That's the way I understand it. Yes.
Okay.
And my motion.
Is that clear, Deputy Clerk of the Board?
Yes.
Okay, very good. Any further discussion? Okay, Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor Williams.
Yes.
Chair Haschak.
Yes.
Supervisor Brown.
Yes.
Supervisor McCowan.
Yes.
And Supervisor Jurdy.
Yes.
The motion carries unanimously.
Okay, very good. Thank you all for your work on that. Moving on to item 5G, which is notice public hearing, discussion and possible action, including introduce and waive first reading of an ordinance adding chapter 18.50 to the Mendocino County Code for expedited electric vehicle charging station permitting. Sponsor is Planning and Building Services. Okay, so clerk, has proper notice been established?
Yes, proper notice has been established.
Okay, it's 3:27. I'll open the public hearing. Okay, our Deputy Clerk, has there been any correspondence or telephone calls?
There has been no telecomment request for this item, and any correspondence received has been attached to the item.
All right, so we'll go to staff for the presentation.
Good afternoon, Supervisors. This is Jesse Davis, Senior Planner, Mendocino County and Building. In 2015, the state of California adopted Assembly Bill 1236, and that is before us today as the ordinance to add chapter 18.50 to the Mendocino County Code. And what this ordinance will do is it'll expedite the permitting process for electrical vehicle charging stations across our jurisdiction. The proposed ordinance OA 2020-0002 addresses all requirements of AB 1236, such as accepting and approving these EV charging station applications electronically. It directs the chief building official to use an approved checklist as a way to facilitate that review. For your review, a draft checklist is uploaded as an attachment to this item. Additionally, all of these materials are published on a publicly accessible website, which was recently updated and went live this morning. In conjunction with this ordinance, staff worked closely with GoBiz, the Governor's Office for Economic Development, as well as the Mendocino Council of Governments, who has been spearheading these regional efforts for electrification for the past few years. If I may, to the Deputy Clerk, I'd like to turn my presentation over to Janet Orth of the Mendocino Council of Governments to discuss the regional implications for this ordinance amendment and what we hope to achieve with electric vehicle charging stations in Mendocino County.
Good afternoon.
Oh, and Janet, you appear to be muted.
There we go. Can you hear me now?
Yes.
All right, thank you so much. Thank you, Jesse, for the invitation. That's an honor. And I appreciate the opportunity to address this particular Board of Supervisors one more time and just have a chance to say thank you to Supervisors Carrie Brown and John McCowan for your many years of service to us. Thank you. So Jesse asked me to give the regional perspective and some background how we got here and MCOG's planning work on this issue, what's been happening with electrification of transportation. It's a lot to talk about. We've come a long way, but I hope this is a good news item for today, and I'll stick to my notes and try and be concise with it. I'm really proud of our county planning staff for picking this up and getting this done. It's one of the types of outcomes we had hoped would come from the Zero Emission Vehicle Regional Readiness Plan, the ZEV plan as we call it. And I could see that they used a lot of the material from the templates we provided from the California building officials. A little history, and I'm sure you're well aware, Mendocino County has been a trailblazer on this with many early adopters of electric vehicles over the years. From 1996 to 1999, MCOG conducted a zero emission vehicle demonstration project. That was at my instigation. It was one of the first things I did when I came to work for MCOG. So it's near and dear. We had many stakeholders, and at the time, it was the only rural demonstration project of electric vehicles going on at that time. So it was very educational. And in the 2000s, you probably recall, California's ZEV mandate had been watered down to the point where the automakers were recalling the electric vehicles from the market, and you just couldn't get them anymore. So when the comeback finally occurred, the focus was more on urban areas, and so Mendocino County has been playing catch up ever since. In 2012, MCOG resumed the ZEV planning. Again, at my lead, I went out for some grants, and MCOG matched that with some of our own transportation dollars. We created a technical advisory group. We did public outreach and workshops. The focus was on infrastructure this time. And back then in 2012, we were thinking in terms of a public network concept because we thought that the private companies may not want to invest in some of our more remote areas where they couldn't really get a return on their investment. So we were thinking in terms of at least having some kind of backbone system, but this concept kind of lacked the traction that it needed. The private sector was moving a lot faster than we were. And so 5 years on, we revisited the ZEV plan in 2018, completed that in 2019. We have this plan, looks like this, it's up on our website and also on the county's new website there, webpage at least. So this time we put our emphasis on partnerships, recognizing that it was really going to be a public and private effort. So there was a lot of value that came out of these plans. Twofold the way I see it in brief. First of all, it supported grant applications for charging station installation. We had shown that we had done location analysis, we had done community engagement, and some cost estimates, and all this kind of underpinned the success of others putting forward grant applications for all this money that's been coming down from the state. And so as a result, we got the state parks installations in all of the state parks in Mendocino County, along with 3 of our cities in one project that we were involved with. We got the 101 corridor DC fast chargers, and that's just wrapping up about now. And we were involved in designing the Sonoma Clean Powers program with the Cal EVIP state program. That's a California electric vehicle infrastructure project, and they had successfully gone out for a grant to provide incentives to Mendocino and Sonoma County residents and businesses. So those are 3 examples of how the plan had a lot of value. And the other side of it was the networking that occurred. We had reached out to our neighbors on our bordering counties and during our process, and that led to invitations to do multi-county work. There were a couple of alternative fuels planning projects that we were participating in, and there was a lot of cooperation there. And we are now starting to work with the 16 county North State super region to support one another as we work through these efforts and to share our best practices. So just wrapping up here on the big picture, California and other states have very ambitious climate targets, and California's Clean Transportation Program has an investment plan for the next 3 years of $384 million. So there's going to be money flowing towards this. A year ago in 2019, there were over 800 zero-emission vehicles in Mendocino County. 300 or more than 300 were battery electric. There's about 500,000 in the state. So, the market is growing. The Cal EVIP incentive program I just mentioned was far oversubscribed. For Mendocino County, we had $750,000 available for charging infrastructure rebates, and we had 3.5 million in applications for that. And I hear it was the same in other counties as well. So there's a tremendous amount of interest in this. So the electrification of transportation is on a roll here. The technology has matured. It's gaining momentum worldwide. The U.S. is behind Europe and China, but moving forward, the Biden plan calls for 500,000 new chargers for electric vehicles. The automakers are investing heavily, and I believe that economics are now driving this technology as much as environmental concerns are. They're seeing the value there. So in conclusion, we do expect to see a new round of permit applications coming forward. And there's a virtuous cycle of new infrastructure leading to more adoption of EVs. So I think it's only going to grow. And I urge you to approve the ordinance. I think it not only brings us into compliance with state law, but also benefits the county by streamlining the process. So we could not have accomplished all this without the support of our many partners. Thank you for your attention to this today. And you're welcome to contact me anytime, and take a look at our website at mendocinocog.org for more information. And that's all I have.
All right, well, thank you. And we'll see if there's any questions from the board. So Supervisor Jurdy.
I don't have a question, just a comment. I just wanted to thank Janet at MCOG for working on this for so many years. Mendocino County is, I think in some ways, ahead of Sonoma County in getting electric charging stations in public places. At a recent Sonoma County Clean Power meeting, they basically said that because there was a greater need in Sonoma County for public charging stations on a per capita basis and per mile basis. But anyway, and I also want to thank Jesse, Senior Planner Jesse Davis, and Chief Building Official Michael Oliphant for helping to prepare this agenda summary. And just finally, Sonoma Clean Power has grant funding available so that if someone is a Sonoma Clean Power customer, they go to their website, you can at half cost purchase a charging station for your home. And once you install it, activate it, and have it connected to the internet so that you can allow them to ensure that it's only charging when there's not a shortage of power in the grid, they'll rebate you the other half that you paid for it. So you're really just covering the installation costs with your electrician. So anyway, that's an example of a program that's available to homeowners and department owners and businesses on the Sonoma Clean Power website.
Okay, any further questions from the board?
Chair?
Yes, Supervisor Brown.
Thank you very much. I'm very happy. I'd like to thank staff as well and MCOG, all the work that has gone in to update our current ordinance permitting process. GoBiz came before the RCRC Board of Directors a number of months ago, and it is mandatory to address and comply with AB 1236, and it's also being tracked at a state level. Jurisdictions that don't comply are going to be penalized in one way or another. So I think it's very important that we move this forward, and staff at the Rural Counties Association, if we have any issues at a state level, they're willing to come in and help us. So that's my statement.
Any further questions from the board? Okay, let's see, we'll go to public comment. So if you have any public comment, call in now. Let's see, are there any public comments online, Deputy Clerk?
No, Chair Hashtag, there have been no requests to speak on this item.
Okay, so staff, would you like to present any final remarks?
This is Jesse Davis, Senior Planner. No remarks other than we thank and appreciate the work of MCOG in helping us to facilitate this ordinance amendment before you today.
Okay, back to the board. Are there any other questions or comments?
I would move the recommended action.
Got to close the public meeting first.
Okay, I'm going to close the public hearing. Okay.
Now I'll move the public or the recommended action.
Second.
Okay, and it's been moved and seconded. Any further comments?
I do have one more comment. One more little sentence. I should have had at the end of my statement. Mendocino County wasn't the only jurisdiction that had not done the update, but I think it's very important that we're here today and getting this done. So thank you.
Okay, and I'd just like to thank MCOG and staff from the county and MCOG about the work you did to get this together to this point. So thank you very much. Okay. Deputy Clerk, could you conduct a roll call vote?
Yes. Supervisor McCowan?
Yes.
Chair Hashtag?
Yes.
Supervisor Jurdy?
Yes.
Supervisor Williams?
Yes.
And Supervisor Brown?
Absolutely, yes.
The motion carries unanimously.
Okay, very well done.
Thank you so much.
All right, so we are going to take a break right now for 15 minutes. It's 3:43, so we'll come back at 3:58. We're on item 5H, which is discussion and possible action, including introducing and waiving an ordinance amending Mendocino County Code chapters 1.04, 1.08, and 16.30 relating to code enforcement procedures and regulations, including administrative penalty increases relating to stormwater, cannabis, and building violations. Sponsors are the Planning and Building Services and County Council. So who would like to take it first?
Thank you, Chair. If I may, this is John Burks, Code Enforcement Supervisor. Good afternoon, everyone. Thank you for the opportunity. I'd like to start by saying code enforcement is not attempting to change the overall approach that we use to enforcement with these suggested changes. These changes will assist in accomplishing two primary objectives. First, update the processes used by code enforcement, and secondly, increase leverage to gain compliance. Staff identified specific areas that, if modified, would improve the county's ability to enforce the code, obtain compliance with violations, and provide for a more practicable process. Additionally, the suggested changes will memorialize code enforcement's current practices with more specific language. It has become clear that the level of penalty is not a deterrent to the behavior. Blanket penalties do not fairly address the overall impact. Higher impact justifies higher penalty and will function more effectively as a deterrent. However, I would like to be clear that voluntary compliance is always the first option when a violation is identified. In the process of crafting this ordinance, code enforcement was advised by County Council, and I would like to turn this over to Deputy County Counsel Mactasy for a little more specific information.
Good afternoon, Chair, Board, CEO Angelo, County Council. My name is Michael Maxey. I'm a Deputy County Counsel. I drafted the proposed language for this ordinance, and so I'm in a good position to talk about what's there, answer any questions about what the modifications will do, and why they're crafted as they are crafted. As John Burks introduced already, the ordinance itself, I wanted to give a little bit of specifics. And specifically, this ordinance is addressing three different chapters in the code, chapters 1.04, 1.08, and 1630. Ordinarily, I would go through in a little bit more detail, take you through the staff report and add a lot of details to that. And I'm happy to do that, or I could give you a more condensed summary. Given the time that's left on the board's agenda today, which would you prefer?
Well, maybe the condensed version, and we will have questions.
That sounds good. So the condensed version is one chapter at a time. The first one is 1.04. We're suggesting that we add a section 130 to expand an already existing code enforcement tool, which allows code enforcement to put a notice of violation on a record against a particular property to put future potential buyers on notice that there's a violation that exists. Right now, that ability is for certain violations and not others. And I called out a few of them that this would cover, including stormwater prevention violations, unabated nuisances, construction permitting as specified in chapter 18.70. And so this is basically just a broad description of if there is a violation of the county code that pertains to real property, this would allow code enforcement to use the tool of recording it against the property to put people on notice and just cover all of those sorts of violations. I'd like to skip down to chapter 16.30 because it's a shorter one than 1.08. In 16.30, it's our stormwater prevention or stormwater runoff pollution prevention ordinance. In there, we made a few cleanup changes to the language, but most importantly, what I was asked to do was to draft some language to increase the penalties. And so the language that you see in section 160A, most importantly, it increases the penalties up to $1,000 per violation. That's up from $100. And in order to do that, we removed the designation that the violations were infractions to allow for the greater penalty. In addition to that, like I said, we changed some of the language and just clarified it otherwise. except for regarding special permits. We added some language that would allow the Planning and Building Department to require special erosion control. I think they're called special permits that would require inspections and erosion control against erosion control violations. This is a practice that they're already using. There's some mechanism that allows them to do this right now. This puts it in writing and clarifies what they're doing already. And John, I don't know if you had anything more to say about the erosion control permits.
Best management practices are already required. It's just a specific way that we can call that out and get that implemented without attaching it to an already existing permit.
And so those are the two big changes in those two chapters. The biggest changes that we're presenting today is in chapter 1.08, which is the administrative citation and penalty ordinance, which allows for citations and penalties to be imposed when there's a violation of the county code across the board. And this came before the board a few years ago when it was created. Since that time, the Code Enforcement Division and myself, primarily in County Counsel's office, have worked with this chapter. And over the years, we've identified a number of things that needed to be cleaned up, that needed to be tweaked, that weren't really working the way that they had originally been intended to work. And so a lot of the changes that you're seeing right here is a result of those years of identifying little things that would make code enforcement's ability to enforce the code better, would allow the staff to process appeals and interact with hearing officers in a much more smooth way. And in general, I've written down a few of the key summary things. We obviously increased penalties. We increased penalties for building and safety violations for cannabis. We allowed, we wrote a provision that would allow for penalties to be imposed when there was a nuisance existing on the property. We cleaned up language. We made the provisions more robust with regard to administrative hearing procedures, how that would work, the timelines involved, how we would interact with the hearing officers, the actual authority of the hearing officers themselves. We added details to clarify what was already there. We made some substantive changes, which again, modified timelines, modified service provisions, expanded the scope of the ordinance to include not just codified law, but the uncodified law that the Board of Supervisors puts out through uncodified ordinances. Right now, when the board puts out uncodified ordinances, they've been writing in the enforcement mechanisms. This would allow code enforcement or anybody to enforce those uncodified ordinances through administrative penalties. Let's see. Another big key change was we added a lot of language to describe how administrative citations would be dealt with after they were issued with regard to modification and rescission. And we laid out a number of different circumstances under which they could either be paused, modified, rescinded, or dealt with through a compliance plan. It gives specific criteria under the conditions that can happen. And it also provides a streamlined way for code enforcement to enter into compliance plans without having to route the contract through the CEO's office or to come back to the board. It allows the director of planning and building or the director of the department in conjunction with the county council to make sure that the compliance plans themselves are sufficient to do what they're intended to do. And with that, those I believe are the main changes. I may have missed a few, but in the interest of time, I know John and myself are ready to answer any questions you might have for us. Thank you.
All right, any questions from the board?
Chair Haschak, I have one, and this is partially to you. Given that there's concern that's been raised and that this really is work that the board had directed, and I think staff has a lot of great ideas, and I support most or all of it, would it save us time if we were to refer this to the Cannabis Ad Hoc, which already has a town hall scheduled, collect the input? Maybe there are changes, maybe there aren't, but bring it back rather than try to hash it out today.
Well, that's a good idea because there's certainly comments, a lot of comments that we could go through with from MCA or from the Covelo Cannabis Advocacy Group. You know, and I think that most of the stuff is, they're appreciative of this, but I think there's some, like Supervisor Jurdy said earlier, you know, it's in the details of definitions and such. So I think that there's some, they raise some valid concerns that it might be better to take it back to the ad hoc. We could do it that way and kind of work through these, make sure that there's agreement on what the terms mean and everything.
If I may, Chair?
Yes.
I would just like to point out as well that this is really quite broad and it's not focused specifically on cannabis. There's a lot of other changes, and with permitted cultivation sites, we have the compliance plan option with them. So this isn't specifically targeted to anything related to the permitted sites or sort of a mechanism in place for that. So I would just like to add that.
Mr. Chair?
Yeah, Supervisor Brown.
Thank you very much. And I was on mute, and I appreciated the comment by staff when you and Supervisor Williams want to take it to the cannabis ad hoc and the town hall. It's meant overall for all code compliance. But one statement in the memorandum is overall, these changes are based on improving the county's ability to effectively and efficiently obtain code compliance. And many times in the past, that has been very difficult. So I feel we need to go forward today.
Okay, Supervisor Jurdy.
Yeah, I don't think I agree with sending this to the ad hoc that's on a specific subject, and for two reasons. One, this is for all property owners, all Mendocino County and all neighborhoods, and the other is this is for people who aren't in a permit program. So who do you go to for people who aren't in the permit program? I mean, you say calling all scofflaws, go to this one public meeting that we're going to have. So I think that we really need to, if staff's saying that this will enable them to enforce rules that we already have on the books, it's just giving them different tools. I think that's different than saying we want to establish new standards, new rules, and we're seeking public input from the general public.
Chair Hashtag.
Yeah, Supervisor McCowan.
Thank you. Well, I think I've heard a lot of valid comments here, and of course we'll hear more from the public, but I do think enough questions have been raised, and after all, this is 3 years in the making, and these issues aren't new. I think staff has done a lot of great work. The public comment that I've seen acknowledges the work of staff and appreciates it, and yet a few questions have been raised. I agree with Supervisor Brown and Jurdy that there's no need to refer it to the Cannabis Ad Hoc Committee since this is a much broader topic. But I do think we could continue this into the next year. I think staff is capable of considering the comments from the public, understanding that the public has maybe made only preliminary comments at this point and may have some additional points to make once they more thoroughly digest everything that's been presented. But so I do agree that this item should be continued for staff to further refine it, clarify the questions that have been raised, and it can come back at some point in the new year, would be my recommendation.
I guess staff, is there any problem with putting this off until these this clarification is made for these questions that these groups brought forward?
Thank you, Chair. We're prepared to field any questions that that they have. We've reviewed all the comments that came in and think that, we've been able to, reach out to the community and get a lot of input on the front end of this because it has been so long. So we're prepared to move forward right now and answer any questions the board or, the public has for us. We're prepared to respond if that's needed.
So, Mr. Chair?
Yeah, Supervisor Brown.
Then if yourself and Supervisor Williams would like to present those outstanding questions, perhaps staff can respond today.
Yeah, certainly if we wanted to start going through them, it might take a while, but
that's okay.
Okay, so
Chair Haschek.
Yeah, Supervisor McCowan.
Thank you. Well, another approach might go to the public first and hear their concerns as stated by them. I don't know who all is lined up to speak, but I might suggest we hear from the public and then bring it back to the board to see what the response to the questions is.
Okay, we can certainly do that. And if staff could, respond to the questions that come from the public, that would be appropriate too.
Absolutely.
Are we good with that? Okay, very good. Is that all right with the board? Okay, we'll go to public comment then. Is Hannah Nelson on the line?
Yes, she is, and we're bringing her in, Chair Hashtag. So Hannah, you're in the meeting, and if you want to just press *6, you can begin speaking.
Ms. Nelson.
Can you hear me?
Yes.
Okay, thank you. Good afternoon, supervisors. We did submit a detailed memo, and I was attempting to avoid having to go through each and every single item. But if that is our only opportunity for staff to respond to some of these comments, then we would in fact appreciate that the board take up each item and each question. I do want to say that our comments for MCA, and I'm sorry, I need to back up. This is Hannah Nelson. I'm speaking on behalf of the Mendocino Cannabis Alliance. Our comments do specifically state that we are not objected to some of the provisions, including increasing the fines. That's just not what we're concerned about. What we're concerned about is some of the unintended consequences of how these laws, even if they were intended to be broadly applied to the entire general public and to be utilized most vigorously against non-permitted cannabis operations. The reality is that we have great concern that unintended consequences might follow, and specifically impact those people with compliance plans, those people with other minor building code violations. And in our memo, we specifically call out the current code enforcement office, and the way that they have handled things has been just really excellent with respect to encouraging compliance and not going the citation and penalization route, if at all possible, and if people are being responsive. However, laws really have to be written for all circumstances. In particular, Deputy County Counsel mentioned that there was an expansion, that it did expand the scope of uncodified ordinances. But the language is not just for uncodified ordinances. It also says, and other building permit violations. There are numerous instances throughout our memo where we
30 seconds.
We detail some of the unintended consequences that we're concerned about, and we really ask that you look at that and understand that our support is behind clarifying and cleaning up any processes and procedures that might be needed. But in fact, the service request to change to regular mail is one that we're particularly concerned about in terms of expanded liability, and especially if you're going to record violations.
Thank you, Ms. Nelson. Is Mo Ramirez on the line?
Hello, this is Monique Ramirez. Thank you for the opportunity to speak today on this agenda item. I'm representing the Covelo Cannabis Advocacy Group, and we also submitted a memo. I don't want to take up too much of the time. I just feel like we did ask a lot of questions in regards to some of the proposed changes, and something that we're really interested in is how enforcement will be taken place for people that do have problems that need to be remediated on site. And looking at the increased fees, especially for some of these egregious violators that we hope are going to be captured under this new enforcement, amendments that you guys are making with the cost of fees, that these people may, end up racking up a significant bill. And so we're curious how the county's going to actually recover that money if it's, $400,000. We gave an example. And in our memo about that. And so that's something that we're really wondering. And also, is there any type of action that the county and the code enforcement can take to make the violator apply those fines towards remediation of the site? I think that's something that we all should share a value in and having that happen to the property. And then also something else I wanted to point out was around the responsible party definition. And while it did allow a landowner who rents out a property to a tenant that in fact does something illegal, as long as they can prove that they signed a contract with the landowner saying that they would not engage in any illegal activity, and then if they did so, that would alleviate the landowner from being responsible. But we didn't see anything regarding people that get land returned to them because somebody defaults on land. When you sell a property, there's not really a clause in there to tell the new landowner what they can and can't do with the property they're purchasing. So we want to make sure that the person that's in violation is the one that's ultimately responsible to remediate and to pay the fines, and that the landowner is not, if in fact they don't have any responsibility towards what happened. And so I'm not sure how someone could prove that in a landowner situation. And maybe what we need to do is write in something about that. If they can prove documents that said, I sold this land to this person, they defaulted, and then it came back into my possession, what happens at that point? So I think that's a really important thing that this board and code enforcement should examine and think about. And that's why we're requesting, if that can't be answered today, that maybe this gets pushed out until the beginning of next year. And we had a couple other detailed questions that were in the memo, but overall we do support this, and we do believe that it's interesting. There's some clauses in there that people can use to maybe get off the hook for the financial burden of paying back the fees. And so we argue, wouldn't somebody say at any point that a fee is a financial burden? So we're just curious what the parameters are going to be to determine that cutoff to where someone is going to in fact have to pay back whatever fines they've racked up versus someone that could say, oh, well, I can't financially do it. We have to be strict about these rules, otherwise it means nothing. So thank you for the opportunity to speak.
All right, thank you. Moving on to Ron Edwards. Mr. Edwards.
Yes, I'm here. Can you hear me?
Yes.
Okay. I'd like to follow up. I support the comments by Hannah and Mo. However, I would like to add a concern that by removing that registered letter requirement, having been caught up in this myself, I'm not sure how good the county's database is as far as addresses go. My address was changed by the post office, but was not updated by the county. So I did not receive a notification until I later got an email about a default. So I would really be concerned about that the landowner is actually properly notified, as well as the person responsible at the property. So both of those items are of grave concern to me. Also, with the large increase in the fines, is this going to cover staff time, or is this money going to be going into a cleanup fund? And I think it would be good if those fines went into a cleanup fund so that the properties just aren't fined and a lien placed on them, because a lot of these properties could just languish with a lien there and no way for the county to recover those fees. So whatever is recovered could go to cleaning up these sites. That, I think, would be a great benefit to the county. And I support this ordinance, and thank you very much.
All right, Corinne Powell.
She's not on the line, Chair Hashtag.
She's not. Are there any other public comments?
No, there are not.
Okay, so let's go to staff to see what you have to say about some of those questions.
This is Deputy County Counsel Michael McAfee. I'm going to answer or respond to a number of them, Chair. I think some of them are appropriate to be answered by me. I think some others would be more appropriate for John Burks to answer. So let me start. And I want to say that the letters that came in, I spent a lot of time with yesterday. In particular, the letter from MCA and the letter from CCHE. And so I have responses to every single one of the issues that they've brought up. It would take some time if the board wants me to go through item by item, I can, but for now, I'd start with the comments that were made just right now. With regard to unintended consequences, so I'll just start from the top with Hannah Nelson's comments. She talks about unintended consequences potentially being there. She mentioned this in her letter as well. There wasn't any examples of the types of unintended consequences she was referring to. And I'm not saying that they don't exist, but without examples, it's hard to understand what those potential unintended consequences would be. When I went through and I was looking at what these rules would do, and she brought up compliance plans potentially. And so I looked at the compliance plans and I thought, well, what are the potential unintended consequences for compliance plans? And I didn't see any. And the reason why for compliance plans in the cannabis realm, I didn't see any issues is because the compliance plans is essentially carves an exception for how you address violations. There's a standard way for addressing violations. The compliance plan gives an exception to that. That exception isn't going anywhere. That exception is staying the same. So any rules we make with regard to the standard way, the compliance plan is if there's a compliance plan out there, it's still effective. It's going to be carried out the way it was written and accepted. And if another one came along, the same thing. So I didn't see any unintended consequences for compliance plans. For minor building code violations, again, I didn't see how that would cause unintended consequences. The proposal today is about a code compliance. If we're talking about unintended consequences on permitting, that's a little bit different. This is just if there is a minor violation, then it's addressed. I don't see the exact connection for how that would cause an unintended consequence. Again, I'm not saying that there isn't one. If there is one, I would like to hear it. And if Hannah is still there, that might be able to help me respond to that particular concern. But I did spend some time thinking about the potential unintended consequences for this, and I didn't find any in my consideration of these comments and consideration of the proposal before you. She mentioned the expansion to uncodified ordinances. And yes, that's true. It would expand to uncodified ordinances. But if there's an uncodified ordinance that we haven't created yet, we can always address anything in that. The uncodified ordinances that happened before, what I was thinking about when I was doing this was the recent urgency ordinances with regard to COVID. they were uncodified ordinances. We had to draft into those ordinances specific enforcement provisions that wrapped the 1.08 provisions into it. Allowing the 1.08 itself to say this applies to uncodified law is just it's a kind of a safety net. If you didn't get it into an uncodified ordinance, I'm not always going to be the one who's drafting it. This will give you that option in the future. She mentioned that it wasn't just uncodified ordinances. She mentioned any building permits. And in her letter, she did a cite to that, and she cited to 1.08.060F. She said that we were adding, quote, any building or safety code, including but not limited to. And I went back and I thought, I don't remember adding that. And so I looked at the actual language, and I can see where she believes that we were adding that. We actually weren't. We were rearranging language. And when you look at the red line, it looks like we were adding it, but you have to go to what was stricken out. And what was stricken out was any local building or safety code. And we just put it later on in the sentence, any local building or safety code. So there's nothing new there. And so there shouldn't be a concern that we're adding anything that's going to cause any differences. That's the same as it was before. The only other language we added was including but not limited to Title 18. And that's more just for clarification. That doesn't have to be there. It's going to include Title 18 regardless. That's just by way of an example for clarification, both for the public and for county staff in the future and now. Moving on to Ms. Ramirez's comments. She asked, how will enforcement be taking place? I'm going to leave that for John Burks, and he can come back to that. How will the money be recovered? Again, I think that's a John Burks question. Can any action be taken to make a violator apply this to remediating their site? In my experience in watching code enforcement, I know that they will oftentimes pause the accumulation of penalties so that the violator can use that money that ordinarily would have gone into penalties to working on their site. If the violator isn't working with staff, penalties accrue. So that's as close as I could get to it. Perhaps John could give a better response to that. More of a my question, which is the responsible party definition. I wanted to just address it, and she didn't bring this out exactly, but I wanted to say the responsible party definition, the only really real thing we did with that was we clarified that this is going to apply to landowners. It's the way we've been applying it in the past. The way we consider it is that a landowner, by virtue of owning their property, is responsible for what happens on their land. This makes that clear and definite. The additional language beyond that, we referenced a section that regarded a definition of a landlord in a particular situation that involves a tenant that would be growing cannabis illegally. And what that does is that actually carves an exception for that particular landowner, who could be an innocent landowner that didn't know that that was occurring on the property. So rather than adding an additional restriction that was intended for a carve-out exception so that we're not targeting people that really shouldn't be targeted. And it's only a very narrow exception to the extent that they didn't know about it. As soon as they are given the proper notice and opportunity to remediate it and to address it as the landowner, then they could become responsible after that. So again, it's a very a narrow exception. I also wanted to address in that Hannah Nelson in her letter had talked about joint and several liability, and she didn't mention it in her comments, but I thought it was worthwhile to bring up. The reason we included that language was because we wanted the people that were responsible to, of course, address that penalty to us, but to be able to determine between themselves who's really responsible for it. If we didn't put that in there, the county could go after each one of them separately for the full amount of the fine separately. So instead of just one fine, it's one fine for each person that would be responsible. This would just be the penalty against all of the parties, and they determine who's responsible, but the county could collect from anybody. In thinking about it, I thought, maybe there is that rare circumstance where one party is really shouldn't be responsible for the whole part of it when their part was so small. But the nature of joint and several liability would give them an action to go against the other people to recover that. That said, if the board is not comfortable with that language and would rather it just be pulled back to not create that sort of situation, that clause can be pulled out. It doesn't really change the carve-out exception for the landowner. And so I wanted to put that out there. More specific to Ms. Ramirez's question about, there's nothing about when the land is returned. Right now, that's the case as well. That's the way it's always been since I've been here. With any code violation, if someone destroys the property and it's defaulted, it goes back to the landowner. It's the landowner who's ultimately responsible for what happens on the property, regardless of how they acquired that land. To address that here would be different than we've ever done for any other violation. I'm not saying we couldn't do it, but that's the way it's always been. And I wanted to give an example of a recent case that wasn't quite the same, but there was a situation where a landowner had done damage to the property, sold the property to a buyer who this person did not disclose what happened and did not disclose the violation. That new landowner was still responsible for the property. And we went to the new landowner and said, "New landowner, you're still responsible for this, even though the buyer did not tell you that this was had occurred on the property." And by way of example, what happened there was the code enforcement didn't automatically issue a citation. They worked with the landowner, and the new landowner is currently working with staff, and there hasn't been a violation imposed, but it's still the new landowner's responsibility to take care of the property. The last thing that Ms. Ramirez mentioned was the financial burden hardship waiver. We did two things with this. We took out the hardship waiver that currently existed and we added a different one. The hardship waiver that was there was basically a deposit or a fee to get to the hearing itself. It really wasn't working as intended. Again, we created this a few years ago. Through experience, we found that just it's more of a waste of money and it's confusing and it hasn't had the desired effect. And so code enforcement wanted to pull it out. We pulled it out. We added this new one in, however, because of state law. Since that time, state law has changed that mandates that we have a process to allow people under certain circumstances to ask for a hardship waiver, not to get to the hearing itself, but on the penalties themselves after the first citation, under a particular set of circumstances, basically financial hardship. Now, the direct question from Ms. Ramirez was, what's the evidence? What's the burden of proof, essentially? Well, the proposed changes, we've identified the burden of proof as a preponderance of the evidence, which is basically a little bit more than 50%, more likely than not. And county is not going to determine that. This is something that the hearing officer would determine. It would be on appeal, and the hearing officer, as the arbiter, would determine whether the evidence presented was more likely than not that they had a financial burden. Moving on to Ron Edwards' comments. He talked about the registered letter requirement. This is another situation where we added the certified mail. Originally, a few years ago, we thought that would be helpful. In practice, and perhaps John Burks can describe this a little bit more, but in practice, I can only think of maybe one circumstance, if that certified mail was actually the way that the notices got served. Everything that I see is either personal service or posting and mailing. Those are the mechanisms that have been working. Certified mail costs money, it costs time, it causes confusion because of the way that currently certified mail is calculated in terms of when it gets served. The code currently says it's served on the date that it's signed, which makes sense. But sometimes it doesn't get signed for a very long time. Sometimes it gets sent back. Until we either get it sent back or get it signed, we don't have certainty as to when that service occurred. So we can't really move on from there. So and like I said, most of the time it doesn't get signed. Most of the time it gets sent back. So we're relying on mail and posting regardless. So instead of continuing on with the confusion and the difficulty and the time wasted and the money wasted, we decided to pull that out to rely on what has been working. And the final thing I wanted to say about that is this is just a notice. This isn't a service of a lawsuit. So certified mail is not required. And excuse me, I need to shut my door 1 second. Sorry about that. So in taking it out, we're not depriving anybody of due process. They still have the right to have the notice, and substituted service through posting and mailing is a legitimate way to do that. If there was ever a situation where somebody legitimately didn't get it, you know, that happens from time to time. And to the extent that that can be worked out, I know that my experience with code enforcement is they do what they can. They want people to be heard. And ultimately, it's a question of working with people. And if somebody really is trying to work with code enforcement, what I see is that they're working with them right back. But again, perhaps John Burks could talk more to that. There was also mention from Ron Edwards about are the penalties put into a cleanup fund or does it go to staff? I wouldn't be the best person to answer that question, but my understanding is that that the code enforcement money does get put into a fund for future code enforcement efforts. I'm not sure exactly if that's correct. Somebody can correct me if I'm wrong. But there was a question about how that money would be recovered. It'd be recovered in the same way that we've always recovered it. If somebody doesn't pay their penalty that's owed to the county, I know code enforcement staff reaches out to them, tries to contact them, figure out what's going on. To the extent they needed a compliance, a payment plan, I know that that's always been an option that code enforcement would discuss. If really somebody is just not talking to us, isn't paying, then it gets sent to me. And what I do is I try to contact them. I tell them that so much is owed. And if they don't respond to me or if nothing happens, then what I've done in the past is I've gone to the board first to ask for permission to file a lawsuit to recover these penalties and to enforce it by way of a court judgment. I don't know if I've missed anything. Again, I can go through line by line with the letters that came in. I spent a lot of time with them yesterday to try to address those. But rather than going through each one of them, perhaps you can tell me which are more of a concern for you as a board.
No, I really appreciate those comments and those explanations about what's going on and your point of view on these issues. And so I really, really thank you for that. Supervisor Williams.
Yeah, so I also appreciate you going through all of the questions. The one that stood out for me was the certified mail when I first saw that, because I have a notice of void 5-day payment plan. And I was surprised thinking, did I miss paying property tax at some point on a parcel? No, it's not my parcel. I have another late bill for dog tags. My dog has been dead for a couple of years, reported. It's not my dog. I hear the cannabis folks talk about being told their paperwork was lost, they need to resubmit it over and over again. After seeing the disarray, the shape the files are in, the planning is having to deal with, it came from ag. I have some hesitation about first-class mail that we may be in a position trying to argue that a letter was sent from a county that doesn't have a good track record about record keeping. And so that worries me, but your explanation certainly helps on that one. Is there any ability to have a little bit more robust than just first-class mail?
Deputy County Counsel Michael McAfee, and then I'll give it to John because I know he's wanting to speak. I had given some thoughts into alternatives. I wanted to point out that when code enforcement goes out there and tries personal service first, they usually post it on the property too. So it's not usually just mail. It's usually mail accompanied by posting on the property where the violation is occurring. I think that there is an alternate where we could potentially use certified mail, but not require that to be part of the timeline for service, because it's caused so many problems with when service gets calculated. If there is if the board really does not want to let go certified mail, I would recommend stating that certified mail should be used in conjunction with first-class mail, but that whether or not it gets signed or when it gets signed doesn't matter, that service is effective 5 days after the posting and the mailing. That gives certainty, and that doesn't leave staff not knowing when they can take the next step or when it's going to be sent back, or having to recalculate timelines. as a result of that. But, I forgot that I did want to hand it back to John because there was a couple questions that I think he was better to answer, and he might have a comment about what I just mentioned as well.
If I may, Chair?
Yeah, go ahead.
So I'll just quickly touch on a few of those, but one thing I'd like to say is that, our main objective is not to go right after penalties, it's to gain compliance. Having that burden on the county to force an abatement is not helpful. We really do want to connect with these folks to try to get them in a situation where they can become compliant, because that's really our main concern. These are just leverage tools. So I certainly understand the concern, and maybe if I gave some examples of the things that we do to get a hold of people, we use every resource we have available at the county, including tax information, which more often than not is fairly good in most cases, to try to get a hold of these potential violators or property owners or any way that we can. So a personal service is always our preferred method, because that way we know that we've made contact. It bolsters our case if in fact they won't comply down the road. We typically will do certified anyway, but it creates some really burdensome timelines when the folks that want to come into compliance, usually through our efforts, we're able to get a hold of them, they connect with us, and we're able to accomplish those things. It's penalties are just, again, one tool in the toolbox to try to encourage them to come into compliance. So we'll give them every opportunity, because that's, the burden of a forced abatement is not something that we want to do. Okay, so now that being said, we're not really changing anything specifically to how we collect the penalties, like Deputy County Counsel pointed out. Violators potentially applying the penalties to remediate the site. So when we're working with them, we'll give them the opportunity to come into compliance first. We don't start out with the penalty. We say, hey, look, this is what you need to do. And if they're willing to do that, and it does require them to spend some money to come into compliance, we would much prefer that than having to go through the penalty route. But even if that were the case, if down the road, they wanted to come into compliance, but they have amassed some penalties, we could enter into a compliance plan situation, and the potential savings, if you will, of those penalties could be applied to remediation of that property. Because again, compliance is the goal. So as far as like the land going back to a landowner that's not necessarily a responsible party, that has happened, though it is really rare. And again, this is one of those things where everything's a case-by-case basis, and we always will try to give folks the opportunity to be heard. It's just part of our due process. There's several built-in layers. We just want to work with them to bring it into compliance. And there's always solutions. We're looking for the win-win there. And again, appealing citations, there's any number of ways that if they, want to be heard in that capacity, they can. Let's see here. And then as far as the penalties go collected, they do go into our abatement fund, which we use for regulatory enforcement, forced abatements. Again, we're not trying to bolster that a lot. We'd rather have the compliance. That's our main goal. So though it is fairly small at the moment, we do have it at our disposal. We typically don't go to it only because it is so limited. We'd much rather have the environmental safety and all the building codes met and be in compliance than try to bolster that fund. So I hope that I've touched on all the questions. Certainly I'll answer any additional ones that there are.
Okay, if we could go back to public expression, because Corinne Powell is on the line. So Deputy Clerk, is Corinne Powell available?
Yes, I am. Can you hear me?
Yes, go ahead, Corinne.
Excellent, thank you. In general, I am just a little concerned about greater specificity. I realize that this is multiple concepts and situations, not just cannabis, but as pertaining to cannabis, the most specificity we can get, the better. I'm curious to know how John Burks and Trent Taylor interact or don't, and their respective roles in code enforcement. And other than that, I would like to return any time I have to Hannah or Mo for their questions. I completely support MCA and CCGA's confusion on some issues and need for clarification. So I yield my time.
Chair Haschak, you're muted.
Yeah, if it's all right with the board, Hannah Nelson, if she's on and she could clarify that unintended consequences remark for Mr. McAtee.
Yes, this is Hannah Nelson. Thank you. I do have some specific examples, and they do relate not to unintended consequences of this ordinance within the context of this ordinance or these ordinances, rather the unintended consequences of those who are in the cannabis permit program application process. So while there may be a carve out, as Deputy County Counsel McAtee explained, for those who have already been given a compliance plan, those who are in application have not yet had the privilege or opportunity to have their annual permit issued and a compliance plan issued at that time. There certainly have been there's been a lot of confusion, and our concern is really about whether or not this kind of action could unintentionally pick off those applicants from being considered properly in application. So that's one of the unintended consequences. With respect to the joint and several liability, the problem is only only arises when viewed in conjunction of the definition of responsible parties, which in the memo that we submitted point out could, as written, be interpreted as applying to people like civil engineers who often have to sign documents with the county saying that they are acting as an agent. So unless there's specific language that specifically accepts those types of professionals who are helping in the context of not only building permits, but cannabis permits, anything, I think that it could be implied that there is a potential additional liability, which would only serve to accidentally discourage additional professionals from helping. And we already have such a shortage of professionals like soil engineers and other engineers who will assist people in applying for the proper kind of grading permits so that there aren't difficulties with erosion, et cetera. Additionally, another example is with respect to recording. You know, the recording provision, it makes sense to have it recorded, but the objection is really to record against the deed when it's an NOV and you're losing the benefit of full service by certified mail. It seems like an NOV could be issued without direct service or certified mail. Or if, as county counsel is, I'm sorry, I was responding to a particular question.
Yeah, Hannah, could you just wrap it up? Yeah.
Yes, I am. So the issue with respect to the NOV being recorded, really, it would be no problem if it was just the citations. With respect to immature plants, there is a complete inconsistency in the definition, and I'm particularly interested in understanding how the distinction between an immature hemp plant in that instance would be made. And then with respect to the policy and the procedure of how compliance is being advanced and encouraged rather than enforcement straight of citations, I concur that is the policy, but laws have to be written so that they are enforceable on the face of it and not just dependent on the good policy of the department.
Thank you, Hannah. Okay. Mr. McAtee or Mr. Burks?
If I may, Chair, just real quick before Deputy County Counsel responds to some of the more technical aspects of Hannah's questions, I'd just like to remind everybody that code enforcement does not make determinations on cannabis cultivation permits. That's actually handled through the cannabis program in planning and building services. Our focus is simply the code compliance portion of that. And again, we do have compliance plans specifically for those that were issued those cannabis cultivation permit. So now if there is a code violation that exists after, they apply, that might be a different story. But, again, we're willing to work with them, and that's not our purview to, deny anybody. So I just wanted to put that out there. Thank you so much.
Deputy County Counsel Michael Mackesy, if I could then respond to the additional comments that were made. With regard to Corinne Powell's comment about John Burke's and Trent Taylor's interaction, I think that's actually better answered by John. Did you want to address that before I went on, John? Yeah,
it'll just take a second. So I'm the code enforcement supervisor, and Trent Taylor's an interim code manager.
So with regard to the comments from Hannah Nelson, the first thing she mentioned was a concern for the people that are in the application process, as opposed to people that already have permits, and how would enforcement be applied to the people in the process who don't yet have a compliance plan. I think the best way to respond to this is to refer back to 10A17-100C, subsection 1C. Subsection 1D. This is the section in 100C that talks about the compliance plans themselves. That's what created them for in the context of cannabis permitting. As it stands, what it says in sub C1D is the compliance plan will be the primary mechanism to obtain code compliance from permit applicants with respect to violations directly related to phase 1 permit applications. Now, when we wrote that, I remember that the purpose for that was to acknowledge at a board policy level that we have other enforcement mechanisms, but this was going to be the primary one. And it doesn't say permittees, it says permit applicants. And it goes on to say nothing in this section is intended to limit the use of any other applicable code enforcement provision. So as it stands, if we made no changes today, right now, that risk would be out there. But the policy, as directed by the board, as codified here in section 100, 10A17-100C1D, the primary mechanism is intended to be the compliance plan for phase 1 permit applications. Again, that's not going to change when we make the changes today, if you make the changes today or accept any of them. So the risk, yes, may still be out there, but the directive from the board has told code enforcement that this is what they wanted to use first. She then mentioned, can't read my writing, she was concerned about the responsible party definition applying to civil engineers. I agree, we don't want to deter people from helping people that are trying to get into the program. The changes that are proposed today won't change anything though. The risk to anybody that would help cannabis growers at the moment will not change. The only thing that the responsible party definition changes today is clarification that it's going to apply to the landowner, and then a carve out for specific landowners with an exception. So to the extent that it currently applies to civil engineers or any other party that might help somebody trying to get into the program, there is no change being made. If Anna's request is that we make a change, the board can certainly do that, but that's not part of anything that's going to change today with the proposed language. With regard to recording, losing the benefit of certified mail, again, I'm not going to go back over all the comments I made, except to the extent that certified mail hasn't been working for code enforcement. That's why they're looking to take it out. And with regard to recording an NOV, the process is after you serve the NOV, there's a separate service. So essentially people are getting served twice before an NOV is recorded. Once the NOV gets sent out and it's determined, okay, nothing's happening, they want to record it against the property, then another notice of an intent to record has to be served on those people again. We would be taking out the certified mail provision, but again, I refer to my past comments. And in response to what Supervisor Williams had previously said, if the board really doesn't want to take that out, I would strongly encourage the board to leave the timeline for service, or not leave it, but to modify it to allow the timeline to be 5 days from mailing and posting. That way there can be a creation of certainty But if they wanted to add the certified mail and let that kind of exist as well to be sent out at the same time, we can do that. I think I've developed some language if you wanted to change that today. But my recommendation would be the same as staff, based on their interest in reducing confusion, reducing waste, reducing resources for a process that historically, my understanding, hasn't been working for them. And I say that in that it hasn't been the mechanism that service has actually achieved. The next comment was about immature plants, the definition of cannabis, and especially as that is related to hemp. And I know that the Mendocino, I believe the Mendocino County Farm Bureau had weighted on this a little bit too, saying that the definition didn't cover hemp. I went back and I looked at the definition, and I'm not sure that I agree with the Mendocino Farm Bureau. The definition for hemp is more expansive. I looked it up, and I was looking at a 2019 version of the Congressional Research Service defining hemp, and it was a fact sheet, and it puts hemp next to marijuana. And the first line in both is either the plant of the cannabis sativa L, and then marijuana is all parts of the plant cannabis sativa L. In our definition, we call out cannabis sativa L as one of those plants. So I think that it would apply to hemp and all cannabis as it's defined. It doesn't matter what level of THC content there is. If you're growing it without a permit, if you're growing it in the absence of a license, it's an illegal grow according to the definition. And to be very clear, the definition here doesn't conflict with board direction about what the definition is, because the prior definition that was given by the board, given by the state, it was all about the definition of cannabis as it related to plants being grown pursuant to a license or a permit. The definition that's proposed today in H4, I believe, 1.08.060, I believe, is the provision. Actually, let me confirm that. Yeah, it's no, it's 1.08.060 H2A. It specifically says that the definition of the cannabis plant there is only about the illegal growing of cannabis. So the definition would allow code enforcement to identify plants being grown illegally without a permit, without a license, and allow them to address all of them at any stage of the growth. And it's very specific just to the ones being grown illegally.
Okay, Supervisor Williams.
Yeah, I feel satisfied with all of the answers staff has been able to provide. And seeing that we have other items on the agenda and that it's 5 o'clock, with all due respect, is it possible for us to wrap this up and move along? Or do other supervisors feel they still have open questions?
Mr. Chair?
Yeah, Supervisor Brown.
Thank you. This has been very good, and I appreciate responses, the questions asked, the responses by staff. But bottom line, our code enforcement needs these tools. The cannabis businesses using best practices should not fear these changes. It's the renegades out there that are giving the industry really a black eye. And it could be the same with any industry or business. Good landowners that care for their land or bad landowners. Bottom line, again, code enforcement needs these changes in order to do their work. They've been very good. I don't want to deny them these changes. I will support staff on these amendments today. So therefore, I move the recommended action.
Okay. Is there a second?
Yeah, I'll second the motion and just briefly say I really appreciate staff's responsive and detailed response, and also John Burke's comment that if someone is subject to a fine, that if they are proceeding with remediation, that the county will work with them to draw down the fine as they spend those dollars instead on the remediation. I think that's the appropriate approach, and I'm glad and proud that our county takes that approach.
All right, and I'm very appreciative of that, the responses and going through this list of questions. there were lots of concerns, but I think that you guys have answered them very well. And I think that we do, like Supervisor Brown said, we do need these tools in the toolbox. So I'm ready to support it. Yeah, Supervisor McCowan.
Thank you. Well, this is quite an extensive item, and I do appreciate the work that staff has put into it. I think we heard from the public that they appreciate the work as well. And yet it is a lot to digest. And I don't see the harm of a modest delay of 45 to 60 days for the public to have an opportunity to become more familiar with all the implications of this and perhaps refine their concerns if there are any remaining. I have to note too, there's the constant push to, we can't discuss things because we're so busy discussing more important things, and yet this rather complicated, involved item manages to come forward as a priority, and I don't disagree, but we have put off and deferred so many things. If we get to it today, we'll be discussing another one under item 7A that's been put off for nearly a year. I don't see the urgency, I don't see the harm of a modest delay, so I will not be supporting the motion.
Mr. Chair, I'd like to call for the question.
Okay, so Deputy Clerk, could you do a roll call vote?
Absolutely. Supervisor Williams?
Yes.
Supervisor Jurdy?
Yes.
Chair Haschak?
Yes.
Supervisor McCowan?
No.
And Supervisor Brown?
Yes.
The motion carries with Supervisor McCowan dissenting.
Okay, thank you very much, gentlemen.
Thank you.
Okay, moving on. We item 5I, which could be a long one. So is there any will of the board to go to one that will be a little shorter? Or do we?
I think 5I has a large impact on county revenue, about 5.6 million a year potentially. And so I think we should get to it as a priority.
And I think we should dive right into it as well.
Okay, so item 5I is discussion and possible direction to staff regarding the cannabis cultivation permitting program priorities from September 22nd, 2020, and direction to staff to review additional options for the program, including potential consideration of cannabis cultivation as an agricultural activity. Sponsor is Planning and Building Services.
Thank you, Chair Haschak, board members, CEO Angelo, and Council Curtis. Brent Schultz, Planning and Building Services Director. As you know, our staff has been working hard over the last year, working with the board, state agencies, our cultivators and industry leaders to address the problems and getting through our cannabis permitting program, and most importantly, helping our permittees and active applicants get an annual license from the state. And to date, permittees and some of our active applicants do have provisional licenses, but these will expire, as you know, in January 2022. And the loss of state provisional licenses and no pathway to an annual license at the county or state will result in our current provisional license holders not being able to legally cultivate in the county. We need a solution, and we need new solutions fast. We have completed many of the directives that the board gave us at the meeting of September 22nd. And I want to commend Megan, our cannabis manager, Julie Acker-Krog, and their teams, and the ad hoc and the CO's office working so hard to help us get through those. Basically, of the 10 of those directives, pretty much all of them but 3 are left to do, 3 to 4. Based on recent discussions with the ad hoc CDFA, our staff believes it's critical that the board pause some of these directives on the 22nd, so that the department will have time to explore the possibility of cannabis as an agricultural activity or use. We're requesting this temporary pause on the following items: the digital portal, cost recovery analysis, work outside the scope of the current cannabis application process, And 3, the CDFW interagency agreement. And 4th, the cannabis cultivation guide. It should be noted, I want the board to note that that the cannabis program will continue to send out correction letters and review the phase 1 applicants. And we are doing that and not getting a very good response from our active applicants. We're going to continue to implement and kick off the cannabis equity grant. We sent out an RFQs and we're going to get those back soon and review what kind of additional consultant services we could get to help us with the phase 1 processing, as well as a discretionary phase 3 process. So we'll see who's out there and what that cost would be. And we're going to continue drafting the phase 3 discretionary ordinance, and Julia has been heading that up and that process. So we believe it's time to pause for a second. We will look at this and any other options we can come up with, and we're recommending the board pause these items from this 22nd and direct staff to look at additional options for the cannabis cultivation permitting, including the potential of consideration of cannabis cultivation as an agricultural activity. And myself, Megan Duquette are here, and Julie Acker-Krog if you have any questions.
All right, any questions from the board? Supervisor Williams.
Yeah, just to add a tiny bit more detail, I don't know if my colleagues have been following the cannabis permitting in detail, other than I think we all know it's not working. The ordinance that we have doesn't create documentation that can be shared with the state to trigger issuance of a state license. Cultivators need a state license to cultivate in California, statewide. And in our county, they're operating on temporary licenses, provisionals. Provisionals expire in 1 year. And maybe the state will extend, it'll take a legislative action to extend it. So far, that hasn't happened. Under our current model, we've worked with staff to bundle up the documentation we have. CDFA has said that's insufficient to meet state CEQA requirements. If we do additional review beyond what we used in our ordinance, we're not really sharing our work. We're creating this new work product. That's not quite right. That doesn't fit CEQA. I think Supervisor McCowan, called it when he pointed out that we would be better served with the discretionary use permits, similar to Humboldt County. When you ask why do we have this problem and the rest of the state doesn't, well, provisional, about 84% of the state is on provisionals, but we do have a unique problem in that we have a high volume of legacy cultivators. And we haven't done site-specific review adequate according to CDFA. If you go to Humboldt County, they have use permits, and their use permit path generates enough documentation to meet state CEQA. Unfortunately, if we were to staff up maybe 4 or 5 times the planning staff we have today, it would take more than a decade to bring in our current queue into the legal market. We can't imagine the state extending provisionals long enough for that to happen. So you rule out our current ordinance, which is going nowhere. It's doing nothing for cultivators, unless we litigate with the state and find that their interpretation of CEQA is wrong. Use permits just creates a new problem, a time problem. We're not going to get through it quick enough, and it's a new expense. This treated as ag. It may be a long shot, but we see other counties pursuing this direction, and it may have some hope. The ad hoc feels that it should be explored. We don't know if it'll be an answer, but we would like authorization to use some planning staff time to further research it to see if it would help us. And then last, cultivators have asked over several years, can they do full sequence, submit it direct to the state? And we weren't sure. The ad hoc has resolved that question. CDFA agrees, it's in regulation, cultivators can do that. And so essentially, instead of using the shortcut where the county shares the site-specific review it's conducted, the cultivator can work direct with the state to get their state license and provide full CEQA. The drawback with that is the cost. We don't think it would be less than $10,000. I've heard estimates as much as $80,000. This is per farm. There aren't enough consultants in the area. We have 1,100 in our queue. If they all rushed out to use the available consultants, it would create a backlog. Further, CDFA calls this the nuclear option. They would prefer it not happen. because they don't have staff to process these. Other counties have local control that provides documentation adequate to meet CDFA CEQA responsibility. So they don't have staff dedicated to processing. It would be sort of this one-off for Mendocino County because we don't have an ordinance that's workable for the state. So I think questions are welcome, but in the big picture, we're at a standstill. I don't think there's a decision to make about whether we pause this effort. Effectively, it is paused. It's not going anywhere. I've equated it to Humboldt, where Humboldt and Mendocino are heading to San Francisco. Humboldt is moving 5 miles an hour. Mendocino County is moving 0. So let's open it up to questions.
Well, I'd just like to add to what Supervisor Williams said, is that we do have a meeting tomorrow with CDFA. The ad hoc has a meeting with CDFA and representatives from Senator McGuire and Assemblymember Wood's office. And we're looking, trying to continue on with these attempts at finding a pathway forward. One of the things I think in the recommendation that the ad hoc is in agreement on is that we need to be pursuing all pathways, to see what we can do. And if it includes considering, cannabis as an agriculture activity, let's see. We tried to have a meeting with CDFA to clarify that before this meeting, and they wanted to wait until this meeting tomorrow. So hopefully we'll get some clarification from them tomorrow. But I think that one of the items that has been recommended to pause, that we don't want to pause, is the agreement with CDFW and the biologist contracts, because that is something that we've committed to with the people in the permit program, and it needs to happen. It will help everyone in the long run. And if we pause it at this point, it won't be good with our relationship with CDFW. And I think that we're only going to pay for the amount of work that's done. So it's not like we're approving a huge contract that's not going to be worth it. We're going to pay as needed. So I would agree with the recommendations in this, but I think that we need to pull out the CDFW pause, and we need to continue on with that work.
And I think John is speaking for the ad hoc. I too support that. I don't know if this sensitive species review will help applicants get closer to their state license. I think it probably won't, but they already paid the county for doing this work. Of the approximate 272 permits we issued, 190 of them, we skipped over this critical element in our own ordinance, which has created a problem when we try to do this Band-Aid approach to meet the state's requirement. One of the boxes is our sensitive species and habitat review. And while we made a mistake at some point, and our cultivators have vested their right to cultivate based on our issuance of the permit, that doesn't help with the state process. And so I guess I feel like no matter what happens, we have hundreds of people who paid for work that wasn't conducted. It's our obligation to continue forward with it. So I would agree with John, we shouldn't pause that effort, but I think we should pause all of the other items.
Chair Haschuk.
Yeah, Supervisor McCowan.
So I think I have a little different view of what the applicants have paid for. The applicants, hundreds of whom came forward in the first several months after adoption of our ordinance in 2017, paid an application fee to have their permit applications processed on a ministerial basis subject to our adopted ordinance, which was supported by a mitigated negative declaration. A couple of years later, the state adopted a provision that they would only issue a permit that had site-specific CEQA. That wasn't provided for in our ordinance. Nobody paid for that work to be done by the county. and this is one of the items that has been deferred, is who, if anyone, shall pay for this work and who shall conduct it. These were questions raised by staff previously, and the board cut short that item without answering the questions and giving guidance of, do we expect these applicants to go out and hire a consultant on their own? Do we expect them to do the work themselves? Would the county do it and they pay for it? That issue never got resolved, and I think that's one of the issues that is recommended for deferral. So I would like to go to staff if we could, and the question is, do they agree that the applicants have already paid for the county to do the environmental review that is now required by the state, and is determination of who shall pay for this work, is that one of the items recommended to be paused?
Supervisor McCowan, just to add clarity, I think you may be mixing two items, and it's my fault for not explaining it more clearly. The item that the ad hoc is recommending that we not pause is the sensitive species and habitat review. That is a requirement.
Yeah, no, I understood that. I understood that.
And our environmental document. We're not suggesting that we do that work for the purpose of the state CEQA problem. We're suggesting we do that work because applicants paid for the county permit, and that effort was part of the county permit.
Yeah. Chair Hashik,
again,
if I could address
clarification from staff.
If I could address the board on that, Chair Hashik.
Go ahead.
The sensitive species review we continue to do as we're going through the current active applicants. That is that pilot policy that Megan and Trent developed that we got approved by, that took us a year to get approved by CDFW. We're doing those now. We're not saying we're going to pause that. What we're saying pause is the interagency agreement and we've sent them a scope of work. They are working on it. I cannot push that project any faster. I don't even know how quickly they'll get back to us. We've been asking them, but it's going through their internal county council and their processes of that contract. And by the way, we will get that. They will send that back to us, but we're saying we should pause that right now so we can focus on getting back to you on this ag analysis. But the sensitive species reviews are happening. But the problem is when we can't self-check that off, and we have to send it to them, they don't have a lot of staffing to do the sensitive species review. That's when the biological studies may happen and their costs accrue. They want to hire 2 scientists, and the current estimate is $238,000 a year. We don't have any funding for that. So, I can continue to talk to them, and I can bring that interagency agreement forward if you want, or our staff can, but just so you know what's coming with that sensitive species review interagency agreement. It's being worked on by them.
So follow up, for $238,000 a year, how many applications would they be able to review for sensitive species?
This is Megan Duquette, Senior Program Manager through the chair.
Yeah, go ahead.
I don't have an estimate, Supervisor McCowan, in terms of how many applications they could get through. This is a best estimate for 2 environmental scientists to work for 1 fiscal year. That's the estimate that we've been given. And so I don't have a definitive number of applications. This was just for those folks dedicated to this cause. I hope that addresses your question.
And this is for sensitive species review, and does that get us to the point of site-specific CEQA, or is that still what staff, I think, has identified as a very costly item, still remaining to be determined who would pay for that?
Yeah, that's, if I could address that, Chair. Brent Schultz, Planning and Building Services Director. Supervisor McCowan, the CEQA checklist is a wholly nother process 15 to 30 hours each. We think it could take up to 30,000 hours for all these applicants to get through. And I think it's a multi-million-dollar process. I think we need probably conservatively 16 to 20 or more planners to process those, and that CEQA checklist would go on and on and on and on. Every time the cannabis cultivators change their sites, which they do a lot, we'd have to change that document. We may have to change the sensitive species review. We don't know yet because we haven't gone through the process with CDFW.
And is that point 2 in the last paragraph, cost recovery for work outside of application scope?
This is Megan Duquette, Senior Program Manager through the chair.
Go ahead.
The cost recovery was specifically looking at different amounts of time and looking at our fee schedule to address that. To kind of give you a little bit of update, we briefly spoke with County Council about this, but we would suggest that we pause looking at cost recovery in terms of both the application as well as depending on the board's direction in regard to the CEQA checklist or Appendix G, or any changes that are given would definitely change the way we would approach a fee schedule and potentially a fee schedule hearing. And so that's why we're recommending the pause.
Well,
if I could jump in there, Supervisor McCowan, that the question about how many SSHRs, the sites or sensitive species and habitat reviews these biologists could do. From our conversation with CDFW, it sounded like they could do one biologist could do 2 a day. And if we're only referring the real trouble cases with the pilot program, we'd only be referring the ones that were really questionable. Then it certainly wouldn't be 1,100, it could be several hundred. If we have several hundred and we're doing, one person's doing 2 a day, that would be, say 200 work days in a year. And so we're talking about less than a year. What we tried to get is several biologists so that we could do it in a shorter span. So if we can do the work in 3 months and their work is done, then we're done. That it's not $230,000. We don't pay for the whole year. We would just pay for the time that they spend, dealing with these. So that's kind of the issue is, do we go ahead and complete the process that was supposed to be completed for these applicants, for the people who have permits and in the system?
Well, if I understand correctly, that would complete the sensitive species review. It would not provide site-specific CEQA, which I think we were just told would require 16 to 20 planners.
Right, and that's a different issue.
Correct. And I guess there's a couple of issues here. One, an update on the progress being made in working with the agencies. And you and Supervisor Williams have been incredibly diligent and persistent in working with the agencies, with staff. You've had multiple meetings, and yet it still sounds as if we haven't yet had a breakthrough and we're still at impasse. Is that correct, that at this point we really haven't resolved how we're going to satisfy their demand for site-specific CEQA?
Supervisor McCowan, that is accurate. And in a couple of meetings with CDFA, I've asked them what they would do in my place. How do they recommend we get these 1,100 in phase 1 to the annual license stage? And there are no answers. The Prop 64 and SB 94, all of the regulation has been focused on new cultivation, probably in counties with land that's already disturbed, zoned as ag, commercial agriculture. We have a unique problem in that we have people who have been cultivating for decades, and getting them through this same process without state support looks impossible. When we ask our state partners for guidance, we don't hear answers. No, with unlimited time and unlimited budget, we could probably figure out how to connect the dots. But when you apply the available time and the resources in our area and the funds we have to work with, none of the paths look viable. The only hope, and it may be a long shot, but the treated as ag notice of exemption, that may work, may help us. But without having staff focus on that path, we won't know.
Thank you. And so let's come back to that issue of designating it as ag, and is that the silver bullet? But I think I hear you saying very clearly, we're at impasse. We don't know the way forward. The state doesn't know the way forward. And yet the board has repeatedly given direction that we move forward with a land use permitting system, which would provide site-specific CEQA. That's a clearly identified path forward. There are obviously questions: who pays for it? How much time will it take? But it would move faster than the 0 miles per hour at which we're now traveling. But I'd like to ask about the 1,100, because we have 1,100 or so applicants, some of whom we don't really hear from much, except it sounds like they're paying their taxes, and thank them for that. But the information that I had from staff when I was working with them back in May is that there's a very real concern that there are several hundred of the applicants, it could be 300, possibly more, who will never be able to get a permit from the state. They paid their application fee one time, they're paying their taxes. Some of them may have gotten a permit from us. They're not going to be able to get one from the state, and we haven't really sorted those people out. So that's one cohort, the people that simply aren't going to be able to get a permit. We have a second cohort. There may be people who can get a permit through our current ordinance, although it's turning out to be quite a struggle. But there could be some number based on their site conditions and so forth, may be able to qualify. And we certainly want to get those people through the easiest pathway possible. But then there's a third cohort, which from my conversations with staff, could easily be 50 to 90% of our applicants. Their only hope of getting a permit, unless the state relents, would be a land use permit system. And that's what we're not moving forward with. And that not only what would benefit the majority of our current applicants, it's also what is required in order to open up phase 3. And the board has repeatedly given direction that phase 3 will be a land use permit system. There will be no issue about site-specific CEQA. Anything that needs to be conditioned can, or the application rejected if it can't qualify. So there's an imbalance of the amount of resources we're directing towards the people that are at impasse and the lack of resources directed to moving forward with a functional ordinance.
Okay, any further comment from the board before we go to public expression?
Yes, Chair, do we have Jesse Davis in the call? I'm wondering if he could briefly share with our colleagues the findings of the 20 or 22 sample Appendix G pilot program.
Here, do you want me to get Supervisor Williams, this is Julia Acker-Krog, Chief Planner, and Jesse Davis is not in the room here with us at the moment. I can briefly summarize, if you like, that when we went through and looked at the various applications, there were certainly challenges identified in just about every application that we looked at for getting through a particular sort of streamlined group. Oh, and we just had Jesse Davis walk into the room here, so I will let him continue.
And if you may, Supervisor Williams, could you repeat the question, please? I was just coming in from my office.
So the ad hoc has had the public asking for details of what happened with that pilot program of about 20. Can you, and I know, but it's better in your words, can you walk us through, or how would you group those 20 into different categories of what worked and what didn't?
Most definitely. This is Jesse Davis, Senior Planner, and I'll also defer to Megan Duquette to kind of give the overview. But with those 20, we were able to review and process 2 of those ultimately for to the satisfaction of the California Department of Food and Agriculture. So out of those 20, 2 were able to go through that process entirely and be provided with the necessary site-specific documentation to satiate the requirements of CDFA. The other 18 we found to be in varying states of application progress. Some were missing components, some were, had information provided that was contrary to what was stated in their application. And we found that overall the application materials were quite difficult to process. So again, out of the 20 we reviewed, 2 were able to successfully be processed to the satisfaction of CDFA. And to give you a time estimate on the processing of those, they each took about approximately 12 hours to facilitate independently. So that is highly variable, however, because one of those sites was in Covelo, the other site was in the Willits area. But I'll turn it over to Megan to kind of summarize the remainder of that application review.
This is Megan Duquette, Senior Program Manager, and I think what I would just like to clarify is that we specifically looked at a group of 20 folks with an issued permit, and that the CEQA checklist is what Jesse Davis was specifically speaking to. And we discovered that there were a lot of potential things that had come up in the application materials. Many of those things, I would say, made it very difficult to do the research and to get the background per file in order to review it and see if they were ready to be basically go through the CEQA checklist process. And if you have further questions, we're available.
Do you believe that sample of 20 was truly representational of the 1,100? Chosen at random, and the 10% that got through would be representational of what we could expect out of the whole?
This is Megan Duquette, Senior Program Manager for the chair.
Yeah, go ahead.
I guess, Supervisor Williams, I do believe that that is a good sampling, and I believe that's accurate. We picked these at random, and I do believe that that is the likely statistics for the entire permit T pool, and Jesse Davis might have some additional comments.
Yeah, just Jesse Davis, Senior Planner, and I'll affirm that as well. This sample was selected randomly. The applications varied in terms of the cultivation size from cottage to 10,000 square feet. They also varied in the type of cultivation style for both mixed light as well as outdoor, as well as nurseries. It really did span the spectrum.
Chair Haschuk.
Yeah, Supervisor McCowan.
Thank you. So then if I may, 2 out of 20, and if it is representational, and I appreciate that it was random, and it would appear that the 18 would have a great difficulty getting through the environmental checklist and therefore qualifying for a permit on a ministerial basis instead of having to have conditions attached. That seems to bear out that if we continue focusing only on the current phase 1 ordinance, potentially up to 90% of our applicants will not qualify for a state permit. Is that an accurate conclusion to draw from the data that you've presented of 2 out of 20 appear to be able to get through the checklist?
If I may, through the chair.
Go ahead, staff.
Jesse Davis, Senior Planner. I would agree with your assessment, Supervisor. The remaining 18 would be difficult to process. They feature an array of shortcomings. Some may be closer than others, but there would be difficulty in providing a singular answer to those 18.
And if I may, Megan Duquette, Senior Program Manager, I would say that the amount of time in order to fulfill it would be a significantly greater. It would be more likely a 36+ hour activity to actually complete that. And mind you, as Director Schultz had mentioned earlier, any changes to the site would require staff to do this annually to update it and provide additional time to produce this document for the applicant to submit to CDFA yearly.
And to build off of Megan's statement, Jesse Davis, Senior Planner, I think the difficulty and my response to your question was how much time is unknown. And I think Megan is right on with regards to the fact that some of these applications, those other 18, could take up to 36 hours. The amount of unknowns is part of what staff had difficulty ascertaining in the back and forth with applicants and the review process that was engendered. The unknowns in time, the unknowns in applications, that's really where the hesitation from staff is coming, because we just don't know how many unknowns are out there with some of these applications.
And I do have one more thing to add. This is Megan Duquette, Senior Program Manager, is the amount of hours does not equate the duration it will take to complete the CEQA checklist. A lot of the documentation or questions we need clarification on in order to do this requires the applicant to respond in a timely manner in order to accomplish that.
All right, with that, I would like to go to public comment. So, Deputy Clerk, do we have public comment? We have Hannah Nelson on the line.
Yes, we do.
Okay, Ms. Nelson.
Good afternoon, Supervisors. Thank you for staying so late. Also, staff that is hard working transcribing this. MCA is definitely in support of exploring every avenue possible simultaneously. MCA also recognizes the need for staff to pause certain items. We do absolutely support the redesignation of cannabis as an agricultural crop and an agricultural activity, regardless of whether it's going to be the panacea for the CEQA issue. It's about time that cannabis be treated with parity with other agriculture, and particularly now that this county is moving forward on hemp. Regardless, though, we do feel that it is imperative to proceed with the contract with CDFA. In particular, Director Schultz was saying that they're waiting for a response from CDFW. So if they're waiting, then that gives them a pause. There's no need to pause a contract for a requirement in our ordinance that is irrespective of the CEQA issue. It's been a requirement. If you all remember, I specifically advocated to take it out of the ordinance. You chose not to. It's in there. Permits were granted. It was not done. It needs to be done. So delaying the CDFW contract will not help that. Additionally, I think that a practical view of where we're at is helpful, but add to that the financial view, which is that if CEQA stops, the state can pull, not only allow the existing provisional licenses, 811 of them for this county, but they could actually pull the current licenses, and all of that money will be gone from the county coffers. So I think it's imperative in whatever is done that we keep all balls in the air, all avenues towards some CEQA solution, as well as switching to a new system for new applicants, everything going at once. And otherwise, there's going to be a significant gap. Finally, the other thing is, and I understand that there are varying degrees of applications, but I have to say from my personal experience, and I know that of other MCA members, that we're getting these 30-day action letters and turning around and responding to them immediately. So to constantly characterize the situation that there's not people aren't responding is inaccurate. And you have to remember also the county has repeatedly sent things to the wrong email address or wrong mailing address, etc. So I just really want to caution that people are responding. And when you send out an action letter and call it a corrections letter, when you're really asking to update information and to fill out 2 new forms, perhaps that has an impact as well. At any rate, I hope that the board can consider the fact that it's imperative for purposes of people being able to keep their current state provisional licenses that the CEQA train not stop. It's imperative. And that means in this instance to go ahead and proceed on all levels at once. But we support the idea of pausing on some of the items and certainly the redesignation of cannabis to ag.
Okay, thank you.
Question, Mr. Chair?
Yeah, Supervisor McCowan.
Thank you. And certainly we want to try and get all the applicants through in the best means possible, but based on all the discussion about the ongoing impasse with the state, the lack of any resolution, I'm not hearing a lot of hope that we're on the brink of a breakthrough. What do you propose that we offer these people? Because if they can't get through phase 1, they won't be able to get a permit at the state. They'll have no fallback. Sounds like, so anyway, what solution would you recommend? We're hearing 90% or more might not qualify under the current ordinance.
Ms. Nelson. Is Hannah Nelson still on the line?
We're bringing her back in.
Okay.
Hi, sorry, I was trying to unmute. Yes, thank you for the question. I think that, again, it's an all cylinders, operating on all cylinders at once. First off, I am not sure that many applicants would not qualify. I think it is a matter of whether the files are in a disarray and whether project descriptions would take too long. There was a bill actually introduced by state legislature just yesterday that will extend the provisionals. I don't think that is an answer to the issue, because it still is a question of how much will it really take to get there, how much money and time and effort, whether it's, no matter who pays for it, if it's the applicant, the county, the state, whoever, or who does the work. But it is a start. There is a spot bill that has been introduced. It's likely to change in terms of the amount of time that it extends provisionals, but it certainly gives a gasp of air to the possibility that provisionals won't expire. So it's important to continue to pursue all of the avenues. Separately, this designation of cannabis as agriculture, I strongly believe that, first off, if the ad hoc is meeting with CDFW tomorrow, they might be able to get a nailed down answer from their perspective, but I wouldn't stop there, and I would get council to specifically form an opinion about whether or not a local designation would solve the CEQA problem. And then additionally, that would give leverage for the state to redesignate, which we know would solve the problem. The more jurisdictions that redesignate, the more likely the state will redesignate.
Okay,
Finally,
Ms. Nelson?
there's also one other item, and that is that this county stood on a hill and defended its path forward, issuing a notice of exemption and a mitigated negative deck, which found that the impacts were less than significant, and therefore notice of exemption could be issued. And I believe that the county should explore the option of defending that, and whether or not, and checking directly with the Office of Public Research,
30 seconds.
whether or not that interpretation is accurate, and whether or not state licenses even need that anything other than that notice of exemption.
Okay, thank you, Ms. Nelson. Okay, we're going to move on to next public comment, Sarah Bodner.
Hi, can you guys hear me?
Yes.
Great.
Go ahead.
I'll be brief in the interest of time because I know it's late. Firstly, I'm Sarah Bodner. I'm representing the Cannabis Business Association of Mendocino County. And it is absolutely core to our mission that cannabis be considered agriculture in both policy and practice. And we totally support the exploration of this direction. For reasons that are well understood, our cannabis program is really hamstrung right now, and cultivators are facing kind of the continuation of regulatory prohibition without options. And we know Mendocino is a really unique circumstance, and we hope that you will look into this, see if there's any merit to it, that it could be a direction for us, and consider resourcing the solution, perhaps with outside counsel, whatever it takes to get some definitive answers, because that's what the cultivators really need going into next season. Like, is there a pathway here in Mendo for actual state licensure? We appreciate all the efforts of the Cannabis Ad Hoc, the staff, and the board to keep finding solutions. Thank you.
Okay, thank you. Monique Ramirez.
Hello, this is Monique Ramirez speaking on behalf of the Covelo Cannabis Advocacy Group. We support the ad hoc's recommendation to not pause on the work with CDSW and the interagency contract work. It's imperative, especially because in order for somebody that is only operating on an embossed receipt to get their county permits, they're going to have the sensitive species and habitat review done. And so that all that work that's been activated between the ad hoc and CDSW needs to not be halted. So let's continue to see that happen. We too share in the desire to see cannabis move towards an agricultural designation. We will have concerns around what that implication can mean as that unfolds. And we've outlined a lot of our questions in the memo that we hope that staff will address as they hopefully will get granted permission to explore this with or without this helping our CEQA problems. I want to speak specifically also to the Appendix G 20 test cases. It felt like there was a point where it was actually halted because staff was getting more direction from maybe CDFA to possibly streamline the document itself and maybe not require every single checkbox. And so I think there was a point where some of that wasn't continuing forward. And then I don't really understand what happened. I personally gave my own information and tried to fill out the Appendix G document to the best of my ability, and I don't know where it's landed. And it's just disheartening to see that we haven't found an answer yet. And I do agree that we need to figure out which way is the right way. And if the land designation or the land use permit process is the path forward, ultimately, then of course, I think everybody is going to jump on that idea. But the problem lies with time and cost, which are the two things that are basically the thing that's prohibiting us from moving forward ultimately. And even if the state acts on extending the provisional deadline, I'm really concerned of what this kind of thing is going to cost.
30
and if
seconds.
we have to all do initial studies on our properties, and it's also really alarming to hear stats about potentially many people not being able to make it through no matter what, no matter how much money they throw at it. Their property just won't meet the requirements. And it's unfortunate that we don't understand that now, so we can let people know to stop doing what they're doing, stop building out their business, because they're not going to make it through. I just am really appreciative of the ad hoc. CCAG is also appreciative in the work that everyone's been putting forward to make this work. And we don't want to pause on any avenue that's working towards finding a solution. So because the thing is if we pause to go explore this other thing and it doesn't work.
Okay, thank you, Ms. Ramirez. Anna Stockel.
Chair Hashtag, it doesn't appear she's on the line at the moment.
Okay, Ron Edwards.
Yes, Ron Edwards, Willett. Can you hear me?
Yes, go ahead.
Yeah, I'm quite concerned that through a number of meetings, it keeps coming up that it seems that the county has identified cannabis businesses that won't make it through. And I'm concerned that have these businesses been notified? Or are they continuing to pay fees and taxes not knowing that they're in a dead end? The second concern I have is with the ag designation, which I think is long overdue. Will this bring fees for structures, F1 type buildings in line with general agriculture? In other words, will it remove the fees for hoop houses? Thank you. Looking forward to some answers.
Chair Hashtag.
Yeah, Supervisor Williams.
Yeah, all of these, all this public expression is right on target. I think what happened is the county came up with a permitting system and gave cultivators the impression and the public the impression that this is the hard part. You get your county permit and there's this additional state license. We have to figure out CEQA, right? That's a little extra work. When in fact, being on this ad hoc for a few months, I now understand the state license is the big piece. That's the core. And our county permit is almost irrelevant. If you don't have a state license, you're not cultivating in the state. And so we added a bunch of hoops on top of an already difficult process. We have people getting through our hoops, but none of that leads them up to get this state license that they need. And so the fee schedules, the details, the zoning, the rule, none of it will matter in a year if we have only illegal cultivation, which is where we're headed unless, and I think this is what Supervisor McCowan is pointing out, that the ad hoc has not come up with a solution. Our state partners have not offered one. We have some long shots, but there's no clear path in front of us.
Okay, Supervisor Williams, we're on to public expression. So Devin Jones.
Thank you, Board. Devin Jones, Executive Director, Mendocino County Farm Bureau. And I'm going to respectfully disagree with some of the previous commenters. Mendocino County Farm Bureau does not agree that the county should move forward at this time with redefining cannabis as an agricultural activity. And let me just mention a few reasons. One, it's going to conflict, I think, with what's happening at the state level and how cannabis is currently defined as an agricultural product under Business and Professions Code, not necessarily as an agricultural commodity under Food and Ag Code. There are other significant programs connected to the definition under Food and Ag Code that aren't covered, that CDFA administers for traditional agricultural commodities that won't be applied to cannabis. And I think really the root of this is going to be at the federal level, okay? And I understand the complexities behind this, but if this becomes decriminalized and becomes on par, similar to the situations we've just seen with industrial hemp, I think this is a whole different conversation. But CDFA at this point in time really needs to be considerate of federal designations, or there could be implications for them regarding federal funding for a significant number of programs that come to their department. So that's just something to bring up in that discussion tomorrow. And I looked at the Santa Cruz County example that was provided to me. There wasn't a whole lot more background information provided with this item, but in talking to multiple contacts down in Santa Cruz County, there was nothing that I could find that verified that CDFA had actually made the statements that were brought forward from Santa Cruz County regarding the fact that they are considering cannabis cultivation to be an agricultural activity at this point in time. Now, that's being said, I think CDFA needs to bring that forward at the state level to have that conversation and not on a county by county basis, perhaps by different staff members with different interpretations. So at this point in time, I think that the county would be premature in moving forward with this designation, and I think it possibly could create additional conflict at the state level. So, you know, when these ordinances were moving forward at the county level and when the regulatory frameworks being developed at the state level, we brought up significant number of times that be careful what you ask for. CEQA is a horribly complex process, and I don't know if this designation to an agricultural activity is really going to give the county more leeway to provide a categorical exemption for CEQA. So all of these things need to be brought forward and discussed before a decision is made. Thank you.
Okay, thank you. And Corinne Powell.
Hello, thank you. Lots of things to discuss and way too little time, but the main thrust of my thoughts after listening to various comments today all day long is that this is not the time for the board to make any concrete decisions without further input from CDFA as to the following. We, the county, have an ordinance, one that can be changed. The board can change the ordinance. We also have no information, at least back to me, and I've talked to ad hoc members about this ad nauseum recently, but why does Nevada County have not a requirement for site-specific CEQA for their cultivators, and they have been approved under an EIR and a questionnaire system? If the questionnaire system is so rigorous, I believe that it's only fair that those of us who might qualify be informed as to what's going to be required. That would be huge to hear from CDFA. I'd like to have the ad hoc question why some of these other counties are avoiding site-specific CEQA with either the combination of a mitigated negative deck and or questionnaire and an EIR. Monterey County has a mitigated negative deck. So there must be a way. I agree that the PBS can pause on several things, certainly not the sensitive species, but I'm also very concerned that we're losing Brent, who has been a cheerleader for the land use program, and land use permits, as Supervisor Williams has explained on several occasions, does not pencil out in the ability of, and staff has claimed the same thing, we don't have the ability to process land use permits in any reasonable time frame. I want the county to discuss, move forward with those of us in phase one who we supposedly were your first priority, but postpone until there's a new set of supervisors in about, 2 months, a little less.
30 seconds.
There's a new planning director, and some of these other issues with state agencies have had more time for evolution. Thank you.
Okay, thank you. Are there any other public comments?
No, there are not.
No?
No, there are not.
Okay, back to the board. And I just like to, yeah, I just want, before you go, Supervisor McCowan, I just wanted to clarify that I don't think we're looking at a decision tonight. We're looking at just pausing some of the programs that are taking up time in the cannabis department. And, you know, we're trying to get more information. So the information gathering will take time in and of itself. And so that's kind of the pause, is to be able to get that information, bring it back to the board, and make a clear decision. And certainly Supervisor Williams and I are meeting with CDFA. We're trying to see what's possible. We have that meeting tomorrow. We'll explore these options. And so I think that's where we are with it. Okay, Supervisor McCowan.
Thank you, Chair Haschek. I agree with you. And that's the nature of this item. We're not making a decision per se. We're requesting more information about what are the implications of pursuing cannabis as an ag activity. And my concern, and I fully support that, I have no issue with that whatsoever. My concern is what is the basis for believing that this provides a CEQA magic bullet? Because many of our legacy cultivators are on somewhat difficult sites. It's somewhat steep terrain, proximity to stream courses, a host of issues. And then the question's been raised by the sample study of 20. Many people are doing something differently on the ground than what they described in their application. It might have been accurate when they submitted it. They've made changes since. How does designating cannabis as an ag activity resolve environmental issues for somebody on a difficult piece of ground? So I'd appreciate any discussion of, is there anyone on staff that thinks making this change, oh, it's ag activity, which does tend to put us in conflict with the state, but does that get us further down the CEQA compliance pathway for county council?
To weigh in?
Yes, if I may, through the chair.
Yeah, go ahead.
So thank you, Julia Acker-Krog, Chief Planner. And I just want to really reiterate, today we're solely looking to direction so we can fully vet out this approach as in terms of an agricultural activity. I know there was comments provided that folks have reached out to other jurisdictions that may have done something similar and not quite seen how the dots connect. And what we're asking for is that opportunity to be able to review this, look at how we could potentially permit activities for cultivation through this approach and be able to look at how we can resolve any of the CEQA concerns. And, it may not be that it is no documentation required at the local level if we do this as an agricultural activity. It may be some amalgamation in the middle. And today we're solely asking for direction to explore that and be able to answer those questions that we hear from the public and the board. Without the direction today, we really would not be spending our staff hours, our limited staff hours looking into this, as we have to really prioritize and respond to the direction received by the supervisors.
Okay, any further comments? Is there a motion from the board?
Well, I do have a further comment. It's pretty obvious from the discussions we've had over the last several times that this issue's been on the agenda. Tremendous resources have been expended trying to negotiate this impasse with the state agencies, and it's essentially gone nowhere. There's been a very limited amount of resources devoted to developing a land use permitting process, which is a clear path forward. Yeah, it costs money for the application, and potentially equity funding could be used for existing applicants. I would certainly support that. New applicants coming in, wanting to apply, I think would be happy to write that check. We've been holding off anyone not a legacy cultivator from getting into the program for 4 years. We will continue to hold them off if we don't have a land use permit process in place. Again, the board's repeatedly given direction. We need that in place for phase 3. So, we're expending a lot of activity here, resources, getting nowhere. We're not traveling down the pathway that would actually lead to a resolution. And I just find that to be very unfortunate. I'll move the recommended action.
Well, which is discuss recommendations and provide direction.
Well, Okay, so the recommended action, I believe, is to authorize staff to pursue agricultural,
Supervisor,
to pursue cannabis as an agricultural activity and to pause the 4 items mentioned.
yeah, and Supervisor McCowan, if you would like to augment that with some focus on the use permit model, I would support you in that. I think we need to explore all options because we don't see a path that's certain.
Well, actually, so I offered a motion. I think we need to find out if there's a second or not.
I would second it.
If I could just speak to that, I think that, you know, again, we're trying to explore all options. And if we put a halt on the CDFW contract and working that out with them, it's going to set us back months and months and probably do some real harm to our relationship with CDFW. And I think it's not doing justice to the people who do need that SSR. So I would say we need to pull that out of this motion.
So Supervisor McCowan, that SSHR applicants arguably have paid for, and they need it even if they're just in our permitting program and they can't get a state annual. If the state provisionals are extended a couple of years, we don't want to boot them out while they look for other pathways. And so I think I'm with the chair. Would you be willing to modify your motion to exclude halting the contract with CDFW?
Well, let's look at that a bit. I heard the argument earlier that this contract, although it's stated on an annual basis, really would only be for 3 months or something. But I've also heard from staff the purpose of this agenda item and of pausing these particular items is to give staff time to pursue the question of what are the implications of cannabis as an agricultural activity. I would expect that to be a temporary endeavor. I would hope there would be a concrete answer within 45 to 60 days on that question. I've also heard staff say sensitive species review is continuing. Now, the issue of the contracts with CDFW to do it is thought to be a way to expedite it. But currently, it sounds like we would only be expediting them into a dead end since there's no state annual permit waiting for them at the end of the process. So I don't see the harm in a temporary pause to that contract as well while we explore cannabis as an ag activity. So I do not support an amendment to the motion.
May I add another detail that for your consideration? We have cultivators who need to renew. And today we tell them they can't renew if they don't have sensitive species done. And we don't have a way to do that sensitive species review. We don't have a biologist. And so without this contract, it means we may not collect revenue. We may lose more in lost taxes from our own cultivators who are now telling can't renew because they don't have a sensitive species that we should have done, but we managed to skip over 190 times.
Mr. Chair, may I ask staff for clarification?
Yeah, go ahead.
Well, I thought I understood staff to say that sensitive species review continues. So these applicants that are coming forward for permit renewal, are we able to do sensitive species review on them or not?
This is Senior Program Manager Megan Duquette. We are doing sensitive species habitat review of the questionnaire using the pilot policy that was agreed upon with CDFW. So yes, the staff is doing that review. However, if we do need to submit a referral to CDFW, that process may take additional time because of the limited staff that's currently available to do that from CDFW. I hope I clarified that question.
So we refer them to CDFW and then there's a bottleneck over there And so we're going to have an agreement with them for them to hire scientists to do the review that they should be doing anyway.
So I feel like I need to clarify that further. This is Megan Duquette, Senior Program Manager. So through the pilot policy, staff has the ability to do the review, and based on the responses in the questionnaire and the review of the site, we have the ability to approve the project per the pilot policy. However, if there are certain requirements that aren't basically through the policy that can't be met by staff approving it, we do need to submit a referral to CDFW to do the review, which could lead to biological surveys of the site and other types of reviews that CDFW may request.
Would it seem to cover, well, a potential amendment to the motion? Would the concern raised by Supervisor Williams, and I suppose it's a question to you, is that concern resolved if we, until we know what direction we're going, we pursue the contract with CDFW, but we limit referrals to those permit applications that are up for renewal where staff is unable to complete the process unilaterally?
Yeah, what the ad hoc knows that you're missing is, I think the county never realized that we put the sensitive species habitat review requirement in our environmental document and our ordinance. But when we refer it to CDFW, and we call out CDFW in our language, so we can't do it ourselves, right? We have to refer these. We don't pass along a fee. We don't collect a fee for this. So the requests stack up at CDFW. They don't get any money for this. You can imagine how quickly they're going to.
Okay, let me try again, if I may. Does it work if we limit the referrals currently to those permits that are up for renewal?
Yeah, I think that works.
I'd be willing to amend the motion to incorporate that change.
I accept it.
Okay, any further comment about the motion?
Mr. Chair?
Supervisor Jurdy, and then Supervisor Brown.
Yeah, just briefly, I want to thank the ad hoc and the staff for digging into this as much as you have. I think you've all collectively, clarified many of the issues that are kind of underlying the sticky wicket nature of this program, both at the county and at the state. And so I wish you all luck in your upcoming meetings, and hope you're able to break through on these final issues. Thanks.
Okay, Supervisor Brown.
This is an opportunity where instead of coming to you and trying to get your support, I'm really coming to you asking for your advice. What do you want the ad hoc to do with this?
Okay, Supervisor Brown.
Let the others go ahead. I'll wait.
Well,
I'll defer.
Okay, we've heard a lot from the three of us, so.
Mr. Chair, could we get a restatement of the motion as it currently stands? There's a little bit of confusion on this side.
Okay, good. Deputy Clerk, could you restate what your understanding is?
Oh, no, not from me, Chair Haschak. We need a clean restatement of the motion for the record, please.
Okay,
certainly.
Supervisor McCowan.
I move that we authorize staff to pursue the implications of cannabis as an agricultural activity, and that we pause items 1, 2, and 4 as identified in the summary of request, and that we only refer permit renewals to CDFW under the interagency agreement.
Second.
And I mean, if that's not acceptable, I'll take another stab at it.
I've got it, Supervisor McCowan. Thank you.
So to clarify that, we would be continuing our discussions with CDFW to solidify the contract, because we would have work for them to do.
Correct.
Okay.
The intent of it is that you would pursue the contract, and once solidified, once agreed to, permit renewals only would be referred to them.
Okay. So any further comments?
And I just had one point of information, if I may, Mr. Chair. So I think I'm hearing that we approved 190 permits without sensitive species review, and that's out of approximately 250 permits that we approved total.
That's
that
about
accurate?
right. Yes, that's my understanding.
Thank you.
Okay, so if no more comment, we will go to Deputy Clerk. Could you conduct a roll call vote?
Of course. Supervisor Jurdy?
Yes.
Supervisor Brown?
I'm going to vote no. I didn't get my final comment.
Could you go?
I really want to hear Supervisor Brown's comment, Bruce, no matter how she votes.
So do I. Supervisor Brown, could you comment?
Let's do it after the roll call vote.
Supervisor McCowan?
Yes.
Chair Hashtag?
Yes.
And Supervisor Williams?
Yes.
The motion carries with Supervisor Brown dissenting.
Okay, Supervisor Brown.
I just really feel the redefining of what is defined at a state level as an agricultural product, and we're looking at a local level if redefining it as an agricultural activity is going to cause us more problems. I've dealt a lot with CDFA. I've dealt a lot with agricultural on the federal level. I think we're going to have some real problems if we just go forward. So thank you.
Okay. So
Chair
it's
Hashtag.
certainly late. Yeah, Supervisor.
Just briefly, for clarification, I thought my understanding of the motion was that staff is going to look into the issues around reclassifying it. I don't. My understanding was that we're not actually doing that today. We're looking for more information.
That's right. We're looking at if we classified it as sort of a field and row crop, and field and row crops are allowed on certain zoning types. Maybe we can issue a notice of exemption and have a review over. But it's only to look at this as a possibility and research what's possible. We're not putting anything else in place, but back research.
But I would like to also add, this is Supervisor Brown, there was not a lot of information pertaining to that definition in the agenda item. So I'm giving you my opinion, and it stands.
Okay, very much. We very much appreciate it. And certainly we don't have the information. That's why Supervisor Williams and I were trying to get it, but we couldn't. So hopefully soon we will have more. So we have two more agenda items. People who've been waiting around, is there, it's 6:22. So does anyone have an idea how to deal with this, or are we calling the 5:30 rule?
Mr. Chair, at our last, if I may, at our last meeting, I believe 3 supervisors voiced interest in a special meeting, given the number of agenda items, the amount of critical county business that isn't getting dealt with. Do we want to consider adding another meeting?
Well, I checked with the clerk of the board, and we thought we could get it done in these 2 meetings. So, do we want to continue on the meeting tonight?
Chair Hashtag, this is CEO Angelo. We do have Howard Dashiell waiting to do his item, and we do have Barbara Moad. They have been patiently waiting all afternoon. So if the board could continue, we may be able to get through these items quickly.
Okay, if it's all right with the board.
I'm certainly willing to continue.
Okay, very good. So we'll move on to item 5J, discussion and possible action, including direction regarding various solid waste matters. Sponsor is Department of Transportation, so Howard DeShiel.
Good evening, Mr. Chair, ladies and gentlemen of the board. Howard DeShiel, your Director of Transportation. The item before you is broken down into 4 bullets. The first bullet deals with direction on moving ahead with an extension of franchise area 2 curbside solid waste service, includes the Fort Bragg area and the greater Ukiah Valley area. This agreement expires June 30th of 2021. We understand that the city of Fort Bragg, whose agreement also expires June 30th, will at their December 14th meeting entertain a recommendation to actually enter into negotiations for an extension. What I'm looking for from the board is support to send a letter as soon as the city of Fort Bragg takes their action to mirror and concurrently do the same thing. I think there is a benefit in moving together on that negotiation. And of course, the board would have a final say on anything we would negotiate. As far as an extension, they could refuse to approve it and send us to do something else. So our goal would be to do this quickly in 2021, bring something precise back to the board as soon as we could. I'll just keep going through the items unless there's questions along the way.
I'll go ahead.
Okay. Continue then. The other 3 bullets deal with the Casper transfer station, which is our self-haul facility. I need to send a letter to Solid Waste of Willits to exercise an extension provision. I need to do that before the first of the year, and I intend to do that. That will need to have detail and confirmation brought back to the board early in 2021 and before June 30th, 2021. Leading into bullet number 3, I do know that the operator there feels that Solid Waste of Willits, that there are certain commitments and needs to address outdated transfer systems, and that there is probably going to be a counter proposal or to this request to extend. And that will probably involve, if we will not make or somehow design a funding mechanism to make those improvements, it will probably mean some kind of rate adjustment to cover the additional inefficiency of that system. Again, we can get into the details of that when I actually bring the extension resolution to the board. A similar extension resolution will have to go to the city of Fort Bragg, but I need to send the letter by the first of the year to indicate to Solid Waste of Willits we intend to extend. And lastly, and kind of tied in with all of this, is, and it ties in because there has been a proposal and actually a portion of the self-haul tipping fee at Casper, which has gone into a fund to promote and establish a Central Coast transfer station, a new transfer station. That fund has accumulated some $200,000. It is the recommendation of the Joint Coordinating Committee for Casper that we use some of those funds to hire the retired city engineer, Tom Varga, to become the project manager for that. And of course, those funds are controlled by both the county and the city. So, you know, it is my intention to move ahead with hiring Mr. Varga as a project manager and using the funds from that account. So those are my items, and I'll entertain questions.
All right, any questions from the board? Okay,
Mr. Chair?
Yes, Supervisor Brown.
I believe that 3 of those items will be easy for the board. And we have one item that I feel, and that's the first one mentioned, franchise area 2, contract extension, and that's under the summary of request. So we can go to public comment or comment from our coordinating committee with the Casper transfer station to have comments, but I think those 3 will be much easier to go forward on than the first item.
Okay, any other comments from the board? Hearing none.
Chair Haschek.
Supervisor McCowan.
Well, I agree generally with Supervisor Brown. I do think there's a real question with the Casper transfer station improvements. I think we have a estimate of 400,000 to move forward, and then of course the question who pays. But I'm willing to see that be an item of negotiation, and I would expect that the Casper Coordinating Committee with our coastal supervisors and 2 of their counterparts from Fort Bragg City Council can probably wrestle with that issue and bring back recommendations. So with that explanation to myself, I think I agree completely with Supervisor Brown. I find item number 1 on this list to be extremely problematical. I will not be able to support a lengthy extension for the current franchise operator.
Okay, any other comments from the board before we go to public expression?
Yeah, one question for the board. It would help me in my role on the committee, which actually seems to may actually be a JPA with Fort Bragg, to understand, does the county support us working on a plan for a coast transfer station? And because this has an impact on what sort of improvements, how much we want to spend on Casper, how temporary is it? And I've since I've been on the board, we've never had an open discussion about, does the county support the coast building out a new transfer station?
Chair Haschek.
Yeah, Supervisor McCowan.
Well, I fully support a new coast transfer station. However, as pointed out by some of the attachments to this item, that's been delayed for years. It's currently uncertain if a site will be identified, and then will the city and county still be willing to go forward? We'll have pretty much a completely new complement of council members and supervisors. So I think we have to do something in the interim, and I do support doing that. I think the current operation, based on changes that have occurred, that I don't think were up to the current operator. You know, there were changes in the way that material is transferred that I think were simply the current operator had to accept, and has been eating the cost based on the assumption that this was an interim solution. Well, it's an interim solution that will likely drag on for some additional years. So I think it makes sense to work out an equitable agreement to pay for the improvements, probably using ratepayer money to do it is warranted. We just need to make sure that we're holding on to enough money to pay for the expenses to reevaluate and potentially restart the transfer station process. I hope that adds a little clarity, at least from one point of view.
And last question, is there any history on how the funds that were collected and set aside, were those earmarked for a specific purpose, like a new transfer station, or can they be used for any expenditure at this point?
Mr. Chair, if
Howard?
I could, through the chair, right now, the direction from both the board and the council is those funds, I'm talking the $3 a yard rent, has to go to development of the Central Coast Transfer Station. So if they were redirected, it would have to be done by agreement of both the county and the city.
Okay, any further comment? Okay, is there any public expression?
Yes, Chair Haschak, we do have Jerry Ward on the line to speak on this item.
Okay, very good.
Good afternoon. Thank you, Chair Haschak and Board of Supervisors. I guess part of the questions that I have is if we are going to use the money for a project manager and some of those funds, there's not going to be enough really to do the improvements. I'm not interested in doing the improvements on my nickel. It would have to be a rate adjustment at the gate for that. And if you're looking at doing it through a gate increase, you're looking at $3 to $4 a cubic yard. Obviously, the 409 group over there in Fort Bragg wishes for me not to do any improvements over there because they feel that that's just going to enhance a long-haul facility out of that particular location in the future. So without any kind of funding, either through a gate increase or through the $3 cubic yard, I'm really not interested in extending the contract for the Casper Transfer Station. First of all, we don't know how much longer I'm going to have to do this. I don't think there will be a transfer station, coastal transfer station built. It's way overdue. We don't even know the cost yet. So if the board wishes for me to continue operations at Casper without the improvements, and I have to continue with an inefficient system, I need at least 87 cents to 90 cents more a yard to cover the costs that I've been hauling out of there since Empire Waste Management pulled out. So if this all needs to be done through negotiations with the Transportation Department, so be it. But those are some of my concerns. I'm not interested in continuing operation that continues to lose money, and it's something that should have been built years ago. So that's all my comments, Mr. Chair.
Okay, thank you, Mr. Ward. Okay, any further public comments? Okay, back to the board.
Chair Haschak.
Yeah, hold it. Supervisor Jurdy.
Yeah, I just wanted to reiterate that items 2 through 4, I think that, the ad hoc joint powers agreement with the city, the Supervisor Williams, myself, we're working with county staff and the city and others to get information at this point. So we're still in the information gathering, and we hope to cooperatively bring back some recommendations.
Okay, Supervisor McCowan.
Well, clarification. I thought I heard Mr. Ward say that he doesn't necessarily support the expensive improvements, which would not be welcomed by the Road 409 neighborhood, but instead supports a gate increase to cover his additional costs of the current inefficient system. And if that's accurate, I mean, I'd appreciate hearing that. But then I'm certainly willing to leave it up to the ad hoc to work with their counterparts on what is the best approach.
Okay, it seemed like that was an accurate summary of what Mr. Ward said. So, so where do we go with this?
Mr. Chair?
Yes, Supervisor Brown.
Thank you. I think the coordinating committee needs to address that ASAP because Mr. Ward is a business. He cannot be losing financially, and he stepped in when others stepped out. So, I would recommend this happen very quickly, and whether it's an increase in rates to cover the shortage he is feeling and no improvements, and to go forward as quickly as possible with looking for a new place for the transfer station. location.
And one more point, we have a written comment as an attachment from a member of the public, and it sounds like we're no longer accepting roofing material at the Casper transfer station. It's then having to be trucked by the public to Willits. And so hopefully that issue could be addressed in whatever approach goes forward. But again, that'll be for the coordinating committee to wrestle with. But it certainly is not a good practice to have that classification of material have to go all the way to Willits, truckload at a time. Thank you.
Okay, so Supervisor Brown, was that the direction to the Department of Transportation and to the
well, I believe the Department of Transportation's hands are tied because we have a coordinating committee, which consists of 2 county supervisors and I believe 2 city council persons from the city of Fort Bragg. We just need to get this resolved and to move forward. And Mr. Ward and Solid Waste of Willits should not be losing financially when they stepped in to take over an operation, and they should not be held responsible to do all these improvements.
Okay, I could agree to that. So let's see, Howard DeShiel.
Yes,
what kind of,
Mr. Chair,
you have enough?
Ladies and gentlemen of the board, I think I've got all the direction I need on the last 3 bullets. I think I understand, you know, how I can proceed.
Okay, very good.
So you have one we don't know.
You have what you need.
Except for the first bullet, yes.
Yeah. And is the first bullet something that we'll talk about next week?
It isn't scheduled at this point. It's basically, you know, do I have the direction to do what I'm asking for, which is to try to concurrently follow the lead of the city of Fort Bragg in either extending the waste management contract, of course, bringing that back to the board for their full, you know, vote and decision, because that's the direction I'll head in based on what city council does on Monday the 14th.
Chair Haschek.
Yes, Supervisor McCowan.
For many reasons, I do not support a 5-year contract extension. I think recent events over the last couple of years have made clear that it's not in the public interest to simply roll over this contract, but instead, I believe the board should be looking at putting this out for an RFP to see what other entities may be interested in bidding on this service. I believe there's at least one that would be interested, and I think it would be in the public interest to find out what else is out there, because the current franchisee, I think, has been engaging in some rather questionable practices. The retroactive fee increase, the questionable charges for overage. So I absolutely do not support the recommendation for the first item. I would support a 6-month contract extension to see us through an RFP period.
Okay, any further comments from the board on that?
Mr. Chair?
I support what Supervisor McCowan just said, and I would add, I would like to recommend that we request the waste company reconsider that retroactive billing at a time when we have so many people struggling, sheltering from COVID, so many out of work. It's not the right time to be increasing fees, certainly not retroactively.
Okay, Supervisor Brown.
I agree with both Supervisor McCowan and Supervisor Williams.
All right. Supervisor Jurdy.
I agree with the comments so far. It would probably be helpful, though, if we had a further discussion about, what we have in our hands is a contract for the area outside of the city of Fort Bragg. The city council has in its hands the contract for the city limits, which is probably the more profitable section just because it is, houses are so close together compared to the county. So there's less driving around to do curbside pickup. What we do also have is a contract for the transfer stations on the coast, and Albion and Casper. Maybe we have another, I don't know if we have another South Coast contract, but I know there's been some question about, is the county's contract outside Fort Bragg city limits big enough to attract competitive bidding, or would we need to consolidate other contracts into one bigger contract in order to get the attention of other bidders? So I tend to think we would need to have a bigger prize for people to be bidding on than just the contract outside of Fort Bragg city limits.
All right.
Well, to clarify, franchise area 2 is the contracts outside of Fort Bragg, but also the contracts in the greater Ukiah area for the unincorporated. So, outskirts of Ukiah, Redwood Valley, and other areas are all part of franchise area number 2. And I think that was done specifically to benefit the unincorporated coastal area, and for the reasons that you stated. It creates a bigger pie that would make it worthwhile for someone to bid on it.
Okay, and I agree with what's been said about we should really look at that retroactive, try to get the company to review that and to see if we can undo that, because that's it just doesn't seem fair to a lot of people. And if we could go for a 6-month contract with an RFP, that would be great.
And Mr. Chair, I would like to recommend that a letter be written from the County of Mendocino with your signature, asking Waste Management those very questions. I'm also very concerned going through COVID, many families financially stressed. And there's other issues that I'm trying to get answered as well about the time we're in and what Waste Management is doing. And they may be a corporation out of Arizona, but I know there's been issues up and down the state with cities and counties with this company. I just think it's important we stand up for our constituents and those retroactive charges that this provider has charged. I would like to recommend you write a letter.
Okay, are we all good with that?
Well, Mr. Chair, Howard DeShieldian, Director of Transportation, the Waste Management has already said unequivocally that their shortest extension would be 5 years. In fact, the city of Fort Bragg knows that as well, because their recommendation from their ad hoc will be to negotiate a 5, 10, or 15-year extension, but they can't be less than 5. So if we're not going, you can ask them for an extension beyond that, and they might do something shorter with the existing contract if we were in active negotiations in June, if we came to the end, but they're not going to just agree to a negotiated shorter term than 5 years.
Mr. Chair?
Yes, Supervisor Brown.
That certainly concerns me, but that's the bully that they are as a business, 5 years. I don't know what to say about that. My time is short on the Board of Supervisors. I really don't know what to say. But on the other hand, I'm really upset with the business and how they build their customers and have billed, and all their requirements. You call the local offices, they can't talk to you. You got to call Phoenix, Arizona. So I don't know where to go from here, but Mr. DeShield is correct, 5 years. So I'd like to hear from my colleagues.
I stand by my earlier comments.
Okay, anyone else?
I also stand by McKellen's earlier comments.
So the question becomes, if we don't direct a 5-year extension, what are we going to do if they pull out for these unincorporated areas under franchise area 2?
Supervisor Jurdy.
I think if we want to put this out to bid, we are better off directing staff to proceed immediately with it. We can always get obviously additional information at later meetings, but I think staff needs to start proceeding with the bidding process, and we'll just get more information in a later meeting.
Excellent suggestion.
Okay.
I fully support that.
Director DeShield, does that work for you?
If what I'm hearing is that it's the direction of the board to pursue bidding, we will march ahead with that as quickly as possible.
Yes. Okay. Very good. So have we completed all that you need?
Yes, thank you.
Okay, thank you. So, moving on to item 7A, discussion and possible action, including presentation regarding the Mendocino County Air Quality Management District's 2020 annual report, and update on implementation of May 2019 Directive to Air Pollution Control Officer, and overview of Air District and pellet mill history. Okay, sponsor is Air Quality Management District, and Barbara Moen. Are you on the line?
I am just trying to, yeah, there I am.
Thank you for being here, and sorry about the delay.
Yeah, well, good evening. District Board, CEO Angelo, and I assume County Council Curtis is still there. I'd like to just give you an outline of a brief presentation. 2020 has been a challenging year for the Air District. Of course, we're all dealing with COVID emergency. In addition to that, here at the district, we're running a 33% vacancy rate. My program manager retired in April. And we have had an ongoing request to a Public Records Request Act, which has there's a huge volume of materials. Trade secret protection requests have been very time consuming for my staff. And so it's been a challenging year for a number of reasons. And then I also would like to, I'll bring you I'll present some statistics about district activities on my next slide, on a slide in a moment. I also want to just inform the board about the responses that the district and myself have taken to the board's directive to work with fire agencies and community partners to identify barriers to vegetation management projects and to streamline air quality processes that support vegetation management, including investigating feasibility of implementing unified application and payment models for burn permitting. And then I also submitted with my agenda item a memorandum, which is which basically gives a very brief overview of what air districts do and the pellet mill history. And I also uploaded a health risk assessment. And these documents are actually direct responses to the public controversy that has been created over the Forest Energy and Mendocino Forest Products wood pellet mill in Calpella. The district would like the public as well as the district board to have the facts about the facility, the district's regulatory actions taken to bring it into compliance while protecting public health. And then I also would like the board to know that that the district is reviewing its regulations. And I'm excited about this. I think it's overdue. And as you might guess, Regulation 2, our open burning regulation, has been the first regulation that we have gone through. And, this is too many items really for one meeting with a 20-minute limit. But so just to say that we would like to bring forward a white paper entitled Legal Basis for Burning in the first quarter of 2021. And along with that, we have some recommendations for how to redline our open burning regulation going forward. Okay, so I'd like to praise my district staff for accomplishing what they have accomplished this year. And let me see if I can share my screen here. I just have some quick statistics to pop up there. Here we go. Yeah, so just to give you an idea of the kinds of activities we do on a regular basis, we issue authority to construct permits for either new facilities or modifications to existing facilities. We roll over about, as you can see, 450 or so permits to operate on an annual basis. In 2019 and 2020, you can see the number of burn permits we issued. Smoke management plans, we've typically got, well, in 2019, we had, 83 active. At 2019, I'm sure we've had more than that. We have more than that active. We also review asbestos renovation and demolition notifications. And that's because we are delegated by the US EPA to enforce their asbestos national emission standard for hazardous air pollutants. So yeah, we get over 100 of those a year, and we work with the building departments on those. As you can see, our number of inspections was very much lower in 2020 because of COVID. You can also see the number of complaints and investigations we typically get and investigate on an annual basis. Our notice of violations are actually, a bit down this year because we obviously haven't been around, inspecting facilities like we typically do, out of concern for staff's health. And then, yes, you can see how many public records requests we typically get. Okay. So regarding the board's directive about vegetation management projects and exploring the possibility of a unified burn permitting application and payment model. So the district staff has provided presentations to land management burn symposiums in 2018 and 2019. Basically, the content has been on advice on how to reduce smoke impacts and applying for and implementing smoke management plans. We have met with the ad hoc regarding the proposal to use a district database as a tool for implementing unified application and payment models for burn permitting. The ad hoc had requested a meeting with CAL FIRE, which is pending. Current Chief Gonzalez has indicated a willingness to explore this possibility with us. However, I will say that given the legal basis for burning paper, which we completed almost a year ago, it's important that we bring that forward. And I suggest, or what makes sense to me, is to postpone the meeting, the ad hoc meeting with CAL FIRE and us, until after the legal basis for burning paper has been discussed and stakeholder workshops have been held. Because we expect some changes to be made, let me put it that way, regarding burn permitting. And then the district hosted an interagency prescribed fire program training in January 2020 with fire and forestry personnel, land managers, owners, nearby air district staff on use of a statewide online prescribed fire incident reporting system called PFERS. And this database allows land managers, fire agencies, and air district staff to submit, review, and approve smoke management plans, coordinate burn ignition requests and approvals. And then we also recently began emailing ignition requests and approvals so that district staff can communicate with burners remotely and after hours, which we were not previously able to do. In other words, we don't have to be in the office to have these communications. We can have them off hours and on the weekends. Also, the district staff has implemented an online burn permit application and payment system through our database. And the advantage of this is that customers don't have to come to our office. They can pay online and they can print their burn permit at home on their own schedules. In addition to that, we have had PM 2.5 portable monitors deployed around the county to capture, measure air impacts from smoke impacts from prescribed burns in Ukiah Valley, Laytonville, Covelo, Cloverdale, Yorkville, and Philo. Let's see. So at this point, well, I guess I should ask: would you prefer to ask questions on that topic at this time, or shall I just proceed through my presentation on all my topics and hold questions for the end, or comments? Or...
Well, let's see if there's any questions. Are there any questions out there so far?
Were there any findings from those PM25 measurements from around the county that we should be aware of?
Well, the goal of that work is to document, to try to determine whether smoke impacts to the population are lower over a long number of prescribed burns compared with what smoke exposures are from wildfires. Okay, so as you might, there are, yes, we have measured impacts. But I think that, in the bigger picture, compared to prescribed burns versus wildfires, I think we're in the process of likely documenting that smoke impacts from prescribed burns are lower than wildfires. And, that's really, I think, a major impetus for this prescribed fire grant program it's actually being run jointly, or I should say the legislature gave money both to CAL FIRE and the Air Resources Board, channeled through the air districts to collect this data, which they will eventually model and, issue a report on, which I suspect will conclude what I just said, that basically smoke impacts from multiple prescribed burns are lower in the long run than wildfires. Yes.
Barbara, this summer again, we had a situation with the wildfires where even on the coast in Fort Bragg, there was just this, really dark cloud over the town. And it was, at one point I was on Main Street and you could see the smoke coming back from the ocean back into town near Noyo Harbor. And I'm just wondering, did you say that there is or is not a county air district air monitor in the Fort Bragg area?
So what we have in the Fort Bragg area is a PM10 monitor. We want to supplement that with a PM 2.5 monitor. And we've been, seeking grant money to do that. I think that having PM 2.5 data available for the coast in Fort Bragg would, not only inform us better about what residents of Fort Bragg are exposed to, from not only wildfire, but also wood stoves and fireplaces, which is a piece of data, that we don't really have right now and that I believe is important. So, did that answer your question?
Well, it sounds like we don't currently have the air.
Right, we don't.
And I just want to make sure that everybody's aware. Ted's certainly aware that we've had from these wildfires, major air pollution for a few days at a time, and I think it does, as it does anywhere. It kind of freaks people out because you certainly don't expect it on the coast when the fire is a couple counties over.
Yeah. So we, in specifically in response to wildfires, we did deploy a portable PM 2.5 monitor at the airport, the Little River Airport. And so we did get data at that time related to the wildfires. And actually, that data was really important to have for the modeling of smoke impacts, the forecasting, of what was expected in terms of air impacts, over the next few days. So yes, but we did, but that was just a temporary, it was in response to the wildfires. And, I believe we still have that monitor out there. Yes, we do. So there you go. We have one now, but it's a portable monitor at the airport. And, it's not adjacent to our PM10 monitor that's on the roof of the high school in Fort Bragg. So yes, so currently we do.
Okay, are there any further questions? Okay.
Moving on?
Yeah.
Okay. All right. So now I'd like to turn to the submittals that are, I'm going to say, I submitted them in response to the public controversy about the pellet mill. And one of the things I noticed that the public and perhaps even the board, I'm not sure, needed to be informed about what an air district does and how it works. And And so I just want to say that a few things. An air district is a form of local government whose mission is to implement district, state, and federal air quality regulations pertaining to stationary sources of ambient air emissions. We are governed, as you folks know, by a board of elected officials, and you are that board in the case of Mendocino County. The Air District issues authority to construct permits prior to construction, modification, operation, or use of stationary, portable, indirect source, or large grading operations, which may cause, reduce, control, or eliminate emissions of air contaminants. We also issue permits to operate, or I should say, authority to construct permits roll over into permits to operate on an ongoing basis, assuming facilities are paying their bills and working in or working towards compliance. The pollutants of concern are referred to as criteria pollutants, and those would be particulate matter 2.5, particulate matter 10, ozone, carbon monoxide, nitrous oxides, sulfur oxides, and lead. And then there's also another group of contaminants that are referred to as hazardous air pollutants or toxic air contaminants. That's the state of California's terminology. HAPS, hazardous air, is a federal terminology. And HAPS and TACs are typically, because they either contribute to cancer or do cause cancer, they are considered more important than criteria pollutants, typically. And the district is responsible for ensuring compliance with the regulations and permit conditions. So, regarding enforcement actions, it is prescribed in statute that the Air Pollution Control Officer oversees most enforcement actions, while the district hearing board has remaining enforcement responsibilities. And, I know that it's clear that the public does not understand this. And so I just really wanted to put this out there for public knowledge. Because I know my understanding is that the directors have been receiving emails and calls about the pellet mill. So the hearing board hears requests for variances, abatement actions, and appeals to permit conditions made by the district. The hearing board issues formal decisions, which, are final unless challenged in court. So the current regulatory status of the pellet mill is as follows. Emissions testing demonstrated compliance with air quality limits, permit limits in late August 2020, after it demonstrated compliance with air quality permit limits in November 2019. There are currently no violations, and there is currently no basis for enforcement against the facility. And also, we had a health risk assessment done, which found very low cancer and non-cancer risks from toxic air contaminants generated by the processes done at this facility. In other words, basically what they do is they take clean waste from sawmills and turn that into wood pellets for fuel without adding any additives or adhesives. So, okay, so the health risk assessment, which I uploaded so that the public as well as the district board can see the document itself. It was conducted using California Office of Environmental Health Hazard Assessment Guidelines. It used California Air Resources Board's Air Toxics Hotspots Analysis and Reporting Program. It used this software to calculate health risks. A health risk consists of 3 steps, basically. Step 1 is hazard identification to determine the pollutants of concern associated with, in this case, the activities at the Forest Energy Mendocino Forest Products wood pellet mill. The second step is exposure assessment to quantify site-generated toxic air emissions. They use air dispersion modeling to identify concentrations of toxic air contaminants at ground level receptors that may be affected. And in this report, specifically, in addition to a regular grid of receptors, Cal Pello Elementary School, Waldorf School, Consolidated Tribal Health Center, and the nearest residents to the north and west of the pellet mill boundary were specifically identified as potential receptors. And then the third step is risk characterization to estimate potential health risks from calculated exposures. Okay. So the key thing here is, well, a little bit more. Well, you know what, I'll just, I think, well, I'll give you a little bit more. The air dispersion modeling used the scrubber, baghouse, and diesel-fueled vehicles as sources of emissions, and it yielded ground-level concentrations for 25 toxic air contaminants expected from the facility's processes, specifically from the processes at the wood pellet mill. It calculated cancer and non-cancer risks for 25 toxic air contaminants plus diesel. And the conclusion basically was that all calculated health risks are below neighbor notification thresholds and risk reduction thresholds. So I guess that I want to say that this report should alleviate concerns about health risks to the surrounding area from the pellet mill. My professional opinion.
Hey, Barbara, I have a question that has been brought up to me by several people about when we had the smoke from the wildfires and then this COVID pandemic that we're dealing with. And then added to that, this risk, which might be below the threshold in and of itself, but with others contributing, would that raise it to a level of real concern?
No, in my opinion, no. And I say that based on looking at our air monitors. I mean, you could see the impact from the wildfire smoke overwhelmed. It's so overwhelmed any point source that. In other words, I guess what I want to say is it would not have changed if the AQI was hazardous. Having the pellet mill shut down, which of course, if they're in, first of all, if they're in compliance, I don't have the authority to shut them down. Let's be clear about that. They would have to volunteer to do that. Okay. So, yeah.
Are there any other questions?
Is there a chart? Maybe we could share with the public a chart of the pellet mill running versus not running it on air quality readings. Would it look the same?
I can explore ways to show that. At this moment, I'm not quite sure how to best do that. But again, I mean, well, I'll explore ways to see if I can, yeah.
Thanks for all the information. Great presentation. I don't have any further questions.
Thank you, Supervisor.
Supervisor
Director.
Thank you. And thank you for your presentation, Barbara. I think to people willing to consider data and be fair-minded, it should go a long way to assure people. But I think the conclusion of the health risk assessment is that the plant, based on all of the modeling, it poses no public health risk, and the emissions levels are so low that it doesn't even warrant public notification.
That's correct.
Is that accurate?
Yes, it is. In our, actually, let me just, yeah, in our county, we use a threshold of 10 times 10 to the minus 6 cancer risk, as that would require a facility to notify its neighbors about their emissions. And let me see here, in this case, I think we had like, I don't want to misquote it, one second here. I think it was like 2.1 in a million was the inhalation cancer risk calculated, compared with 10 in a million for neighbor notification and 100 in a million for risk reduction. So that is an extremely low number.
So what, roughly, if you could, what percentage of the notification level is this plant operating at?
So,
or is that a number you can,
yeah,
that is relevant?
Yeah, so basically it is operating at 20% of the level that would require, well, that's not exactly the right terminology. Let me rephrase that. The calculated cancer risk from the facility is 20% of the cancer risk that would require neighbor notification of the emissions. And it is 2% of the cancer risk that would trigger risk reduction activities.
Right. So it's it sounds like the risk of this plant is extremely minimal.
It is very low. Yes, it is. It is very low.
And then, in addition to the pellet mill itself, which I think you pointed out, it uses clean wood waste with no additives, no additional chemicals added into the mix. It's simply the clean wood waste that is then processed and then squeezed into these pellets. So the emissions would come from small particulate matter, and including the source of fuel that is being used to operate the plant. I think it's 10 truck round trips and a loader that moves the chips around. Those are the sources of emission on this site. And I want to contrast that.
Yes.
We have the intersection of US 101 and Highway 20, probably within a couple hundred feet of the plant, or say 300 feet maybe. I'm not sure of the scale.
Yes,
but do you have any idea the magnitude of the emissions of US Highway 101 and Highway 20 compared to the 10 truck trips a day at this plant?
I don't have that comparison offhand.
Wouldn't it be, just by logic, it seems to me it'd be considerably more emissions from the highway traffic.
Yes, that is my educated supposition as well.
Yeah, thank you. And it's unfortunate, you know, I think you were prepared to make this presentation quite a bit earlier, and also the the authorization for burning that you talked about that was presented to County Council in January, so that'll come forward in the new year.
Yes.
But there was also the issue of the very extensive Public Record Acts requests that were made, and I'm sure the sheer volume of those took quite a while to compile, but what was the process for the PRAs? Do they come to you and you're an independent district and then you process and respond to them, or are they referred to County Council? And now that you have your own district council, is that still the process?
So the Public Records Act request for the pellet mill was submitted to the county. And, you know, as you know, county planning and building, in addition to the air district, had records, emails, and so forth. And so county council's office, they worked with IS to go get emails. The air district certainly, you know, another aspect of all that record, and we're still doing public records. We're still processing emails, which we have to redact to protect trade secrets for the operator. We're still working on that, the email portion of it, almost a year later. I mean, the volume has been overwhelming. We have over 1,000 emails, and just emails, and six source tests. We had 24 or 25 months of daily records from the plant, which we had them provide us as indicators of compliance while they were operating until they demonstrated compliance, let me put it that way. And so we continue producing records.
Well, thank you, Barbara. And I do want to thank you for your diligence from the beginning of this process in overseeing the project, making sure the company came into compliance, reducing their production level to keep them within permit limits until they were able to get the new equipment installed and approved that it actually met the limits that were allowed. I think it's unfortunate that the public has only heard the inflammatory comments that have been posted in social media or sent out to the press, and didn't have an opportunity to hear your detailed explanation of the process. And I hope that anyone interested in the history of the pellet mill will look at item 7A on today's agenda, look at the documentation that is provided. And I have to say, a lot of the figures in the health risk assessment, I did not really understand. I don't have the background for that, but I could understand the conclusions that have been reached that you have detailed for us in your staff memo, your annual report, and your comments today. Thank you very much.
You are welcome, and thank you, John.
Okay, are there any other questions? Let's go to Supervisor Brown.
Oh, someone else was going to speak. Let them go ahead.
No, I think you're.
Oh, I just want to thank our air pollution control officer. You've been really on this. I've worked with you over the issues for several years with the pellet mill, in concern for constituents as well. But I think all the right questions have been asked. I appreciate what you brought forth in your annual report, and being able to explain it all. It's unfortunate that individuals want to do what they want to do no matter what. And of course, as county supervisors, we receive all those calls.
Yes.
But I think you've done an outstanding job. You have a very small staff. The PRAs have been extensive. But I congratulate you for doing what you're doing on behalf of the Board of Directors for the Air Quality Management District. Thank you.
You're welcome.
All right. Are there any public comments? Deputy Clerk?
No, there are no public comments for this, or public comment requests for this item.
Okay, so we'll bring it back to the board. Okay, so we have a recommended action, which is, does anyone want to, well, we can receive the presentation, which was very well delivered, and receive the overview of the Air District and pellet mill history, and direct staff to bring legal basis for burning paper to the board in the first quarter of 2021. So are we in agreement to bring that, or to make that direction?
Yeah. I agree, sir.
Okay, are we all good with that?
Yes.
Okay, so we're providing that direction to staff to bring the legal basis for burning paper to the board in the first quarter of 2021. Very good.
Thank you.
All right, thank you, Ms. Moed, very much. Okay, all right. Thank you for hanging there with us.
No problem.
So we're on to 5K. It's 7:30. Does anyone want to call the 5:30 rule?
I will do so, sir.
All right, so we will leave off 5K, 5L, and 6A. Okay, and so it's 7:30.
Those items, why don't you mention them for public process?
What was that?
So you're saying we're vacating a number of items on the agenda. I think it's important to the public to know what those items are.
Okay, so 5K was the CEO's report. 5L is the legislative platform item. 6A is the supervisor's report.
Sounds good to me.
Thank you. So at 7:31, we'll adjourn the meeting. Thank you, everyone, for hanging in there. Right.